He joined the commission in 2013 and became a regular member in 2015 and has made very valuable contributions, particularly with the insight from his background as an engineer and in construction and development. We're going to miss Andy's contribution, but we know that he is very time constrained and therefore just can't make the commitment anymore. So with that, thank you, Andy, from all of us. And we welcome you to your last night. And we'll begin. Our first application is a discussion item, 1A. It is being filed as a pre-application review. For those of you in the public who are not aware, fundamentally, it's an opportunity for us to review the overall strategy and whether an application strikes the balance that we wish to find for the development in the town. This application is for Greenwich Hospital. It is both for a text amendment, rezoning, and a site plan at 1630 through 38 Lake Avenue and 54 to 64 Lafayette Place. We've discussed it once before in February, back in the in-person days. And with that, would you please proceed?
Thank you, Madam Chair, members of the commission. For the record, Tom Hegney on behalf of the applicant. We were in front of you on February 25th. I'm not sure that was the last meeting that we all met in person, but it was pretty—
March sometime. I think we had a March meeting, maybe?
I think you're right. And at that meeting, there were a number of questions that came up regarding need for the community, need of these particular services, what are the benefits for the town residents. So in the interim, where the hospital has been extremely busy and continues to be so, dealing with the pandemic, we looked at the services which are needed. We looked at the utilization of the Benheim building, which was one of the big questions the commission had. What were we going to do with that building if that was not going to be the cancer center? And we were looking also at the plan of conservation development that you approved last year. And well, of course, it starts out with what our strengths are as a town, and says providing access to quality healthcare and top-ranked physicians is one of our strengths. And Greenwich Hospital leads the way in meeting that strength for our town. The focus of the prior POCDs really hadn't been on healthcare at all. In fact, I think this is the first POCD that actually does have a section devoted to healthcare as part of its goals and guiding principles. And one of the guiding principles is to provide best quality health services. The objectives are to support efforts by emergency services, Greenwich Hospital, and local healthcare organizations to provide top services to Greenwich residents. And also in section 6-3, work with various healthcare entities to identify significant longer-term means of supporting their land use needs. And that's really what brings us here this evening and brought us to you in February. What services do the town residents need? How does the hospital remain viable and maintain its edge as providing superior health care to town residents? What we have before you this evening is a new oncology center to provide services to the community and surrounding communities. We believe this facility addresses the objectives and goals that have been enumerated in the Plan of Conservation Development. I'd now like to ask Diane Kelly, who's president of the hospital, to address some of the questions you had at the briefing yesterday, and to take you through the first part of our presentation to address many of the issues that you raised back in February. Diane?
Thank you very much, Tom, and good evening, everyone, and thank you for giving us this opportunity. If I could just ask for the presentation to be shown.
It just takes 1 second, don't worry.
That's perfectly fine. It's perfectly fine. I feel like I live on Zoom. I've now become very comfortable staring at myself in front of the computer.
Do you even notice anymore? I don't even see myself anymore.
No, you know, I don't. In fact, after the initial shock of when did I age 10 years, because whoever looks at themselves this much.
When you had your kids at home.
That's right. So anyway, so thank you everyone very much. And as Tom had talked about, you know, I'm going to go through a really brief presentation to bring us back to how we got to this place. And hopefully I'll be able to answer some of the questions that were submitted the other night. But please know if I haven't answered them clearly, or, you know, just, you know, feel free to stop, ask questions. My goal here is that we have a really good understanding of what it is that we're trying to accomplish here at Greenwich Hospital in working with the town of Greenwich. If you could go just to the next slide, and you can just go right ahead to the next. You can look at that for 2 seconds, but go right ahead to the next, because we'll talk a lot about that a little bit later. But what we've been doing in the midst of taking care of people during a pandemic, we actually had not taken this off the plate, because at the time we were absolutely taking care of patients and rearranging a lot of what we did during this COVID, and here we are again. We recognized we couldn't really step away from this, because what was interesting during COVID is the oncology cancer patients was the one population that was not, I don't want to say they weren't impacted, but we did not reduce anything. They needed their services, they needed them when they needed them, and we did everything we could to keep them very separated from the main hospital and continued with their care. And we, after you know, caring for them and realizing we needed to move forward with a lot of the programming, because we really are at capacity in the Ben time. So just kind of let you know why we were able to continue through this work. Now, we did learn a lot after we had our initial meeting, and we also learned a lot during the COVID time, and we'll talk a little bit about that, how we can use different technologies to deliver care. So we've had a series of meetings, and most of them were all around programmatic clinical needs. And we also brought in we were able to refresh our data that looked at what were our projected volumes in our population growth. Fortunately, we did just get the census information, so we are in the target of the growth category that we thought. And we also were looking at refresh data to show what is the prevalence of cancer incidences in this area, given our age of the population and the number of the population. And as I had briefly talked about, we did find opportunities to care for people using telemedicine, whether you call it telemedicine or virtual health or electronic health, is when the providers, the physicians and the nurses are reaching out to the patients when they're at home, when they can do that. And to do that visually, you know, sometimes we were using a phone call until we could get out to people's homes and help them get set up. So that definitely was an opportunity for some follow-up things. It wasn't, you know, as everyone can imagine, it's a nice opportunity to expand what you do, but it doesn't absolutely substitute for for chemos and treatments and radiation treatments. People obviously still needed to come into the hospital. But we took all of those things into account, and we did hear some of the questions and the concerns. And we really looked to say, what can we use of our own current services, and how can we adjust the size and scope of what we're doing, and without actually changing the scope of what we're doing, but the size. And the reason I say this, what we're doing, is you'll see that it is still very important as we looked at our data and we looked at the services that we have, and we actually looked at how far people are needing to travel for different care based on different options available. So if you could just go to the next slide. So the Greenwich service area, and in the slide coming forward, it'll be a little bit clearer if you're visual like I am. We have some maps, but the area is that we're looking at, the populated area is expected to actually have over 4,000 new cancer care cases within 10 years. And we break this down between 5 and 10 years. 5 years is the shortest amount of time you would build in a healthcare facility. You know, you're always planning 5, 10, 15, 20 years out. In fact, much of what I do today, I want to make sure that it will meet the needs of a community in 10 years. Now it's becoming more challenging to do that. I'll be the first to admit it, because the explosion of the technology and the care that's available to people. I mean, if you asked me 15 years ago about telehealth and doing visits, I'm not sure I would have sat here and said, yeah, that's really going to happen. What we saw in our trends is that the areas of breast, gynecological, and urology cancers, they will continue to remain the most prevalent in the region, with nearly all cancer types showing some growth between 20 and 26% respectively in the 10-year period. So that's one of the reasons of the why. And the needs is the Greenwich residents and surrounding communities are not able to access specialized care locally. So when I say that, if you look around to Greenwich and you were trying to get into a lung cancer specialist at Greenwich Yale New Haven Health System, you would not be able to do that. I do know one of the questions that I was asked about, well, why Greenwich then? Why would you not just do Stamford or White Plains? And that was the question about who are the other people that are providing cancer care, and then the MSK over in New York. So people have choices, and you'll see many people do choose to use Greenwich for their cancer care, but also many people use Greenwich Hospital, Yale New Haven Health System for their other basic care, if you will. And it's very important. And one thing that has been a big change in healthcare in the last 15 years has been the use of the electronic medical record. I think it's arguably one of the top 3 safest things we've put in place in healthcare. And having your information in your medical record, it really lives in the system of which you are in. And you can go, if you're coming to the emergency room, they can see what chemo you're taking. They can see the last time you've been on chemo. They can see that 5 years ago you had surgery and you may have a cardiac problem. They can see if you're allergic to medications or you have a severe allergy to any foods. Why is that important? You may not be conscious when you come to a hospital. You may forget when you're at your primary care's office that you were taking a medication 5 years ago that could have long-term effects on something you're visiting here today. So people should have a choice when they've invested into a system to know that their record is going to be accessible for all their level of care at all levels with different specialties, and how you do that. So it is important. So I'm not saying that if you're going to go to another place, you want to do that. You would probably want to do most of your care there, because you really want your medical record to be part of the delivery of care. And we have we have 4 or 5 delivery networks, hospitals, and this access that we have through Yale New Haven Health System. We have over 300 cancer researchers working behind the power of this cancer care. So it isn't just what you have here, it's what all the clinicians can see about you in your primary area. And I know I'm going to talk a little bit about location, because the idea is then why not go to New Haven, or why not go into the city? There is no cancer specialist that would not tell you that to have a cancer diagnosis, you have to be ready for a good year of your life, and sometimes it's more, to devote to getting well and to getting healthy. And that affects you and it affects your family. And really driving more than 30 minutes is a hardship. I know it doesn't sound like a lot, but until somebody who's just had treatment looks at that car and thinks, how do I get into that car for 30 minutes? I mean, we have our cancer top physician, Dr. Charles Fuchs, who has actually made it a mission that no cancer patient will drive more than 30 minutes. if they're getting care through the Smilow Cancer Center at Yale New Haven Health System. And I know you and the face value may want to look like that spread. That is truly a patient-centered strategy. It really is a hardship for people. So we're also going to focus on when we talk about who these people are and where is the volume of coming from and where the primary services, that Stamford, Greenwich, and New Rochelle is based on population density. And those are the most significant rates. And we'll talk a little bit about what those rates are with population. Given that data, there's a need for breast, colorectal, gynecological, urological cancer at Smilow Yale Medicine. They have this expertise and they have appropriate studies in each of these. And will every single thing be done here at Greenwich? Would we bring in every single specialist? We wouldn't. We would bring in the ones that the data shows that the community would benefit the most. If you have a very specific brain cancer that maybe 1 in 20,000 people are going to have, you would go up there and you would have your surgery there. But you would also try to come back here in your own neighborhood and have your ongoing treatment, have your surgeons check on you here. The whole idea is that the providers come to the center and the patient doesn't have to chase different people and different services. If you can go to the next slide, please. I won't go through this in detail because it might be just, you may just have, it might be helpful if you ask questions later, but what I really wanted to talk about, and when I talk about what is the service area, what's the market area. So this larger area is showing Greenwich, Stamford, Darien, New Canaan. And then the secondary area is Northern Westchester, White Plains, and New Rochelle. And I'm actually pointing my screen so as if you're right in the room with me. It's in the green. So this service population area is 575,000 people. Why is that important? That's very important because that is about the number that you would expect to see 3 hospitals, mid-sized hospitals like White Plains, like Stamford, and like Greenwich. You would not, it's about, if you're kind of an industry back of the envelope, you would, a population between 140 and 180,000 is what a community hospital can serve. You wouldn't try to do it with much less than that. So, you know, the question is why here in Greenwich? And Greenwich is a smaller part of this area. Greenwich has a population of about 62,000 people, residents. You wouldn't put an acute care facility here. That's not enough to house an acute care facility. It wouldn't be sustainable, and you wouldn't be able to attract the quality of providers that you would expect. So that's why we answer to, and we look at regional. It's extremely important because you have to draw from more than the town of which you're in if you're going to continue to provide high quality services. Now, there's some exceptions to this rule. There are things they're called critical access hospitals, and they can serve populations of about 30,000 people. But they cannot keep you if you need a length of stay, if you could sleep over more than 2 nights. They do not deliver children, and they don't do high level services, and they don't have all specialties in their emergency room. It's really, critical access hospital is really rural, built for like the Midwestern, and they would try to tie them together. So the point is, why do we look at that 575? That actually tells us that's a good sized population for the number of hospitals. It can go, you know, can be a little lower, maybe a little bit higher. We definitely all could do it, but it's in the realm. Anything lower than 100,000 is really difficult to keep a quality acute care facility going. So in this service area, I'm just going to look at the blue first bar under the map, if you will. In this larger service area, we have 17% of the patients, and 83% are going elsewhere. and we break it down. And you would expect that because a lot of people in Stamford are probably going to Stamford. And if you're living next to MSK in New York, you're probably going to be going there, and that's in that area. Especially if everything is basically equal at this time. And then it breaks down into surgery. 85% is going elsewhere. We have about 15%. If medical is the oncology. It's not having a surgery. It's treating like a lymphoma, a melanoma, something, something of that nature. And then the radiation treatment. So I'm going to go to the next slide because that's really the market that we look at more closely, if you will. And it's concentrated in the town of Greenwich, but it goes a little bit into New York and it goes into part of Stamford. And that population is about 234,000. Those are the people that are really kind of counting on us for the care. And that's where we see the prevalence data, is that we know the population is growing. It's saying in 5 years, it's going to grow an additional 1.5%, and in 10 years, 2.9. We know that we'll have newly diagnosed cancers in this population. The first year, it'll be an additional 500, and then the second, it'll be an additional 549. Remember, with every newly diagnosed cancer, it's an ongoing treatment, if you will. People don't kind of go in and get out in that year. It's usually a couple of years, maybe a year and a half, 18 months. And some people, it's a lifelong journey because there's reoccurrence. So if I go to the bars in the bottom here, this is a very different story. And this is that we have 61% of the patients are having to leave. Our predominant cancer care that we are providing today is breast cancer. We have some urology, a smattering of some of the others, but the majority is breast cancer. And that's in large part because we don't have those other surgeons, because we need to have this, we need space for them to practice. We need space for the additional patients to be treated. And we've actually are starting to recruit some of these physicians just to take care of the needs of people that are here today. So all cases, we have 39%, we have an opportunity of caring for 61% more of those patients. 27% of those patients of that 39 are we caring for that needs surgical. And a lot of what our growth is in the surgical subspecialty world. Medical cancers, again, those are more of the lymphomas, leukemias. And then radiation oncology. And this one is very interesting to me because and also the medical one, because 31% are we caring for, and then 69% are leaving the area to get their care. Otherwise, these can be 3 times a week, 4 times a week visits. And each time not feeling great afterwards. This isn't a stop in, I'm gonna get a shot. This is, I'm gonna stop in and be there for several hours and get an infusion of chemo and get strong enough and get my labs drawn, and then maybe get home so I can rest a day and come back the next day. So if you could just go to the next slide. So how did we take the information? Excuse me, I just have to move everybody's faces off my screen. So we really, you'll see when we get to hear from our architect about some of these, what are the services and what are the things that make up the cancer center. But what we did is we took them and then we said, looking at what could we do differently to make it smaller by not changing the areas that the data is showing that we really need to care for our community. And so what we did under the program column there is the type of service. So, and then we had what's in the existing Bentheim building. And the question was, what we are going to do with the Bentheim building? And I'll answer that. And then what we originally proposed was 90,000 square feet. And then what we worked to develop was down to 60,000 square feet. And I know that you will see that utilizing this space, it has a much smaller presence from the visual eye outside. And we still are very confident that it is going to allow us to grow as the cancer rate grows and as we bring in new specialists. The major way that we are able to do that is actually dedicate the a portion of the Bentheim to a women's cancer center kind of area with the focus of being breast surgery. We will continue to do diagnostic mammography over there, but we will also have a breast surgeon, and we will also have our radiation, our radiation physicians to be meeting with patients. So it will be able, one of the desires we heard from the public and from our current patients and from our staff was that they wanted to have a separate entrance for this area. And in the proposed building, that was very challenging for us because not wanting to impair traffic patterns. So we decided leaving it where it was, and it would also free up some space for us. So again, and it will be able to grow because that is still unfortunately a very growing service line. So we'll go from 4 exam rooms, 7 imaging rooms to 8 exam rooms and 10 imaging, and we'll be able to keep them in that building. General imaging, one of that is a big, we can be more efficient this way and be more mindful of healthcare costs because we do recognize that we all have a stake in keeping costs to be affordable. So general imaging was going to be part of the proposed. We were going to build 4 imaging rooms. We are going to utilize what we have here in the hospital. We will have to buy equipment that is significant dollars, but it won't require any additional, moving out of the parameter of the hospital. So that is more of an efficient use of the space. The medical oncology clinic, that goes from 11 exam rooms. We proposed to do 24 rooms. And then when we revisited this look, we're down to 20, and we're comfortable with the 20 exam rooms because we did recognize for some of the follow-up visits, there is a use for this virtual electronic visits. Not huge number, but definitely some. So we use that pickup. Medical oncology treatment stations, that one is really where patients spend the bulk of their time. And that's where they're getting their infusions, and those infusions can last several hours. And you'll see that we really worked hard to kind of put this number down, but then still keep the integrity and offer some garden space, as that often is very helpful for people that they can look outside when they're getting their treatments. So right today we have 15 stations, and that is not enough for us. 15 stations is very tight. We need to bring in new physicians to meet our patients' needs, but it's worrisome when, one of our alternatives is people start booking people at night, which is really, it's not the best care. We want people to be sleeping and resting and being with their families. So going from 15, our proposed goal was 30, and then we have that down to 26 stations. 26 stations does still give us into that growth of at least the 5 into 8 years. So we're comfortable with that. Intake blood draw stations, that's a very important part. We now have 2, we're proposed to go to 6, then we've moved it down to 5. We wouldn't want to go much lower. Everybody that really basically comes in for treatment does need their blood drawn, sometimes before and after, to make sure that they're stable enough to be going home. Radiation oncology, this is a major treatment modality. We have 2 exam rooms. We want to go to 6. We're bringing it down to 5. And again, 5 rooms is more than is enough for the growth there. And then the radiation oncology, those will be, and you'll see in the architectural, those are kind of the base of the building. These are things that have had lead lined walls, and they will serve as kind of the basement, if you will, but it's be usable space for us. And we have today 3 treatment spaces, and that we are proposed originally to go to 6, and we're comfortable going to 5 treatment spaces. So that's essentially how we got to the 60,000 from the 90 and utilizing the Bentheim, which will be cost efficient because many of those things will be able to repurpose. If you can go to the next slide. So just to put this in kind of context to where we are, and I know Luke is going to do a much better job talking about all of the exact where things are, but what I wanted to talk about the fact that we really wanted to be mindful of bringing this down. We understand that a big, huge, building was not, we knew we had an opportunity, and we wanted to accept that challenge of how can we do this and meet everybody's needs. And one of the things that we think about, and in every healthcare organization thinks about this, is much of what we do is almost in a campus center, if you will, because we all depend on each other. The new cancer center will depend on the radiation, on the imaging, the radiation, the imaging and the x-rays, so that we don't have to build it twice. So when we look at this on Lake Ave, in that large gray box is the main hospital. That's Greenwich Hospital. We're very devoted to this population, and we'll talk a little bit about why people are devoted to this population. But we are also at the same time going to be redoing an oncology unit with all private rooms. So that's part of that campus feel. It will allow the physicians over in the cancer center to be going over, seeing their patients when they do need to go into the hospital. These are not patients that you can transfer off to another provider, if you will. I think one of the questions was, why here? Why in this neighborhood of the hospital? A big part of it is the synergies of this cancer campus, if you will. And so having the imaging and having those private rooms are very important to this population. And then over here, over to the to my right of the screen, that smaller gray box is the Bentheim. We'll continue to have a breast surgeon in there. Well, actually, we don't have, well, she's there now. And so we'll continue to have our breast program there. We'll continue with breast imaging. And we'll have an opportunity to decide if the pharmacy is going to be in that building or in the new cancer center. But either way, in one of those two buildings, there will be a dedicated pharmacy for just the mixing of chemotherapy. These require specialized hoods so that there's nothing that gets out into the air. But again, and we do not have enough today. We would need to be expanding on this for the number of chemos that we actually are needing to produce. And then in the bottom screen, you see the bottom part of this little map here in the blue building is the cancer center, where the majority of the services are: radiation oncology, the medical oncology, the laboratory. There'll be laboratory there. And very important is we are actually going to have a clinical trials team in unit in this cancer center. And that's extremely important to this population and to this program. You know, Smilow is a significant presence in this world. They had 96 million in cancer research funding, and 49 million of that funding is from NCI. These are some of the top physicians in the country, and our patients will not be having they won't be having just a virtual visit. They won't have an annex or sub protocol. The Smilow physicians will be going back and forth. They're all part of the same research protocols. We'll be able to allow our patients to enroll in some of these trials that they would not be able to. You can't just go to a small, if someone's not affiliated with a major academic and they're not part of the NCIs, you can't just get into the protocols. You have to go somewhere where these protocols are available. And for many people, these protocols, this is all there is. And they're the sickest and they're driving the furthest. So my point on this one is that it's really a campus, and that we're able to cut this number down because we're trying to use this cohesively and using the synergistics between the three buildings within the campus, if you will. And if you could go to the next slide. So I know I'm talking a lot and I'm talking fast. The big message is that we did reduce the square footage and the presence by 30%. We were able to do that by utilizing and enhancing what we're going to do in the Bentheim. And I know that was one of the questions at the last meeting, is what will you do in the Bentheim? Now, we probably won't add other clinical services in the Bentheim. I know there was a concern about traffic and parking, and we'll talk all about that. But the way the Bentheim is, we can devote a good half of this building to our clinic space, but we can also use the other half for people that will be there all day long, not patients going in and out. So more to come on that. And then the imaging remaining at the hospital is a significant savings to us, not only space, but it's a savings in dollars spent. We are reducing the building height by an entire floor. And I think we heard loud and clear that was a concern as well. So Luke is going to talk more about that. And we've also been able to reduce the second public entrance for the breast health that was removed. The providers in that area and some of our patients, when you do focus groups, really wanted to have that separation, and trying to do the separation, a second entrance in the size of building over in the new cancer center, it just wasn't working. So we said, all right, if we're gonna, let's put all these things together, and how can we make the best use of all the space that we have, try to be sustainable, and understanding that we shouldn't be spending any more money than we absolutely have to. But we also were committed to meeting the needs and looking at the prevalence data. And before I end with that and talk about the prevalence data, I think one of the questions was, well, so why build on the cancer center? And why is this important? And I think the question was, do you need this to be sustainable? So there's two ways to answer that question, is that the highest prevalence, the two areas that most of us, if we live past a certain age, and I think it's 56, that might be younger than, I'm just trying to remember my data, that people are more than likely going to need in their lifetime are heart and vascular, cardiac care, and cancer care. Many people will need both. Almost, and the majority of patients will need one or the other of the population, as you saw. So is heart and vascular and cancer care very important to the hospitals? Yes, they are. They're actually two pillars. They're two very important pillars. And you need to do them well. And you need to always be improving on them, because you need to attract top talent to care for patients. You do not want to, you owe too much. Your community is trusting in you too much to fall behind in these areas. And top talent is going to go where people are investing in their care, where people are looking at the newest opportunities to be in trials, or to have some of the things that you'll hear about in the radiation oncology space. And I know at future meetings, I'm sure the physicians would want to talk about all that, and they can do that much better than I. But they are very important. And so those two areas are two areas you're always wanting to pay attention to, because you need to make sure you're excelling at them. And, I talked a little bit about the fact that, well, if somebody else can do that, if you're in healthcare, you're really mission driven. And if you're in a community, and you can define the community whichever way people are, whether it's the smaller community or the general community, you really are obligated. If you're going to be doing it, you have to do it the best you possibly can. You really have to believe in the services that you do, that you have. It's really it's the core of what we do. So does this allow us to do other things? It absolutely allows us to do other things. There are many services in a hospital that will lose money as long as the day is. That doesn't mean you don't do them, but you have to do your pillars well, and you have to be sustainable, and you have to stay competitive. ICUs, intensive care units, they're one of the more expensive areas that we have. You would be closed if you were trying to live on your revenue of an ICU. So it is true. You do need to be, they are important to the business model, but they're more important to who you are as a hospital, because they are what your community needs to do. You can't just pick and choose and say, I'm going to do this one because it makes more money, and I'm not going to do this one because it loses more money. We actually have to do assessments, and we have to review our assessments and what our 5-year strategy is. It's part of being part of a system, and it's part of being part of our not-for-profit status. You have to prove you're meeting the needs of your community, not just the things that you're interested in doing. So I think that might be my last talking point, and I'm sure that there's probably some questions, and you can just go to the next slide to make sure that that's the case. Yes, that was it.
Yes, that was in our stuff.
Thank you.
If I could turn it over to the commission now, I think Ms. Kelly, we normally try, the idea with the pre-application hearing is that it's supposed to be a short discussion, but I suppose we asked too many questions yesterday. I'm going to try to move people along. Can we hear from the commission, please? Now, where are you all, since you had a ton of questions yesterday? Have they all been answered?
I bet they've been answered.
Dennis,
Margarita,
Dave,
I'll start.
there you go.
Can we take down the slides, Pat? Sorry.
Yeah, minimize them maybe.
Make Diane Kelly look at herself.
Well, then I can look at all of you. I'm like, okay. Thank you.
First, thanks. It was a great presentation, as was the March presentation. And as you probably heard, we discussed this in our briefing yesterday, and I, for one, don't pretend to be a medical practitioner or hospital administrator. So I completely defer to you and your colleagues in terms of the medical need. What I think the Planning and Zoning Commission's responsibility is for land use. And you're asking us to do something that I think runs counter to one of the key elements of our plan of conservation and development. Tom Hegney appropriately commented that, having a strong hospital presence here is important to the town. But I'd also say the counter to that is, we need to be mindful of our neighborhoods and the massing that any development would bring. So my questions are very quick. I've thought about this more since yesterday. One, is there space available in the hospital or any of the surrounding infrastructure that could accommodate any of your needs? That is the hospital 20% underutilized so that you could take advantage of that existing vacancy, or underutilized space, I should say. Second, if that's not available, how can you consider acquiring adjacent pieces of property to satisfy your square footage? The predicament, the dilemma that you're presenting us from a land use consideration is, this is a significant increase in, what we have historically deemed acceptable in this hospital zone. I don't think any of us, and, I pretty much say every one of us has had, terrible experience with cancer in our families. So it's not a matter of the square footage. It's really, how do you put it into a form from a height and FAR perspective that comports with how we should represent the town from a land use planning standpoint.
Well, I will take a stab at the first part of that, and I may ask my colleagues to help me on the land use one. But we actually did look hard for space in the hospital because this is a significant financial investment as well. And, that's always the first thing that you're asked to do. But we have gone through many different iterations, and we really don't have the space. We are growing out of two very big spaces right now with our laboratory area and our radiation oncology and imaging, interventional radiology, I should say. because we've brought in other physicians that are treating stroke. So the answer is we really do not have this kind of space. I'm concerned about the space we have allocated today for our oncology patients. It will not be enough. Those 15 chairs is not enough for the amount of time. So it's a natural progression, sadly enough, but we have grown out of it. The Benheim is 30 years old. That's, to be truthful with you though, usually 25 years is the kind of time limit you look at these things and you start to say, if it was a needed program, you do start to grow out of it. So we are at that point. I'm afraid I can't intelligently answer about the land use. Tom, can you take a...
Well, the second question was, is there land around the hospital that could be acquired? Frankly, Mr. Hardman, we have explored that and have not had success in that. This particular corner of Lake Avenue and Lafayette Place is one that the hospital has owned many of those properties for a number of years, and they've been able to add a couple more to it. And of course, the proximity being just across the street from the hospital is still in that, as Diane was saying, campus area. But we have not been able to acquire additional land, particularly going north into the Perry Ridge residential area, which was a big concern of that neighborhood years ago. And so we're looking at this as being that space that can provide these services and be in close proximity to the other facilities that Diane mentioned, both in Benheim and in the main building. So that's one of the ways we were able to bring that size down substantially by answering one of the questions you had, which was, well, what are you going to do with Benheim? Now we have an answer for that, and that keeping those programs there and growing them a bit more can reduce the size, and using some of the facilities that the hospital has already.
Let me ask you, Tom, a question. I had an x-ray a year or so ago in a facility that sort of sits behind the hospital. I can't tell you the name of it, but it abuts, if it's not in fact part of the hospital complex. Oh. It seemed there was a smaller building, somewhat, maybe perhaps underdeveloped, if you will.
All right, 40.
Can you can you creatively move units around and perhaps redevelop, that building to accommodate part of the need here, so we don't have this need for a zoning text amendment?
The building you may be referring to, Dave, is 49 Lake Avenue. It's a red brick building.
Right.
Behind the parking garage. And that is actually a condominium owned by doctors in town. And that is one of the properties the hospital has explored over time and has not been able to arrive at an agreement that can work for the obligations that the hospital has and not overpaying for property that they purchase.
So there has been movement of a lot of uses within the hospital to satellite offices within the last 5 years or so. Physical therapy, things along those lines. Has that been totally exhausted at this point, or are there other things that could move to general office, so to speak?
Yeah, we've really taken out pretty much everything we can take out of the hospital. That is how we're being able to, for one, expand our services. And the other thing is going with private rooms, which is a real commitment that we've made to the community. And especially now as we're in this kind of pandemic and the risk factor. So really that took all that movement was for the private room strategy. And remember, this is 60,000 square feet. I mean, we wouldn't be able to have 60,000 square feet. And the services that we're putting, they're really essential. There's not a lot of there's not a lot of additional fluff in that, if you will.
Mm-hmm. But one of the other things we'd like to talk about, and I'd like to have Luke Voiland, our architect, and Kathleen Lang, our architect from Shepley Bullfinch. What kinds of equipment are going to be in this building and why you need to have it in a particular type of facility.
Mr. Hegney, before we move on, Mr. Hegney, just a quick question.
Yeah.
Following up with what Mr. Hardiman had talked about, was any exploration into possible locations done along the Post Road corridor?
You know,
I'll let Diane answer that because that's been part of what they've been looking for in terms of.
Yeah, so, you know, the reason we talked about that campus feel is that we're able to do this in a modified way because we're using services fluently for patients. So, you know, the doctor could have the patient in the hospital overnight, you know, or needing surgery, and then, you know, seeing their other patients on the cancer center. We're using the imaging from one building to another. So, you know, getting too far, and then our mixing of our chemos, transporting chemos and those kind of things. We're trying to keep that campus feel where we can keep things co-located, because once you start being inefficient, and then the other real big part of that is clinical trials. You do need to be close to an emergency services if things that's one of the requirements as well. So for a lot of clinical reasons, we really are trying to keep this as close as we can without having to duplicate like a whole nother level group of physicians at one building and a whole nother here. You know, we're trying to keep it so that we can not be repetitive and very, very expensive and valuable resources.
Can I dive in at this point?
Yeah.
I don't know. Is there any way, let me interject another point of view,
Yep.
okay? And this presentation wasn't great. It was very impressive. We've heard your one in February. I don't know whether, Diane, you were on the one at the Retired Men's Association.
Oh, yep, that was me.
That was
Norm.
fantastic. I'm really impressed. Having been a part of writing the POCD, particularly this section of it, this is the kind of thing we were looking. What are your big plans? What do you want to do? How do you keep Greenwich special? How do you serve the Greenwich needs? So, but that's not what I'm after. That's a thank you, because sometimes we get very ill-conceived master plans. This one was not, and I can see it, and we can go deep in. I think we're getting into all kind of detail, and I'd love to do it. And I agree with you on the fact that healthcare, there's two things that are really important to Greenwich residents when they come here. Early on, it's schooling in the community, and eventually it's got to be healthcare. And healthcare hasn't been a big part of the POCD, and we're trying to make it, and you're giving us an application along these lines. You know, someone mentioned earlier that you're asking for a significant increase in FAR. You are. I have to tell you that we get requests daily for significant increases in FAR all over town. And I guess to paraphrase someone, you know, all development requests are equal, but some are a little more equal than others. And my point of view, personal, this is a commission, this is a pre-application. So you're getting feedback from individual commissioners. We're not judging an application yet. But my personal view is that this application is a whole lot more critical and not just in a balance. It's nice to get another retail store, another office building, but you're talking about healthcare, long-term critical care. And if we want residents to stay in this community, this is a very important application, and one you're giving us a chance to delve into. You know, it's just not balance. It is really, well, is this really just another person trying to enlarge their footprint somehow? I don't believe it is. I think this is a critical mission for the town to make sure that we provide the top-notch healthcare. And, you know, quite frankly, I've been here almost 50 years. I've used the hospital. I've had great experiences. I've had bad experiences, but that's true everywhere. But when you start talking about cancer long-term, I would love to get into some questions. But I think, I don't know, Chairman, we could get on and on and on. I wanted to get that.
I think, you know, just to remind everybody, and Katie said this to us in an email yesterday, we're here to give strategic input essentially and to opine on whether this application is striking the balance in development and in goals that we wish to see for the town. So down the road, so we give them some general guidance and we tell them what we want to bring them to bring in when they do the real application. And at that time, the right thing to do, I believe, will be to set an evening aside and really get into depth and not have this be one of 12, because it's meant to be a 20-minute discussion right now. But so we'll set aside an evening and we'll drill down into it to what everything's going on. Right now it's strategic guidance. Katie, do you want to add anything to that? Okay, Katie's doing something else. So
could I piggyback?
You'll have to trust me.
No,
I'd like to piggyback a little bit on what Dennis said. And Diane, you you used the word sustainability at one point, and I maybe I just zoned out for a minute, but I would like to know how you would characterize the long-term sustainability of Greenwich Hospital without providing these proposed services in this new facility. If you can be as specific as you can.
I'm going to try. I don't know if it's going to give you exactly what you're looking for, but I'm going to tell you from my perspective. So sustainability is that you want to put a program in place that you can continue to invest in it and have it be a top-notch program, because you don't want to do something that you don't want to get into this that you can barely afford to keep it going. It's not fair to the public. It's not good to it drains your resources in other areas. So we know this cancer center will not contribute to will not probably contribute for probably maybe 3 to 7 years, but that's okay because it's an investment into the long-term part. So so you want to know that everything you're putting in, it can eventually be sustainable. It will contribute. Sometimes the contributions are small, sometimes they're large, and sometimes they're not at all. They run in the red. But you've got to know that, because you've got to know your other programs that are going to keep it up, if you will. So we know that this will be sustainable because it will actually cover itself in probably 5 to 7 years. It'll take us to pay back. So that's not bad. That's okay. So it's sustainable, meaning we can continue to do this. So I think your other question is, can we afford to be who we are if we don't do it?
Well, that's exactly what I'm asking. What happened? Are you sustainable without doing this project?
Are we sustainable without it? We are losing volume every year to other organizations in this arena. And it depends on the answer of sustainable. I think if you continue to go back and you don't improve and you don't really excel at cancer care and heart and vascular, I do think your acute care facility is not sustainable over time. I absolutely, because those people start to know you by who you are, and they will go to you for very small things, and you will not be sustainable. It's just, you will turn into something very small. That's why people want to be part of bigger systems, because they know they have to bring that level of excellence. If we start having high top quality physicians want to practice here, people will not come here. So I do think heart and vascular and cancer care are the hallmarks, and you have to do them well if you really are going to be here for the long haul. Like I said, Greenwich Hospital would not be sustainable on a 70,000 person community. And the reason is that many people wouldn't need high level of services. They would probably need emergency rooms and maybe a few operating rooms, but you don't attract top talent with that. So it's a little bit of a hypothetical question, because, oh, will it be okay for a couple of years? Yeah, it'd probably be good for 10 years, but that isn't how we think about healthcare. We look at this as a generational commitment.
But is the model for a town the size of Greenwich one that is seeking to attract top talent? I mean, is that a reasonable thing?
It is reasonable. That is the number one reason why people affiliate or become part of a larger system. And ask yourself, why would you want to go to someone that's just average with your health? See, I actually feel very passionate about this. If you're going to do this, if you're going to be in this business and people are going to trust you, you have to do everything you can to make it the best it possibly can be. Not every place can afford that. I actually don't think in 20 years from now, you will see standalone facilities. Because when you know you can have better, why would you not reach for it? It's your health. And it shouldn't be based on whether you can afford that or not afford that. It's just the core to what the mission is.
Thank you.
Dennis, did you want to add something?
Yeah, in terms of giving advice or direction.
That's what we're here to do.
That's what we're here to do. Since this is land use and you've got a specific project on a specific piece of land, when you come back, please do some analysis about the cohabitation, the co-locations. You mentioned you're going to make private rooms available in the hospital. I think I missed that the first time through. And just how much of that is, because we all know people that have had to travel, and what you said, I think, is very true. So I didn't realize the private rooms might be available, because we know people that, quite frankly, after they get chemo, they can't stand up. And, you know, I'm not sure, we're not doctors, but that seemed very interesting. And there might be other complementary services between the various buildings at this point. And that would certainly help in a land use perspective. That's all.
Does anybody else from the commission want to ask any questions?
Is it time to hear about the building, or should we, what would you like to do about that?
If we could, Luke Voiland and Kathleen.
But keeping it, I think, again, to keep it very general.
We'll keep it general and we'll move it along. The sense I had from yesterday's briefing was why here were the main questions that were discussed. And so that's why I really asked Diane to focus on that for this evening.
And that's really, that's what this is here for. This process is for the general guidance, so that we don't go barking up a tree, get most of the way up it, and discover it was the wrong tree, which has happened way too many times. So that's the idea. So Nick, if there's just something huge, otherwise this will eventually be an application and go to ARC and the whole thing, and we'll torture them in due time.
I think actually, just one question I had, I think I raised this at the last time, and I'm actually looking at the overall campus plan in the slides. I think this is slide 9. And it shows, you know, how everything kind of is the spatial relationship between the buildings and the campus. And one of the questions I was having, or would like to have addressed when they come back, is if the building itself can be moved off the corner of Lafayette and Lake, possibly, you know, is the driveway around the building required? Because I think actually the spatial relationship of the campus is important, but I think how it reflects it as you pass through the campus is actually probably more important. So as part of looking at the overall layouts, if that can be addressed or looked at to push it down towards the south corner of the site, away from the circle area. I think that was my comment that I would like to have addressed for the next time.
Okay.
I would think, Nick, that the fire department's going to want access around those sides.
I can see that, you know, a driveway there, but there is some wiggle room there. Just looking at that one little, you know, layout there, you know, is it possible to get it off at least the Lafayette side a little bit more? I understand the building's been reduced in height and a lot, but I think actually if we're maintaining this campus feel, let's make sure that actually passing through it, it doesn't feel like it's looming on the circle.
Yeah, so This is Luke Voiland, the architect here. Thanks for having us. Yeah, so we can absolutely address that in the next time. I think there's several constraints we're dealing with, including, as Andy pointed out, the access for fire trucks. And there is subgrade parking that we're tucking under the building, which comes out further than the building. So we'd have to negotiate how close that gets to the edge too, but certainly something to look at as we go forward. Do you want me to sort of do a very quick summary? We don't have to do all the slides, but I'm happy to do whatever makes sense.
On what would you do a summary, Mr. Voiland?
Of the design as shared in the package.
I think that the major concerns have been around the FAR, the zoning change. I think we should stay away from the architecture right now, other than a general concept,
Sure.
which I think we've given you.
Sure.
Does anybody else have any other strategic guidance for the applicant? And is the consensus that this should move forward for a preliminary or whatever they choose to do application? Understanding that this is not binding, but do you find that this strikes a good balance between the town's needs per the POCD and retaining its character and not impacting neighborhoods?
Do you want to hear from the public, Margarita?
No, I just want to get a feeling for a consensus from the commission, and then I'm going to go to the public. I
would think actually if they were to return, I would appreciate if it was coming back as a preliminary.
Mm-hmm. I figured you'd say that.
I mean, this is
big.
This is a significant structure in a significant part of town.
Yeah, I agree with you. What else? Does anybody want to add anything at this time? And then we'll turn to answer that question that I raised, or do you want to, I'll turn it over to the public.
Yeah, Marguerite, I'd just say, so I think there's a lot of ingenuity at work here just based on the progress since March.
Mm-hmm.
If the same degree of effort, came back, in the next iteration, we probably could be at the 0.6 FAR. And then it's just a matter of architecture and
mm-hmm.
So forth. So again, I just think that it's very important, if I'm part of the public and I sort of Greenwich represents 25% of the catchment area, as I kind of thought I heard, I don't think it's really the right thing for this neighborhood to bear, that sort of imposition from the land use standpoint.
Mm-hmm.
So I'll stop at that.
Okay, thank you. Hearing nobody else, does anybody from the public wish to speak? Please raise your virtual hand. Yes, Jill Cobbs, if you would go ahead. And anybody else, please raise your virtual hand. Tell me again, Pat, it's *69. No, just 6 on the phone. What is it? We have we have 4 people.
It's *9.
*9. Ms. Cobbs, if you would go ahead.
Yep, I'm Jill Cobbs. I have a quick question. I appreciate the sense of a campus that you're trying to achieve. Does that include connectivity between the buildings? Will you be connecting them for patients or for doctors, if that's kind of the sense of a campus?
Yeah, we actually had talked about that. And at this point in time, we're not looking at connecting the buildings. We just think it was just brought up so many barriers. And the idea is that the clinicians will have to do a lot of the moving around, and we'll make sure we're scheduling it for the right, like the appointments at the right time, but really not wanting the patients to have to move from building to building.
So I think to answer Jill's question though, Diane, it's, will you have connectivity with the clinicians? Will they be going?
I thought they meant like a tunnel or something.
Well, both actually. I don't know if you can still hear me.
I can hear you.
A tunnel or an overpass.
Yeah.
And will there be, and if no, will there be a lot of movement, and how will they get between buildings? Will it require movement for the physicians or their staff or the patients, any of one, and how will they achieve that?
It's mostly the staff, and they do it today through the patients and the clinicians in the Bentheim coming over to the main hospital.
Mm-hmm.
And the staff, you know, they're using the resources here in the main building. So that's really what we were thinking. We were, you know, we're fortunate. The walkways are well managed, and people are respectful of that. But we were not thinking at this point in time that we would be asking for any kind of an overpass, if that's your question.
Okay, thank you.
Would anybody else like to speak? Please raise your virtual hand. Okay, so I think what I'm hearing from the commission is that, yes?
Actually, Ms. Cobbs brought up a very good question.
Okay.
And I think something actually to address next time would be the interconnection and the pedestrian pathways, that kind of stuff between the three buildings through the site. Because I think that's something as land planners we're really going to be interested in, is how do you get from one building to the other, and do the crosswalks, are they safe? Do they work? Are they logical? That kind of thing. It would seem to me we've got the three buildings now, and how do I get from one to the other? And if I was a patient, how would I get from one to another?
Yep. Okay, yep. So it's just, I think then I'll turn that into a capsule, which is
yes,
to think through strategically making it very user friendly. And I think you're doing that anyway. I think that's been your goal. The general consensus I'm hearing from the commission is that this is going in the right direction. That there's a real effort to achieve the trade-offs for the town to better protect the neighborhood from the impact while creating a top-level healthcare facility. So I think with that, we send you on your way.
Thank you for your time.
Thank you very much, Ms. Kelly. You gave an excellent presentation.
This has been very helpful. It's just the kind of feedback we were looking for, and we look forward to bringing back an actual application to you sometime this spring.
Oh, so long?
We're still working on it. We may come sooner.
Okay, great. We look forward to seeing you whenever you can do it.
Just a minor little comment on that, Mr. Hegney, is when you do come in with the text amendment, that you probably need to take a look at the purpose statement within the existing regulation. I don't think it'll be changed much, but something to consider.
Okay, thanks, Katie. I'll focus on that as well.
Our next item is also a discussion item. It's at 4 Orchard. It's 4 Orchard LLC for a pre-application review. This is for a set-aside development pursuant to Connecticut General Statutes 830G. And that would be, who will be speaking for the applicant? Is that Mr. Cohen, Patrick?
Yes, ma'am. Yes, Madam Chair.
And Mr. Cohen, I'm not seeing him.
He is in the panel now.
Oh, okay. He snuck in. All right, Mr. Cohen.
Unmuted.
Yep, he's good. He's up now. Okay, he's unmuted. His video isn't starting, but we might have a picture of you somewhere. So Mr. Cohen, you are unmuted if you want to start speaking till you can get your video on. Now he's muted again. Okay, now you're good. You're unmuted. You should be able to speak now. I think he's having connection problems. we could go to the next one and wait.
There, yeah, why don't we do that and let that kink get worked out? Is that all right, Madam Chair?
So Mr. Cohen, if you can hear us, we're going to go to the next pre-application and then we'll bounce back to you in a few minutes. It shouldn't be very long. The next one is Matthew Cruciulo for Pizza Post at 522 East Putnam Avenue, and it's to expand to the next door location. Sir, would you go ahead? Have you? There he is. Okay.
Brought him in, Madam Chair. Thank you.
All right.
Yes, hello?
Hello.
Hey, how are you? Can everyone hear me okay?
We can hear you and see you. You're in good shape.
All right, perfect. So I'm pretty sure this will be pretty straightforward and easy. It was just an application. Well, I was trying to do the application to take over the next space next door to Pizza Post where the hair salon used to be and just make it more functional, easy. And I was also hoping to acquire whatever seats would have been available if it was someone else who took that space while retaining the seats I originally had.
Okay.
So pretty simple, and the flow of it would be much better since, you know, if you've been to Pizza Post in the past, you had to walk through the dining room to get to the counter and everybody was on top of everybody. So now it would allow us to shift all the seating to one side while keeping anyone picking up separate. You wouldn't have anybody on top of each other. You'd have more, you know, space, more spread out. We've also be able to have the bathroom, which was always a problem in the past, and it would be handicap accessible. So I think the improvements would benefit everyone. It would also allow us to expand the kitchen and have more clearances and improved fire safety and everything, which we obviously know we need.
Okay.
And I think that's about it.
The only concern that we really raised yesterday, and I believe that when you come in, you're going to actually be fine versus the regulations, is your parking lot is awkwardly laid out, and it is awkward. And it gets tight when you and Gopher are busy. But we think you're going to be consistent with the regulations because what you will add in terms of seats will keep you compliant. But we will just offer you the thought of, is there anything you and the landlord can do to work it out to improve the parking situation somehow?
Well, I definitely have had thoughts on this, especially now with the way everything's going. You know, Pizza Post has never delivered, and it's definitely been on my mind, especially with the whole new COVID world. So if we did implement delivery, I think that would actually ease the parking situation.
I think it
quite
would.
a bit, because then you wouldn't have everybody coming to pick up.
Sure.
And that's already a big bonus. And the other thing I was thinking is, this would be a little less, but still important, is if it's not a different retail space, because my staff is pretty much going to be the same number of people anyway. So by taking that space, you won't have more workers bringing cars to take up more spaces as well. So that alone, I think, would ease up at least 5 more spaces. So
and you don't have to address it now, because you're going to be compliant with the regulations. So I would say just think on it. We just said, wow, he should think about this. But you know, when you come back, does anybody have any comments other than that? Because I think we're pretty comfortable with your idea.
Oh, great.
I would think the only thing maybe just to add to the documents, if the property owner has a site plan showing the parking out there, then we can actually add that to the record.
Okay.
Because I think if it's the parking issue with us as opposed to your layout, that's the plan that we really would need for the file.
Okay.
And also, is the parking conforming? I mean, I think, unfortunately, it's tight in a lot of areas. We just need to know that going forward.
You know, that's a good point, because it's probably narrow, but The question is, would we give up spaces there? And my guess is that could be problematic. So you guys think about that. Andy's right. Take a look at it.
I just want to see a real plan so we can make an informed decision.
Okie doke. Thank you, Mr. Fox. So you're all set as far as we're concerned. Dennis, go ahead.
Andy also brought up, I think it was Andy, that the office space, what are the plans?
Good point.
That would impact parking in a big way.
Yes, the office space is upstairs.
Yeah.
Right?
Yeah, I mean, in the past, they've always been full. And they technically have their own spaces along the side of the building. And usually after 4:30, 5 o'clock, they're not there anyway. So it all clears out by then. And the peak hours for me and Gopher are usually after 5 o'clock.
Yeah, we know.
Yeah.
I don't think we discount that. I think we just need the number, and just so we're looking at the parking in total.
Okay.
I mean, the good news is everybody likes going there. The bad news is it gets a little tight.
Yeah, I understand the tightness issue. I'm like I said, the whole thing for me with this was more the seating, and hopefully we could get those few extra seats. And if not, as long as we could keep the ones we had, we'll be all right.
Well, and next month you'll have about 10 seats in there.
I know. Well, yeah, with COVID and everything, I know it's going to be cut in half anyway. So we'll work through that.
Governor says he's trying to hang on to it. That's what he said yesterday, that he's trying to keep the dining open. Okay, so with that, we'll see you whenever you're ready.
Okay.
Good luck finishing the restoration.
I really appreciate it, and you all have a great night.
Take care. Bye-bye.
Thank you.
Is Mr. Cohen ready?
He's on the phone, Madam Chair. I'm going to bring him in right now.
And there was no public on the other one, I assume, right?
I didn't see anybody. Does anybody from the public want to talk about Pizza Post? No, good. Phew, thanks. I was so worried about Mr. Cohen. Okay, if Mr. Cohen, you need to unmute, or is he phone call? Oh, I see what he's done. Okay, so he's phone calling. I'll unmute the phone.
*9, right?
*9, Mr. Cohen, on the phone. Andy, you're muted.
*6 to unmute on the phone.
Oh, *6.
Yeah, *9 is raise your hand. *6.
Oh yeah, *6. Sorry. Mr. Cohen, *6. There he goes. Okay, you're good. Yay.
Okay, good. Oh boy, this is going to be good.
Now I think you have to turn your speaker off. On your...
No, I turned it off. I just muted him.
Okay.
Yeah, you're good. Now you're not going to use the computer anymore?
Ever.
Okay.
Okay, well, I'm representing the folks who would like to do a set-aside project, as the chairman has stated, a property that's located at 4 Orchard Street in
Oh, you muted.
Okay, I'm sorry, Mr. Cohen, you got muted. If you could do *6 again. Mr. Cohen? Mr. Cohen, if you could do *6 again.
There he goes.
There you go. Okay, good.
Anyway, I'm not sure how much you got. But this is not good. As long as you can hear me, I'm getting a feedback, but that's okay.
I'm trying to fix it. Okay, try it now. No.
No, I think, Mr. Cohen, whenever you're watching the Zoom on, you need to turn the volume off.
Or if you mute everybody, Marguerite.
I did mute him, but I'm not having any luck.
No, you've got to mute all of us and let him be the only one who can speak.
Okay.
Yeah, I believe he has
How's that?
That's good.
Is that better?
Oh, that's perfect. Okay.
Okay. All right. Sorry very much about this. This is so.
It's all right. Something always happens. In the old days, it was rain
in
or
any
snow.
event, this parcel, which you're probably familiar with, it's the site of a flower shop, a greenhouse, freestanding garage, and a single-family residence of about 2,900 feet. Has been there a long time. I remember it as Flowers by Lee. You may as well. But in any event, this is the parcel that my clients have acquired for the purpose of developing on it a set-aside development under 8-30G. This is coming to you tonight, as the chairman has stated, under the pre-application process that's established by the Connecticut General Statutes and by the Building Zone Regulation Section 6-14A. Perhaps it'd be a good idea if Pat could show some of our images. The first one shows the existing site. And we highlighted in pink the existing structures on the parcel. There it is. Orchard Street is to the right. The parcel is in the R7 zone, but it is immediately across the street from a business zone. There's a gasoline station on the corner and other commercial businesses up East Putnam Avenue. To the north is a residential area, and to the south and west is the campus of the Coscob Elementary School. What's being proposed is, and maybe what I should do is to give you a better idea through some photos of what this area looks like right now.
Oh, no, we know. And, yeah, we know what it looks like. I think just about all of us are very familiar with the site.
Really? You've been here?
Yes.
Okay.
I only live. It's on one of my walking routes. So
well,
I
then,
look.
Pat, maybe if you could pass by.
Yeah, Mr. Cohen, what we're very interested in seeing. Yeah. What we're very interested in seeing is this the layout, and then we wanted to see if you had a plan for the front elevation.
Yes, we do.
And then we wanted to just discuss the front elevation, the street facing elevation. And the key concern that got raised at the briefing was the issue of ingress and egress during peak hour traffic, which is mostly related to the school's hours of opening and closing, but is also related to rush hour on the Post Road as people head up Valley to catch either North Stamford or to get to the Merritt northbound. It's one of the routes that people use. And when we do our homework, we tend to go to a site and then see what it, how does it send you to if you're going to take the Merritt, is it going to route you through there or not? So those are some questions that we raised yesterday. I know you heard them.
I did, yes. And I think we can.
Yeah, we wanted it to look residential.
Yes.
And
well, maybe if Pat could turn to a couple of later images to show that. There is marked in red the facade, the east-facing facade of building number 1, which is what I think you're talking about, Margarita. Mm-hmm. And as you can see, there are a number of possibilities here. In fact, the next image, Pat, shows that facade by itself with various methods of treating it to give it the residential look that you're looking for in terms of windows, the porch that's been added to the, and that's the sort of thing. We are scheduled to appear, if you allow us to, before ARC tomorrow night, and we would hope to discuss some of these ways of addressing your interest, and it's a valid interest. Our clients specifically put this smaller scale building and the one behind it closer to Orchard Street, just so that the residential scale was maintained. The other issue that you raised has to do with traffic issues and ingress and egress. And for that, we've asked our traffic consultant, John Canning, to take a look at it. He has, as you know, submitted a traffic report. It has been reviewed by Beta. Beta has made a couple of comments, but generally finds the parking to be reasonable. And I think the other issues that they raised, we can address. But
I was hoping we would be able to see that before this evening, but we don't have a copy of it. I don't know what. But that's fine. I know you filed it, and staff was going to send it, and I think we had a glitch, and I didn't receive one anyway. So no worries. That's what you can come in later for your. We can address that.
I wonder if I could ask John Canning to address the issue you raised at the briefing yesterday in terms of ingress and egress from that driveway.
Will it take a long time? Because the idea is to not get into the brass tacks here. We just want to do an overview and make sure that you're headed in the right direction. What I'd like to say to you strategically, and I believe that your client is aware of this, is that we'd have a task force to implement the goal of diversifying our housing in the POCD, and that one of the things that the task force has worked on is to figure out how to add small scale, affordable, set aside developments in town. And I believe that this goes towards achieving that general goal. So strategically, I believe it is aligned with the POCD. And it's just a question of how it impacts the traffic, how these 15 units will impact the traffic. And does anybody else have any other questions on screening or density or anything like that?
I think
yes,
the traffic was also, when was the traffic counts taken? Since we've been in COVID since in March.
Could we ask John Canning to address that?
Okay, but tell me he only has 5 minutes, no more.
Oh, he speaks very quickly. If he's here. John, are you here?
I'll look for him.
I believe there's a story about a spoon, right?
I've got him. Okay, Mr. Canning, you're in.
This doesn't count towards your 5 minutes.
I know. Well, he is. I had him, and I've asked you to unmute, Mr. Canning. There you go. You should be good. Now, Mr. Canning, this is not fair because we don't have your traffic report, so you can't take advantage of us.
I'll put one hand behind my back.
Okay, you do that. All right. So if you would just in very general terms address both of those questions, the ingress egress at peak hours, and also Mr. Fox's question about how you've accomplished the traffic counts given the fact that many offices are working virtually and the school may have been closed while you were doing counts.
Yes, Madam Chair, thank you. Good evening and good to see everybody. So what we did is we compared the level of traffic activity that is projected for the 15 apartments, which is approximately 10 vehicles in the peak hour. We looked at the morning, the afternoon, and Saturday. And we compared those peak hour volumes to the level of traffic activity that would have occurred or could occur in the future, perhaps, when the florist and horticultural business was operational and with the existing residents on the property. So those trip projections were based on ITE data, and all of the ITE data is pre-COVID. And what the data indicates is that the 15 apartments will generate the same or less traffic as what's there now. So it's not an increase or a change. And then that begs the question.
Mr. Canning, that what's there now hasn't been generating any traffic that I've seen for a really long time. So I would actually treat it as a vacant site at the moment.
Okay.
And I would not address it as a full retail operating shop because it is not at the moment. So when we're looking at peak hour traffic right now, we don't have an as-built and operating case.
Okay. So,
Mr. Canning, before you move on,
yeah.
I think maybe just as a suggestion, seeing as we're a pre-application here, maybe the study to do is the impact that this site has in its traffic ingress, egress, and the adjacent driveway to the school. That's probably our concern, intent of our concern.
It's also the
these affect
backup.
one or the other.
It's also the backup. One is the safety, and that's one of the things that came out in the briefing yesterday, Mr. Canning. Mr. McRae's absolutely right. We discussed the safety of the kids. The second thing is that level of service must get pretty low at peak hours, and we're interested in your LOS impact as well.
Right.
At that, and that is a weird because it's an offset intersection. It operates strangely at peak hours because some of the traffic gets stuck not knowing when it can jump out.
Mm-hmm.
So those would be the things we'd want you to address, and to definitely look at this as a vacant site at the moment, because I've not seen a car come out of there anytime that I've walked by it in the last year.
Okay.
Well, may I interrupt for just a second? I don't think you can legally look at this as a vacant site.
Well, we can
flower
ask,
business or a business
well,
a business similar to the flower business could reopen there anytime.
Well,
as a
we
legal
can
matter.
legally.
So I think it's fair. Let me finish. I think it's fair to look at what legally could be done there, as opposed to what we're proposing to be done.
No,
what
sir.
legally could be done.
You can do that. I'm sorry, Mr. Cohen, but that's not fair to the town. It's just, it may be legal or illegal, but what you do have to make an effort to do what's right for the town. And what's right for the town and its residents is to compare what happens when you build this versus what is happening right now. If you find that you're not legally obliged to give us that, I recognize that. And I appreciate your saying it, but I would really like you to see your way to giving us a manner of assessing the impact of this development objectively and with what's really going to happen.
So I'm sure Mr. Canning will be able to do that.
Thank you so much, Mr.
Cohen. You're just talking practically how it would
impact practically. I realize you're not forced to, but heck, it's really it's the practical situation here.
I think we can do both, Madam Chair, and then.
Thank you so much, Mr. Canning.
And I think you need to blow this intersection up all the way through the post road and show your counts, because this intersection's complex and it's just not this one little small section.
Yes, it is. Andy's absolutely right. It's a tricky intersection because it's got the V, the Orchard Valley, that Orchard Valley V, and in addition, Mead is offset. It's a difficult intersection. So now, go ahead, Katie.
Yeah, Mr. McRae had raised this yesterday. I thought it was a good question. Like, could you address why you did or would or maybe switch the buildings and driveway? Do you see what I mean? So that the driveway was further north. I thought that was an interesting point. I mean, obviously they couldn't get to the other side of the circle, but
Katie, when that was raised yesterday, I spoke to my client about it, and there's a reason that the driveway is where it is, and that is because buildings 1 and 2 have views right now that are over the residential area. If you were to switch it because of the floor plan, the buildings 1 and 2, all of the bedrooms would be, and living rooms as well, would be looking over the parking lots. And so our client really did it in terms of, the livability of the people that are going to live here.
Hopefully they do live when they try to leave the site.
So the trade-off to Nick's point, Nick, you want to elaborate on your point? Because I think it's an excellent question.
It was basically taking the length of the lot And just mirroring it north to south, I understand your points of the view and what people are seeing when they're in the building. But I think the biggest concern was actually where this curb cut is in relationship to the school's curb cut, getting back to that. And you know, is it a better situation? And Mr. Canning can look into this as well, if that's farther away, and does it have any impact if it's farther away from the traffic light, from the school entrance, that kind of thing.
We will take a look at that.
Right. One other issue I'd love you to take a look at. Actually, we can use this drawing. If we zoom in on this drawing, there's an extensive amount of hard surface, sidewalk, concrete, aprons, so on and so forth at the street. It would be a great idea if you could explore minimizing all of that hard surface and adding some green area, you know, narrowing down the sidewalk so it's more pedestrian friendly, you know, those kind of things, because I think it will actually add to one of the things that Chairman said at the beginning, is creating more of a residential feel to the facade of the front facade of the buildings.
And I think ARC is going to echo your comment, Mr. McRae, when they meet. I would be surprised if they don't.
It does seem to me that what Mr. McRae was saying is quite keen, because if you move the entrance to the other side, it does solve a problem of egress. See, right now, you have to cross 2 lanes to get to the turning lane that goes east. But if you're a little bit further away from the intersection, it's really just 1 lane, and you can easily turn into either lane for turning at the intersection.
The problem with that in general is and this is what Mr. Canning is going to have to address, the queuing is, here I am using my cursor, the queuing is pretty significant there. So at rush hour, the queuing goes back from the light. So Mr. Canning will address that. It's worth noting, Mr. Canning, that Mr. McRae was on the New Leb Building Committee, so that all of these issues around safety of the children crossing, he has had a lot of experience with recently. Does anybody else have any comments? We have some hands raised in the public, so we could turn to that unless one of you wants to add something.
I had
Katie,
sorry.
Of course.
Yeah, I had a question about the sewer. I wondered if the applicant had spoken to the sewer department.
I'm not certain about that. We did get I don't think we've gotten a report back in from the sewer division, have we?
Well, no, I mean, I was wondering if you had been proactive in speaking to them before submitting the application, kind of thing, just since we are in the pre-application stage at the moment. Not an official comment, but just if you chatted with them, because as you pointed out, there are existing uses on the property. So there's obviously a demand for sewer based on the retail and the other uses and whatnot. So I'm just wondering how much more of a demand the 15 homes are over the existing, and whether that's manageable in the by the infrastructure in that area, if that's been explored.
I believe it has been, Katie. And knowing my client, I'm sure that this was something that he did not let fall between the cracks.
No, because he knows how problematic.
Before we appear before you, we'll have clarified that. But my guess is that he probably did.
Yeah, if you want me to speak, I'll be happy to address that. Can you hear me?
Yes.
Okay. So the sewer department doesn't necessarily like to do an analysis on projects before they get the plan, so they haven't commented yet. But I can only assume that given Chase, Dunkin' Donuts is all new applications, and given that the Coscob Elementary School is right next door, I can't imagine that this is a problem, but that's for the sewer department to decide.
Okay. I think it's just, we're actually trying to just doing it more for your safeguarding than anything else. Thank you, Mr. Pecora. I'm going to turn to the public. The first person who has their hand up, and if you would kindly identify yourself as EJG, if you would just please let us know who you are.
Hi, this is actually Sylvia Gentile and EJ Gentile. We actually live on Orchard Street. And
great, thank you.
Neighbors. So I actually have quite a few questions and comments. First, for Mr. Cohen, a comment is that the flower shop is open. We've been living here for almost 6 years and it has been open. However, I do agree with Ms. Albin that there is very little traffic going in and out, with the exception of those who currently live at 4 Orchard Street. The other, thing I kind of want to question is, the fact that you seem to think that there's going to be about 10 cars for 15 houses, which I personally find a bit challenging, considering I know our neighbors that are here, and of the 3 houses that actually line up to this new building, we have among us 9 cars. So thinking about just what we're really going to be putting into the parking lot, I think we have to be a little bit careful, because going back, Ms. Albin, to what you were saying, the line of cars in the morning and in the afternoon for me to get into my driveway, I actually have to wait. There's quite traffic going from the blinking light at the intersection of Valley and Orchard to the light at Orchard and the Post Road. And it's actually a light that for some reason, whatever it may be, the Orchard and the Post Road is quite short.
So weird. They're all weird where they cross the Post Road. They're all short.
Yes.
So I know. And then everybody gets backed up on Mead as well.
Correct.
Yes. Ma'am, I believe the ratio, am I wrong? There's 1.25 spaces per unit. Am I misremembering that? So they're assuming that every apartment would have 1 space at least.
Okay, so if they needed additional space, would they be parking on the street, which could also propose a problem? Thinking about, the school, because we're not obviously supposed to park at the school if we have people. And I noticed that there are times that even my driveway is blocked.
And there's
their children, which I understand because it's a neighborhood school. So that's something I thought really needed to be taken into consideration. And being I'm an educator myself, and I have children. So when I was here doing the homeschooling, the number of accidents that happened in that V was terrifying.
So Mr.
So that's I think kind of a concern in terms of traffic, because
Ms. Gentile, I'm just going to say to Mr. Canning, because I know he's still out there listening, if he would make sure that he gets the accident data that when he finalizes the traffic study, that would be important.
That would be great.
Because what we're looking
COVID accident data.
COVID accident data in addition to others, because
the police department has the history, so we'll have pre-COVID and now. So the police department can give the applicant all the data on the accident history and what kinds of accidents they are. I think the assumption is that people would park on site. I don't see a lot of street parking available in your neighborhood.
Agreed. And I'm almost done. I'm sorry.
No problem. You live there.
That I had. The other thing was that when they cleared the trees over a couple months ago, in order to kind of see the actual site and what it looked like, a couple of things happened. One, we lost all of our privacy in the houses that butt up to that property. 2, the amount of wind that has currently come through and all of these storms that we've never dealt with before has actually impacted us as such that we've lost huge limbs on our tree and on our property longer than our house, which is since the 1800s. And that's a bit of a concern because, we would like to ensure that we have privacy because what we see in that plan, my son's bedroom is going to overlook a dumpster.
Pat, would you put on LP1?
I'm sorry, LP1?
Yeah.
Is that in their application, Madam Chair?
Yeah, it's their landscape plan.
Oh, I didn't, I'll have to find it, I'm sorry.
We were told that they were going to put rhododendrons.
They're going to screen and
I think it's page 3.
Yep. So what the applicant is hearing you say this, and they are well aware that we look for screening. And one of the things that we've discussed with the applicant when he, on a different application that they did was to say to them that screening a multifamily use, a multifamily development from a single family is one of the POCD goals, that we make sure that we make that screening denser, and they have tried to address that for you. I think everybody saw it, Pat, but they're listening and we'll make sure that they address it.
Okay.
Is that
it? Looks like it's page 34, if I'm not mistaken.
Yeah, he just popped it up. The screening
Okay,
was up there, and we'll make sure that they look at that because it is a POCD objective to increase the screening between a multifamily commercial or institutional use and a single family home.
Okay, no, I appreciate that. And I think
sure thing.
My last thing was keeping in, because when they were removing the trees, they were not in compliance with the noise ordinance. And just making sure that whatever does go on there, that they're mindful that there are young children that are right next to the property.
Okay. All right.
Because that would be respectful.
Yeah. And what you can always do, ma'am, is if somebody does work during non-town hours, the town has an app and you can report violations or problems with anything the town is doing. You can report it through the app and the person at the other end will route it to the right department for enforcement.
Excellent. I think,
okay, because there's hours that people can work. It isn't
Agreed.
that noise ordinance doesn't apply so much to removing the tree as it does to the hours in which you do it.
Absolutely. Okay. No, I'm fully aware. Thank you so much.
Thank you, ma'am. The next person is NS. And again, would you identify yourself?
Hi, everybody. Good evening. My name is Naren Santayana. And first and foremost, I'd like to thank the Planning and Zoning Commission for the time this evening. Very informative process so far. Before I start, I kind of want to confirm that what Mr. and Mrs. Gentile have shared is similar, if not identical, to the concerns that I've derived as well, just based on the analysis that I've had for the 4 Orchard project. I've been a long-time resident here in Cos Cob, and like Chairperson Albin, I enjoy the Orchard Street walk, and I pass by the florist all the time because they're my neighbors. I live at 6B Orchard, the back lot on that property. You'll see my parents' names actually in the map that we were showing up earlier. But bear with me. I feel as though I'm kind of going to be reiterating what's been consistent throughout the conversation about 4 Orchard, and I don't want to sound like a broken record, but it's important to me. I joined the call today hoping to garner additional information on the plans in terms of addressing incoming and departing traffic concerns for that complex. As it's been discussed consistently, I understand that there has been a traffic report and studies performed by Mr. Canning and his team. That's magnificent, but of course, post-COVID data or current pandemic data is most important, since I know that a number of my colleagues and I are working from home and actively present in town. So, and I'd also like to reiterate and confirm that Chairperson Albin's statement about 4 Orchard and that it's not generating traffic, nearly as much traffic as a fully functioning business would, is accurate. That is accurate. They are my neighbors. I see their cars come in. I hear their cars come in every day. That is where my bedroom is. It so happens that I can see their property from my window. Either way, I've as a Cos Cob resident, I've witnessed and been a part of these traffic related issues, especially coming home from New York City, working after a long day, where I'm literally stuck in the middle in that intersection, Orchard and the Post Road, waiting for people to just either pull into the Cos Cob school if necessary and things like that. Sometimes I've been stuck, not able to pull into my own driveway, waiting for the green to come so I can make that left turn into my driveway. And that's me literally, at a standstill right in front of the current florist's driveway. So the additional 15 or so vehicles, or 1.5 times the number of units, is definitely a concern. I know that during peak hours, it was stated that it's 10 projected at peak hours, but that still drives a concern. I've been there with a 6-car pileup into the middle where folks are coming from Mead or from the Post Road themselves. And it's nearly traumatizing to see other vehicles approaching you and you're like, I have nowhere to go. So bear with me. I'm not informed enough to provide an alternative or even a solution to the issue. I just want to reiterate the importance of the issue during this pre-application stage of the process.
Okay, thank you so much. I think we've raised, as you said, you were reiterating what we saw as major concerns, and the applicant is hearing you. Thank you, sir.
I apologize. There's one more point. After reviewing, I'm so sorry. After reviewing those site plans that were just displayed very briefly on the screen, it does look like there are about eight or so HVAC units that neighbor my current backyard, which is kind of a bummer. I know how loud my one HVAC unit is, of course, there was a recommendation of mirroring the lot that would resolve the issue, but I'm concerned about the peak, the peak of the noise in summer months and so on.
And again, they have to comply with the noise ordinance at the property boundary.
Understood.
But even complying with the noise ordinance, we can all hear our neighbors' ACs. It just, unfortunately.
Yeah.
The next person to speak is Eve, and if you would also kindly identify yourself, and I'll say, ma'am.
Hi, can you hear me?
Yes, ma'am.
Hi, my name is Eve Chen. I'm also a neighbor at Orchard Street, and I'm also a COSCOP school parent. So as my neighbors have mentioned before, traffic is a real concern on Orchard Street.
Yes.
And in addition, I would really like to ask the developers if they have talked to COSCOP school at all about how this is going to affect our children. I have my child is in 3rd grade. In the past 4 years, every single year, COSCOP parents have had letters from the principal, Mr. Smith, begging us to be careful when we are walking across the Forest parking lot, because that is like when they're waiting to train to the COSCOP school parking lot, it's accidents waiting to happen. I watch children almost get hit by cars every single year when I walk my own children to school. So the idea of adding 10, 15, however many more cars to that area during school hours, that is very, very scary to me as a parent with a child walking to school. And I will also ask that for the traffic study, that they don't look just at peak hours, but at COSCOP school hours. We need to look at the hours of 8:15 to 9 o'clock when parents are dropping off their children, and the hours of 3 o'clock to 4 o'clock when the children are leaving. So
yes, okay. I think they heard us say that. I think they understood that we were concerned about the school hours, the incoming and the outgoing of the school, as well as the traffic peak in general, and the safety of the kids because a lot of the kids do walk to that school, so that they will consider that and the safe access. Thank you very much, ma'am. Our next speaker is Rachel. If you would also kindly identify yourself, ma'am, as we bring you in. Oops. Oh, I think I got the wrong person. Okay, there we go. Rachel.
Hi, I'm Rachel. Can you guys hear me?
Yes, we can.
Okay, perfect. So again, I also live on Orchard Street, so I'm very familiar with that intersection. We're neighbors basically with that florist. I live two houses down. And again, I just want to reiterate, the traffic is a huge issue. So you're absolutely right. It should be, honestly, for all intents and purposes, it's basically a vacant lot right now. I've lived there 6 years. My husband has lived here 30 years. Basically, there's no traffic coming in and out of there right now. So to add, 10 to 15 cars there, I'd say it's not going to really have an impact, I think is very, very kind of optimistic. I know from my experience, like you said, it's a complicated intersection. Sometimes I'm trying to turn into my driveway or turn right out of my driveway to get in or to get out. I'm waiting basically 3 to 5 minutes, which doesn't sound like a lot, but when you're just sitting in the car and traffic on Route 1 is piling up behind you and people are waiting to make that left turn on the intersection, 5 minutes is a long time to try and kind of make that turn into your driveway. So definitely that kind of ingress and egress, that traffic flow is a big concern.
Okay, thank you very much, ma'am. I think the applicant is hearing you discuss this. It'll be, in theory, it's 22 cars.
Yeah.
Or less than that. I'm sorry, 15 a quarter. It's about 20 cars. Thank you, ma'am. The next speaker is Luigi Barcello. If you would go ahead, sir.
Can you hear me?
Yes, sir.
Good evening, all. Thanks so much for organizing this meeting. I live on Orchard Street on the same block, and I understand the limit is what's proposed is 1.25 cars per unit. The reality, we all know that is very, very different. There isn't a single home on Orchard, I can guarantee it, that's less than 2 to 3 cars per house. So here we're looking more in the neighborhood of 30, 35 cars, if we're gonna be real. If you're going to stick to the numbers are what they are. But in reality, everyday life, there's going to be 2 to 3 cars per unit. It's just a fact of life. Now, 1.25 spaces sounds great, sounds pretty clean and straightforward. But again, all these cars come in and out of there. And also, where are they going to park? There's no room to park. So 15 units, I would say, is just not realistic for that small land piece of property. Just isn't.
Mr. Barcello, you may be right, but one thing about this application is it's governed by the Connecticut state law, not by Greenwich's regulations. And when a town does not have enough affordable housing, somebody can develop a piece of property and not follow the Greenwich regulations. And that means that although we may require X amount of parking in our regulations, the applicant does not have to do that because today Greenwich doesn't have enough affordable housing. We are supposed to have 10% of our housing stock be affordable in town by state law, and we don't.
I understand that. I'm aware of all
it may not be, so it may not be, okay, I didn't realize you knew that. So they can actually disregard our parking standard. The applicant is hearing you, and I'm sure we'll try to address it, but they may choose not to because the state law allows them to disregard that input.
So this application wouldn't have to modify the zoning use of that piece of property?
No, it would not. It has its own statute by state law that applies to it. So they don't have to ask for a variance from the Greenwich regulations. The state says that they can build it as they see fit because we don't have enough affordable housing in town. Yeah, I know. It's an interesting thing. It's an effort to get more affordable housing throughout the state, but it creates some difficult situations for the towns.
Yeah,
so I think they heard you.
Situation there.
Yeah. Anyway, I just wanted you to know that. So if we could move on.
Thank you.
Thank you, sir, very much. We have one more speaker, Vin DeMarco. Hold on a second, Vin. Okay, Mr. DeMarco. Now I know you're here for something else, but go ahead.
He's to unmute.
I know, I just asked him.
Can you hear me now?
You got it, Vin. Go ahead, Mr. DeMarco, go ahead.
Okay, I'm sorry. Does the state statute or regulation that you're referring to, does it require that the developer provide bicycle parking on site?
We can ask for that, and I think it does not, but we could ask for that, and I think the developer has accommodated us in the past and things like that. There has been talk about modifying the statute, so it does. I actually don't recall if that went through. Katie, do you remember? Or does it say anything about? But yeah, but Mr. DeMarco, we can ask for it, and I think that's not something that's difficult for an applicant to do, so I think that they would make an effort.
Wonderful. Thanks so much.
Thank you, Mr. DeMarco. Okay, with that, everybody, the applicant wishes to speak. Okay, so Mr. Pecora, if you would go ahead. Mr. Pecora?
Yeah, can you hear me now?
Yeah.
Okay. We listened to Beta, the traffic consultant for the town, and we provided 12 bicycle rack stations on site. I find it interesting that we're allowed to listen to all the traffic problems, but you're not allowing the traffic consultant to speak?
Because we're trying to keep it very much to the pre-application. We did let Mr. Canning speak, but we asked him to come back with a slightly different analysis and to look at what the as-built traffic would add, the safety of the kids. He was comparing it with what he did in his original traffic analysis was he did ITE numbers for a full-on retail shop for exactly what's operating there right now. And one of the comments that we made is there is very little traffic going out there right now. And I can tell you that because I see it just about every day. So we did let him speak, and normally we would not, Mr. Pecora, at a pre-application hearing, we would not have the traffic consultant present.
Understood.
It's just a very general strategic, yeah, you're headed in the right direction, which I think you've heard from the commission, sir. You're headed in the right direction. This is consistent with what we've been discussing relative to POCD implementation. And but there's some safety issues to consider and traffic. And remember that for the 830G, we can only ask you about the traffic in terms of safety, not in terms of congestion. The burden
well, you can ask about it, but I mean, depends on how you want to rule it, but you certainly can ask about it.
We can ask about it, but
I'm going to throw sewer into that mix too.
And sewer. We will listen to Mr. Canning in great depth when you return. We promise. Okay. Thank you. Okay. So Mr. Cohen, would you like to make some closing remarks?
Mr. Cohen, before you proceed, just one thing to add to the list of things to consider. On the landscape plan, there seems to be a good portion of landscaping that's actually off-site on the school side. If that's being considered, maybe a consideration of maybe some off-site landscaping on the opposite side in deference to the neighbors and the fact that the site's been clear cut. It might be something to explore.
Okay. Mr. Cohen, I'm going to ask you to unmute. Mr. Cohen, there you go. Hello again.
Yeah.
Okay.
Well, I'm sorry that this didn't work out very well today.
Oh, it's been great.
Particularly since, well, you didn't see me. I got a clean shirt. I mean.
Okay.
In any event, I don't really have anything else to say. We've gotten all of your comments. We understand where you are and what we have to do, and we promise to work with the commission in trying to get this accomplished. I think that's the purpose of this meeting, and we appreciate your input.
And I wanted to thank both you and the applicant for going to ARC because I see it as a courtesy on behalf of both you and the applicant. I know you would not necessarily have to do that under 830G, and the commission really does appreciate the effort in that regard.
Well, again, you know our client. He's done some very successful small-scale developments with affordable units, and he's hopeful of doing it again on the same level. I think that's what the town wants to see in terms of developing affordable housing, and that our client seems to be very good at it. So we'll keep working with you, and hopefully we'll come up with something that everybody is going to support.
Thank you, sir.
Thank you.
With that, you guys think we can get through the, we'll take a break after we do the next two items. We'll combine them if the applicant is willing. Everybody okay with going to trying to get a break at 7:30? Okay. Who's presenting, Mr. LaRoe?
It'll be Mr. Michael and Mrs.
Gabriella?
Yes.
I'm not finding her right now. Did you?
I see her.
Okay, I got Mr. Michael.
And I'll make them.
Are they doing their own slides?
Yes, ma'am.
Okay, got him. Hello, Mr. Michael.
Good evening.
Thank you. Good evening. Can you hear me?
Yes, we can.
Thank you, Madam Chair. Good evening, members of the commission.
Are we combining these?
Yes, I asked Mr. Michael, you didn't object. I said we were going to combine them. So let me just introduce it. It's the Town of Greenwich Department of Public Works for the Glenville Street and Glenridge Road to Weaver Street traffic improvement. It's for the MI as well as for the final site plan. And hearing no objection, we are combining these. Go ahead. I'm sorry, ma'am, if you would proceed.
Thank you. My name is Gabriela Sarcosta-Cohi. I'm a senior civil engineer with the engineering division of the Department of Public Works and project manager for this project. DPW is requesting MI approval from the Planning and Zoning Commission based upon the proposal to add an additional traffic signal at Pemberwick Road, which is considered.
Uh-oh.
Uh-oh, she lost her video and audio.
Mr.
Okay.
Improvements aren't necessary to the roadway. Pedestrian access, signal timing, and equipment, and just improve the overall safety while staying within the right-of-way. These improvements would benefit not only the motorists utilizing the corridor, but the businesses, pedestrians, runners, and bikers. The Glenville community deserves safe roadway crossings and connecting sidewalks to improve the village feel. Funding for this project is provided under the CMAQ grant program, which stands for Congestion Mitigation and Air Quality Program. Please keep in mind that this grant is not allowed to be split into phases. This program provides federal funds to the town, reimbursable up to $2 million. These funds are granted by the Federal Highway Administration and administered by the Connecticut Department of Transportation. The goal of the CMAQ program is to reduce congestion and improve air quality by reducing emissions to help meet the requirements of the Clean Air Act through transportation projects and programs at the local government level. This is completed by optimizing traffic operations, making geometric improvements, making pedestrian improvements while improving overall safety of the corridor. So unlike the Greenwich Avenue project, which was a streetscape project, this is more of a traffic operations project, and anything that falls out of the traffic safety scope doesn't qualify for reimbursement. Here's a timeline of how we arrived to this point. In recognizing the need for improvements through the corridor of interest, the engineering division submitted a grant application through WestCog in March of 2015, requesting the $2 million for this project. Included in this application was a resolution of intent by the first selectman to provide a local match to complete the project. February 2016, the grant was awarded to the town of Greenwich in the amount of $2 million. In the spring of 2017, the design consultant RFQ interview and selection process was finalized, with the design consultants being Malone & McBroom. Up to 2018, we were in a little bit of a standstill because the municipal master agreement, which needs to be signed in order to accept all grants and commence with the start of the design of this project. So in 2019, an authorization letter was issued by the state of Connecticut to proceed with a preliminary design. And then in January 2020, a letter was received to proceed with the final design. The project was approved by the Board of Selectmen in November of 2020. Up until now, we have been working very closely with Connecticut DOT, Bureau of Engineering and Construction, and the Office of Environmental Planning. This project is consistent with the POCD under Objective 5.7, where the goal is to decrease traffic congestion. Objectives 5.7, A, C, G, and L apply specifically to this project. And they are: develop an access management plan to improve traffic flow by reducing curb cuts and promoting cross access and shared parking, pushing vehicular traffic to signalized intersections. C, review traffic issues around all schools, particularly Greenwich High School, and consider ways to mitigate. G, continue to require redevelopment to address traffic congestion, improve traffic flow, improve traffic safety, and accommodate pedestrians and bicycles. H, maintain Institute of Transportation Engineers level of service of C as the town standard consistent with the scale and character of the area. And I, look for ways to reduce stop and go traffic movements, such as traffic circles or smart traffic signals. You will see in the following slides how we have addressed these objectives. A, relocating parking from Glenville Pizza to across the street and out of the intersection. C, improving traffic flow in the vicinity of Glenville Elementary School. G, address traffic congestion, improve traffic flow, improve traffic safety, and accommodate pedestrians and bicycles. H, maintaining projected level of service of C as the minimum at each intersection. And I, upgrading traffic signal equipment to be able to sync for continuous traffic flow. Under the Glenville and Pembroke Neighborhood Plan, adopted January of 2017, DPW has been assigned several tasks under the Transportation and Infrastructure section of this plan. Specifically related are: explore alternatives to improve circulation and safety for the Glenville Center intersections. Improvements to be identified in study of intersection improvements. Consider areas prioritized for sidewalks and crosswalks, including Glenville Road at Pembroke Road and at Glenville Pizza, Weaver Street, and Riversville Road south of Bailiwick. So the Glenville corridor, as accepted by the Connecticut DOT, includes the roadway on Glenville Street and Glenville Road from the intersection of Glenridge Road through the intersection of Weaver Street, including all intersections within the corridor roadways leading into it, with a setback of approximately 100 feet. Glenville Road and Glenville Street is an urban minor arterial roadway. It has approximately 18,000 vehicles per day. It is 1,500 linear feet long and has a posted speed limit of 25 miles per hour. Through this project, we are proposing traffic signal upgrades at all the major intersections through the corridor and one traffic signal addition. There are geometric improvements proposed as well. The Glenville corridor experiences heavy congestion, especially during the morning peak, due to commuter traffic using it as a connection from the Merritt Parkway, Hutch Parkway via King Street to Central Greenwich, as well as the 684 via Riversville Road, of course, under normal non-pandemic conditions. Additionally, schools generate morning peak hour traffic due to 2 private schools located in the vicinity and 1 public elementary school located on Riversville Road. The location of a major unsignalized intersection at Pembroke Road, which is located between 2 signalized intersections, creates further congestion. Specifically in the morning peak, as any vehicle attempting to turn left from Pembroke Road onto Glenville Road or onto Pembroke Road from Glenville Road causes a backup. Other issues include roadway geometry and sightline issues. There's a lack of pedestrian accommodation, sidewalk gaps, parking issues, and access management to local businesses. In March of 2019, a walk audit was completed with major stakeholders, which included property owners and business owners along the corridor. And following that audit, a project information meeting was held. During that time, we collected input from the public and listened to their concerns to find out where they felt the problem areas were located. This way, we knew where to focus improvements and create a priority list. There was a great turnout for this meeting, and we collected a lot of useful info and recommendations. This allowed us to proceed with an analysis. During this time, accident history and traffic counts were collected. We took into consideration proposed development in the vicinity. Traffic models were generated based on the collected information, and the models were calibrated so that a future projection of traffic could be created to model existing conditions and any future improvements proposed. In May of 2019, we held a second public information meeting, and at this time, 3 concepts were presented. During this meeting, we collected feedback from the public to be sure that we address the problem areas and get a feel for what concept was preferred by the majority. In September of 2019, a preferred corridor concept was proposed and presented, followed by a 2-week comment period. This preferred corridor concept included the least right-of-way impacts, with models showing that it will significantly improve the traffic operations and safety along the entire corridor. As you can see, the preferred corridor concept is a direct result of public input received at all the above meetings, with the final result being largely favorable. Regarding issues brought up separate from this project, we were able to make minor safety improvements through the use of modified striping and signage until this particular project is implemented. I would like to mention that this area is on the National Register of Historic Places, so we have been working closely with the Connecticut DOT Office of Environmental Planning and their National Register specialists. After the 3rd public meeting, Connecticut DOT and FHWA concurred that the impacts proposed were de minimis. Additionally, the Connecticut DOT Office of Environmental Planning issued a determination for the project to have no adverse effect on historic properties. So how do we know this is going to work? Based on the calibrated models, we looked at the future conditions for 2029, which isn't too far away. We looked at the conditions without improvement based on the model, and conditions with the improvements based on preferred corridor concept. This is done by looking at the level of service for each intersection. So as some of you already know, a level of service is a grade given to a particular intersection based on the amount of time it takes to wait in order to make a maneuver through that intersection. So for example, a level of service of A is a wait of less than 10 seconds, where a level of service of F is a wait of greater than 80 seconds. We kind of consider these like grades you would get in school, A through F in school. C is considered passing. And similarly, in the traffic world, C is considered standard and consistent with what you see in other intersections throughout other municipalities. So looking at the future conditions with no improvements, if we were to project traffic through the area of this corridor, the level of service goes from morning peak being the worst case scenario, with a level of service of F at Glen Ridge Road, a C at Angelus Drive, an F at Riversville Road, and Pembroke Road and East Weaver Street at an E. If we look at proposed improvements with the preferred corridor concept, based on the traffic models, the level of service improves to a level of C at Glen Ridge Road, Riversville Road, Pembroke Road, and a level of service of B at Weaver Street. So at each of these intersections, the level of service improves by 3 grades. In order to meet the goals in the POCD and to receive the grant funding, the level of service needs to be improved to at least a C or better. So this is the visual of the preferred corridor concept that was chosen and accepted by the Connecticut DOT. After the preferred corridor concept was decided, the consultant Malone & McBroom proceeded with a preliminary design. I'm going to go through each intersection to show you exactly what improvements are proposed. Starting all the way to the west at the intersection of Glen Ridge Road at the shopping center driveway, the changes proposed include widening the Glenville Street segment from the shopping center driveway to Angelus Drive to provide a longer westbound right turn lane into the shopping plaza while maintaining parking along the northern edge of Glenville Street. Currently, during peak periods, cars making that turn into the shopping center take up the parking spaces. Provide new sidewalks along the southern edge of Glanville Street in order to accommodate the widening. Realign crosswalks and reconfigure ramps for ADA compliance. Away from the intersection. Please note, no trees are proposed to be removed or impacted within this particular area. Moving east to the intersection at Riversville Road, the proposal includes on Glanville Street, extending eastbound left turn lane for Riversville Road to allow for a left turn into Angelus Drive and longer queue length. Extend the raised island on Riversville Road to better control access in and out of the gas station. Tighten the northeast corner radius to slow down vehicles negotiating the right turn lane, the right turn from Glenville Road to Riversville Road. Upgrade traffic signal equipment. Maintain the existing bank entrance only driveway at Riversville Road. Maintain but signalize the existing stop sign controlled bank drive-through. Reconstruct and better define the existing parking spaces along both sides of the east leg of Glenville Road. And also at this area, no trees are proposed to be removed or impacted. Moving east to the intersection at Pemberwick Road, the proposal includes install a traffic signal at this intersection. Widen Pemberwick Road to provide dedicated left and right turn lanes, as well as realigning the driveway away from the intersection so that it is a perpendicular driveway to Pemberwick Road. The widening of the eastern leg of Glenville Road to provide the required sight distance for a signalized intersection. Provide sidewalks and new crosswalks to improve pedestrian access at the intersection. The proposed traffic signal would require the relocation of the parking area in front of Glenville Pizza to across the street, since parking is not permitted within a signalized intersection. I would like to mention that those areas shown in bright green, called out as quote unquote fill adjacent to the sidewalks and curb line, don't necessarily mean that the area is going to be filled. Sometimes when you replace a curb or a sidewalk to the correct grade, there is some restoration or grading involved with topsoil to match the existing areas. As provided in your package and shown here are the locations of the trees proposed to be removed. The improvements in this area would require the removal of 4 trees and reinstallation of the trees. The 2 trees called for removal were the 2 new parking spaces proposed are black locust trees. The 2 trees called for removal on the south shoulder, moving west from Pemberwick Road intersection, are mature London plane trees. The tree warden has granted the removal of these trees contingent that there will be a replanting of trees at a 1 to 1.5 ratio. This would equal, in this area, a total of 6 trees of a size no less than 2-inch caliper, with the species and location to be determined at the discretion of the tree warden. Please keep in mind that when this project was originally presented to the Board of Selectmen, the plan called for the removal of a total of 11 trees located in the town right away. After some comments regarding the trees, we had our consultant realign and reslope Pemberwick Road in a way to reduce the number of trees impacted while staying within the design guidelines for a signalized intersection. I would like to note that the trees on Pemberwick Road will not be impacted and will be protected during construction. The majority of the widening is taking place on the western shoulder, with the curb line on the east side remaining in the same location, so to not impact the very mature oak trees. I would like to note that since the public meeting, we took into consideration issues that could be corrected immediately through existing maintenance budget and have since corrected some line striping for parking, added signage, and improved the parking lot on the west side of Pemberwick Road. 3 new trees with grass islands were recently planted and installed when making the improvements to this parking lot. Moving east to the intersection at Weaver Street, the proposal includes widening Weaver Street to provide dedicated left and right turn lanes, provide sidewalks and new crosswalks at the intersection, reuse existing traffic signal equipment and upgrade it. The improvements in this area would require the removal of 2 London plane trees and reinstallation of trees. The tree warden has granted the removal of these trees contingent that there will be a replanting of trees at a 1 to 1.5 ratio. This would equal a total of 3 trees in this area of a size no less than 2-inch caliber, with the species and location to be determined at the discretion of the tree warden. With the tree warden approval permitting the removal of this total of 6 trees, we are required upon completion of the project to replant at a 1 to 1.5 ratio. This would equal a total of 9 trees of a size no less than 2-inch caliber, with the species and location to be determined at the discretion of the tree warden. Once MI approval is received from Planning and Zoning, we will move forward with the final design and work with the tree warden on an overall comprehensive landscape improvement plan that enhances the areas after construction. As we proceed with the final design, we will continue to look at reducing the amount of pavement to only stay within what is required for site distance and turning movements. There is a very good chance that we may be able to get away with not impacting the trees on the south shoulder between Pemberwick and Weaver. If there's any possible way we can save any of the trees we have scheduled for removal, we will try our best within the requirements pertaining to site distance. DPW is proposing to install a street print crosswalk at all the intersections called for improvement. Street print was adopted by DPW approximately 8 years ago as a standard for decorative crosswalks to serve as a pedestrian safety and traffic calming measure. These crosswalks have been installed throughout town and can be found more recently around the Senior Center, Old Greenwich School, and Coscop train station. The product is highly durable, low maintenance, and does not fade, as did products used in years past. The product has a uniform color and has proven to hold up well against extreme weather and use, making it a more cost-effective option for the town. The Highway Division of DPW has recently started converting all the new striped crosswalks to a continental pattern, which is the type shown on the right. It is highly visible using thick vertical striping. Studies show that motorists are more likely to yield to pedestrians in continental crosswalks as compared to traditional crosswalks with just 2 parallel lines. During the project information meetings, street print was the preferred option by the public. At this time, DPW is requesting MI approval from Planning and Zoning so that we can issue a notice to proceed to Malone and McBroom with the final design, since we are currently in the conceptual phase. I would like to note that we are not required to obtain MI approval from the RTM. A capital budget request was submitted for BET RTM approval for the construction of this project for fiscal year 21-22, as we currently have the funding in place for the final design. During the last budget request, DPW was asked to reduce the scope of the project to only include the design items that would qualify for the CMAQ grants. The cost estimate of the preliminary design was initially $5 million. But after extensive review with our consultant and modifications to the original corridor concept, the scope was reduced to $3 million, which is still more than the grant amount, but what we need in order to meet the minimum requirements of the grant. With this being a Federal Highway Administration grant with Connecticut DOT oversight, there are only specific items that qualify for reimbursement, and everything outside of that would need to be at the town's expense as part of a separate project. Our goal is to have the final design completed next summer, with construction commencing in the spring. With that, I'd like to thank you for allowing me to present this project, and I would be happy to answer any questions you have at this time.
Does anybody actually, I wanted to make, I wanted to ask a couple of questions. The first one is something we discussed at the briefing. This concept that the tree warden would decide the location of the replacement trees. Katie, this is a site plan application as well. And I believe that it is within our jurisdiction to decide, or at least to work with the tree warden. I like the tree warden a great deal, and I'm happy to work with him, but I'm not sure that the BOS acted correctly in delegating that authority to him on a site plan. So I would say that I would happily work with him, but that I believe the commission should have input on the location of the replacement trees. Would that be correct?
Yeah, I agree with you that this is a site plan, and this, you know, obviously is the municipal improvement also. I mean, the tree warden has specific rights under the state statutes, and I think there was a bit of a confusion there. And in fairness to DPW, it understood that they were directed by the Board of Selectmen to go to the tree warden first. So this is not.
No, I'm not saying it's their bad. I think the Board of Selectmen didn't understand that the authority on the site plan is solely our jurisdiction.
Yeah,
and that
gone to the commission first, and then if it was determined that the trees were going to be removed, then that would have had to have gone to the tree warden to see if they would, you know, post them or what was going to happen. So you're right.
I think the happy answer is that we'll work with the tree warden to figure this out. I believe I mentioned yesterday that I would very much like to see a 2-for-1 replacement rather than a 1.5. But more importantly, Jim, are you there? Both of you, I wanted to ask both of you this because Mr. Costacoli, you haven't been at all the meetings on the Greenscape and follow the process, so I'd like to raise it with both of you.
Can we take down the screen?
Can we take down the screen thing so I can see? Yes, thank you. Good point, Katie. Hello there. So between the two of you, what we talked about yesterday was that in the POCD, there's another objective, which is to enhance the villages and enhance their character. And that is streetscape and trees and enhancing the historic nature. And I heard you say that you have obtained an opinion that what you're doing doesn't damage the historic nature of, but we'd like to enhance it. Is there a way that without slowing you guys down in getting these very much needed traffic improvements, because, and I'm not speaking anecdotally for myself, we heard a great deal from Glenville when we did the mill project about how terrible the traffic was and how serious the problems are. So I think this is a great thing that you're doing. I think Glenville will be appreciative when you're finished, but I also understand the concerns and the goal in the POCD. Can we work somehow that you move forward, but at the same time, in parallel, the community looks at streetscape? We recognize, Katie made it clear to us yesterday that you don't have funds for anything but the traffic improvements. So this would involve volunteer efforts, which we've done in other parts of town. Can we try to work parallel with you so that you can start the road improvements, but at the same time, we look at the tree planting plan with the input of the tree warden, as well as adding street furniture, other landscaping, I don't know, street lamps, park benches, whatever, that we're working that on a separate track that doesn't slow down your traffic improvement. I think I finally got the question out. So I give it to both of you. Mr. Costacoli, I know Jim Michael has been to a lot of the Greenscape meetings, and that's why I wanted to include him in the question. So go ahead, you guys.
Okay, I guess I can take it. That we'll see what we can incorporate. We can also work as potentially a separate little project on this. I know, for instance, when this past spring, when we had to repave the parking lot that's right there by the firehouse, we put in some pretty decent islands, and we put in some additional trees in that parking lot that never existed before.
Mm-hmm.
That was something that I worked with our highway guys and said, we need to add some greenery to these parking lots whenever we can. And so we put in some islands at the ends of the parking stalls, and added 3 trees already. There probably could be more at that parking lot.
And
it's a pretty small parking lot. So
the regs require 1 tree for every 10 spaces, just in case you want to keep that in mind.
Yeah. So
we've probably cut you some slack in the past.
So we're definitely willing to work when we can with this project. It's a very specific grant program, and we have our hands somewhat tied with certain things that we can and can't do.
So that was it. Well, what we were wondering is whether you could work it parallel. So you go ahead and do this, but at the same time, we try to get the residents in the community organized so that if they want to see some streetscape improvements, much like what we're doing on the Post Road, there's a fundraising effort. We get a plan with Mr. Kramer, Dr. Kramer, with the ARC, for example, who I would defer to on the landscaping. And I think we mentioned yesterday to really make it feel more that if we're going to lose trees now, that we start constructing a future that makes it tree lined so that you recover whatever you're losing, that in 5 or 10 years, you're really recovering what you're losing today. So you could do that. You could, it's because we're talking sidewalk here, and most of your improvements are in the roadway and in the right of way, correct?
Correct.
So as you go forward, you're not going to have to make the sidewalk decisions right up front. I mean, you can incorporate some flexibility if we can, and again, it's a question of funding. It may be that there's no funding available. This is a generous community, and all of us, I mean, a lot of people showed up for the planting of the bulbs on the Post Road. So you can work that. And are you willing at this point to consider a 2-for-1 replacement of the 6 trees?
Yes, definitely.
Cool. Oh, you mean I could ask for 3-for-1? Because I'll go there too. You agree too quickly,
Well, I mean, there might not even be a reason for the removal of a total of 6. We're still working with our consultant. Great. We are going to proceed with the final design, and there might be some way that we can save those trees. We're looking to save them.
I think if we can give people a better future that really conserves their Greenwich, people are going to be a lot more comfortable. It says, it's going to be painful for a few years, and it's going to be a mess, and your traffic's going to be really terrible while they're doing the work. But then on the other side of that, you're going to have something that you're proud of. Okay, so if we could do that, I'm good with my main question. Does anybody on the commission want to ask some questions?
Yes. Ms. Coley, can you bring up the bottom of Riversville Road, that detail?
One second, I'm driving here, so let me see what I can do.
Stay in your lane first.
Exactly.
That's close enough yet. Now, it's my understanding that the center island is being reconfigured. And it looks like actually the curb cuts, or the curb cut on the adjacent property along the river there is being closed in. Is that paved area or is it an area that could be green space?
Good question, Nick.
So in talking with the property owner,
the property owner, because they have concern with their delivery vehicles being able to mount that curb to deliver the gasoline. But we are working with the property owner to see what we can do to make it work for them.
Okay, what about the center island?
Right now we have it shown as, I mean, there's no, it's not final. We can add green space in there. That's definitely a possibility.
Okay, if for some reason it cannot be green space, could that be actually the decorative pavement?
Yes, definitely.
Well, but further to what Nick is saying, I don't know why you need to keep that median so narrow. I mean, right now, you're showing the existing median adjacent to what you're going to be putting in. Why can't you make it twice as wide and keep the roadbed the way it was before, which allowed for two-lane traffic? So that way you'd have a much larger green median there, which would mitigate the tremendous amount of asphalt there.
Well, there's two issues going on here. You have those vehicles making the right turn lane from Glenville Road onto Riversville Road. So we're trying to improve that turning movement to make it a little bit tighter so that cars don't swoop around that corner so quickly and speed up the roadway, which is a concern that was brought up at several of the public meetings. There isn't enough room to make it wider. We're also trying to accommodate the larger vehicles by placing, if you see in dark red, a mountable area for trucks and school buses to mount that curb. I'm sorry, to mount the pavement in that area, but also keep the smaller vehicles within the striped area between the median and the mountable.
Maybe you misunderstood what I said. The median has, you seem to have moved the median between the traffic on Riversville. The median, the existing, it looks like you've kept the existing median outline there. Is that correct?
Correct.
Okay, so why can't it be twice as wide as you're showing it? With the new median is about as wide as the existing one. But if you made it wider, it would really be quite a nice green element. Right now, this long, thin thing is not nice at all. So all you're doing is recreating something which is not nice.
Well, Jim, correct me if I'm wrong, but we're shifting it to the east, making it longer in order to accommodate the proper lane width, in order to have the right and left turn movements from Riversville Road onto Glenville Street and Glenville Road.
You have plenty of width here to figure this out. You have this red area which you're trying to use up, and also on the other side as well. So I think that the objective here, I just want to, it seems to me, should be to create a larger green space in the center, because repeating what is existing is unsuccessful. And this is something that I've talked with a lot of people in Glenville about, and everybody says the same thing. So,
Ms. Cohe, the location of the new island as proposed, that's actually creating a safety issue now, a new safety issue, right? It's solving that long sweep around the hardware store and providing a better width of lanes southbound off of Riversville. Is that correct?
Correct. I mean, and then also by shifting it over, we're creating the right and left turn lane and allowing enough queue space because during the morning peak, there is a long queue and the vehicles waiting to make the right-hand turn have no room to pass through, which is why we need to widen that area.
Okay. Quick question about the mountable curb. Is that going to be similar in detail to what we've seen around some rotaries?
Correct.
Low granite curb and then the brick paving?
Correct. It would be similar in color and style to what would be in the crosswalk.
Okay. I think as an alternate, if there's an issue with multiple curb on the opposite side at the gas station, that might be a great idea. Is actually replicated on both sides of the street with the green in the middle.
Mm-hmm.
Can you slide over, Mr. Michael, to the bottom of Weaver Street? The brown color, that's cut, is my understanding?
Correct.
So can it, how cut, it's reconfiguring the slope or just creating a better safety issue with the drop off from the roadbed?
A little bit of both. We are widening Weaver Street at that location. From the south to the north, you can see the dark gray areas. In order to accommodate that widening, that cut is required in order to match the existing slope and create a safe area.
Okay. And just another question about the traffic signalization. Starting at the bottom of Weaver, are they going to be interconnected and timed? You know, so if I turn left from Weaver Street onto Glenville there, will I be actually getting stuck at each one of the lights as I pass through, or is it going to be timed in such a way where they're all green going in the same direction?
Yeah, they will be synced with each other, so there will be continuous flow. The goal of this grant is so that vehicles aren't stopped and creating emissions waiting at one point for too long. Where our goal is to connect everything so that they're smart signals and allowing vehicles to pass through quickly.
Okay. Actually, one last thing. In the traffic studies that you did, was that taking into account that the mill was changing from office to residential?
Yes. Yes,
Okay.
we did have correspondence with them over concerns regarding the traffic.
Great. Thank you very much.
Thank you.
Thank you. Would you mind if we turn it to public comment, or does the commission, anybody want to ask anything else?
I could go and ask a few other questions.
Let's hear from the public, okay. And then we'll come back to you, Mr. Levy. I think Mr. Levy is a Glenville resident, so he has a great, you're Glenville resident, right, yes. Mr. Levy? Yes. The first speaker is Leslie Patrick, if you would go ahead.
Hi, can you hear me?
Yes, ma'am.
Hi, I'm Leslie Patrick, and I'm with the Greenwich Tree Conservancy, and I think it's a beautiful project, and it's going to really enhance the town. And I know there have been several modifications on the project, and I was just hoping that there's some way that you could modify it further to save those 2 plane trees along Weaver Street, especially since the project was, I was reading about the history of the project, and it was to improve the air quality as well. And I think by saving those trees would do a better job of, you know, keeping the air quality. And also, if you take those down, even if you put in 1 or 2 more trees, those trees won't be mature in 5 or 10 years. It'll be another, you know, 50 or 75 years. So I'm hoping that they could save those trees.
Okay. I think from what I heard, they are trying to save more of the trees, and we could always consider getting larger caliber, and to consider that. There are some downsides to that. Let's go on to hear from Greenwich Green and Clean. Sorry. If you would go ahead, Green and Clean.
I am unmuted.
Yes, ma'am.
Okay.
Hello, Ms. Hull. How are you?
I am thrilled with this project. Sorry about that puppy.
It's all right.
We get
babies and puppies nowadays all the time.
Yeah, everywhere. My office, where I spend a great deal of time normally, is on Pemberwick Road. And going home any hour, whether it's 4, 5, 6, doesn't matter. I'd like to stop at the supermarket and I'd like to use my neighborhood town. And it will sometimes take me up to 6 or 7 minutes to get out of Pemberwick Road to make that left turn to get to the stores. And it is not only not good for the environment, it's pretty terrible for people's psyches to be so frustrated. If you look at a map, people coming into Greenwich use Glenville as a shortcut. Yes. Anyone coming from the New York direction goes right through there, both in the morning and at night. And we really seriously need that light at Pemberwick. I have seen the children playing in the field, and it's much used. I'm thrilled to say that it's much used, wanting their pizza and not looking at the cars and just flying across the road. It is scary to go through the intersection at any hour, and I'm thrilled. And we will have more trees. I'm on the Tree Conservancy as well. We will have more trees when we finish than we have now. And some of those trees are not perfection. They're a bit scruffy. We will have plenty of beautiful trees. I have total faith in our tree warden. Dr. Kramer has good taste and is very knowledgeable. So I just wish to thank everybody who's been working on this because we need it. Thank you.
Okay, thank you, ma'am. Our next speaker is Mr. Stephen Bishop. Mr. Bishop is the chair of the Historic District Commission. If you would go ahead, Mr. Bishop.
Okay, can you hear me?
Yes, sir.
Okay. I'm glad to hear that the applicant realizes that this is a National Register Historic District. We have spent a great deal of our time reviewing various projects in this historic district. And we hope that every effort will be made to maintain the feel and the streetscape for this really important historic district in Greenwich. It's probably our only sort of post-industrial historic district in the whole town. And of course, the mill itself is a historic overlay. And we have reviewed, I can't tell you how many projects there, including the current one to change it to residential. So that being said, if anybody wants the HDC's opinion on anything, we'd be happy to look at the whole project or various parts of it that might be of particular concern for historic preservation. We are also concerned about the loss of the trees, but hopefully that can be reduced or replaced.
Okay.
That's about it.
The question will be how to incorporate your feedback. Okay, thank you very much, Mr. Bishop.
Okay, thank you.
Thank you. The next speaker is Francia Alvarez. Ma'am, if you would go ahead.
There are some slides there that I would like to have up. Patrick, thank you. And you can go to the next slide, please. My name is Francia Alvarez. I'm with the Greenwich Tree Conservancy. The Glenville Historic District joined the National Registry in 2007 of historic places. It is a primary example of the New England mill village, starting with a sawmill built in 1717. The name Glenville was for the area's valley or glen. It first appeared in print in the name of the Glenville Manufacturing Company in 1848. This setting was against a picturesque backdrop of wooded hills. The 2017 Glenville Pemberwick Neighborhood Plan states that traffic and pedestrian safety emerged as a significant transportation issue in the villages of Glenville and Pemberwick, as there is a great deal of high-speed traffic resulting from drivers cutting through this part of town, end quote. Unfortunately, with 18,000 vehicles traveling through this village on a daily basis, it is clear that something must be done to address the traffic issues, but not at the expense of community character. The plan goes on to say, residents are largely satisfied with the way their neighborhood looks and feels and want to preserve the existing character that defines this extremely attractive area of Greenwich. Landscape helps to define this neighborhood character, and in this case, it requires a landscaping plan. The purpose of the congested, can you go to the next slide, please? Patrick, thank you. The purpose of the congestion mitigation and air quality improvement is to fund transportation projects that will contribute to attainment or maintenance of the national ambient air quality standards for ozone, carbon monoxide, and particulate matter. There are two goals: improving air quality and relieving congestion. According to the tree warden's decision, there will be 6 trees that are coming down. Can you change it again, please, Patrick? Thank you. We all know the urban forest can mitigate the health effects of pollution, sequestering CO2 in their roots, trunks, stems, and leaves while they grow, absorbing pollutants like ozone, nitrogen dioxide, and sulfide dioxide through the leaves, intercepting particulate matter, releasing oxygen through photosynthesis. It seems ironic that with a goal of improving air quality, the town would be taking down any trees. As an example, 18,000 cars traveling on a 1-mile road per day release approximately 5 million pounds of carbon monoxide in a year. Therefore, mature trees should be kept, and many, many more trees need to be planted in our urban forest to achieve the goal of improving our air quality. The next slide, please. Thank you. It is the GTC's understanding that with the roadway expansion, Glenville Pizza will be losing 2 parking spaces. So 2 additional parking spaces have been added across the street, but this will cause 2 large trees to come down. With a new traffic light and crosswalk providing increased traffic safety, which is what everyone wants, the GTC doesn't understand why the Glenville Green parking lot could not be used for the stores just across the street. This would save the 2 trees and not back up traffic with residents navigating into a parking space just before a new traffic light. In the latest GIS visual overlay, can you go to the next one, please? Thank you. The fill no longer edges the roadway, but let us remember that any fill over a tree's roots may damage this beautiful corridor of trees along the playing field. Also, there does not seem to be any mention of what type of sidewalk this will be. We have lost many trees in town to granite curbing. This sidewalk needs to be made of a pervious surface, and all roots must be protected from injury when placing any fill and adding a sidewalk. Using best management practices and with the help of the tree warden at the installations that can be achieved. Next slide, please. At the most current, in the most current visual, it does not show exactly which trees are to be removed and how the remaining trees will be protected. Even though it shows trees on the map, there is not a landscaping plan there that shows which trees are actually to be protected and which are not. So the public can know to the full extent of the plans and how they will affect the community character. And finally, the Glenville Green is a contributing historic resource which will be reduced by widening the road. Given that trees are part of the historic landscape as designed and designated in the 2007 information, the GTC does not think this project as designed is consistent with the community history and character. Thank you.
Thank you very much, ma'am. Our next speaker is Peter Malkin. Mr. Malkin, if you would go ahead.
Thank you very much. The trees that are going to be removed, contrary to what Mary Hull has said, some of them are major.
Oops. I'm sorry, Mr. Malkin. Something goofed up in allowing, and there you go. You're all set. My apologies. Okay. That was my error.
I'll start all over again.
Thank you, sir.
some of the trees that are proposed to be removed are major trees that are 30 to 40 or maybe 50 years old. And the trees that are planned to be installed, whether it's 2 or 3 caliper, will take 10 or 15 years at least to come back up to the trees that are there, maybe 20 years. If the sidewalk were to be moved down toward the playing field, instead of running along the street, it might not be necessary to remove the trees that are scheduled to be removed, and it could avoid damage to the roots to the trees that will not be removed and will die as a result of the curb cutting and the curbing and sidewalk being installed next to the road, between the road and the trees, instead of behind the trees, where there seems to be ample room for the sidewalk, and it could remove the need for removing any of these trees. So I would appreciate it if planning and zoning would explore the possibility of relocating the sidewalk away from the roadway, and instead in the park area, which is not used, would not be taking away any of the playing fields, and it could possibly save all of the trees that are there. Thank you.
Thank you very much, Mr. Malkin. The next person needs to identify themselves as they come in. 051684, would you please just tell us who you are?
Karen Matronich.
Hello. Okay.
Hello?
Yes, if you would go ahead. Yes, ma'am.
Okay, this is Karen Matronich. I'm a resident of Glenville. I actually live on Pembroke Road, right in the neighborhood of the Civic Center and the intersection that's under discussion. So one, I'd like to start by thanking Gabriella and her team for the work that they've done. I also want to tell her I very much appreciate the modified improvements that the striping made. I really appreciate her response to that request, and even pre-COVID, it had an impact, and it still has an impact. I also appreciate the efforts to preserve the trees, and that is my big concern is the impact that this design and the widening of these roadways will have on the streetscape. So I have two specific questions. The additional parking or the new parking that is being provided for Glenville Pizza across the street. One, if that parking were not provided, would the 2 trees there remain? It seems to me that the only reason those 2 black locusts need to be removed is to create parking spaces. And those parking spaces seem redundant because we now have a beautifully refurbished parking lot adjacent to the green, which is just steps away from the pizzeria. So I would really like to see use made as much as possible of those existing pathways, and not every walkway does not need to be paved concrete with the granite curbs. So there are a lot of pathways in that green that already lead up to the corner. So I'd ask that some consideration be given to using them, and the additional parking on that side of the street seems quite redundant to me, and it would be terrible if trees were removed just to accommodate that parking. The other question has to do with the widening of Glenville Road, where the plane trees currently are. I just would like to understand better what the elevation change would be. Currently, there is a pathway in that park area that is below the trees. I walk.
Oops, ma'am. Ma'am?
It's considerably lower. Can you still hear me?
Yeah, you faded for a sec.
I'm sorry, a phone call, an untimely phone call came
okay.
in. the pathway that currently exists beneath those plane trees puts the walker, puts the pedestrian quite a bit below the roadway. And so it helps enhance that park-like feel. And I don't know if that's something that, I don't know what's contemplated in the existing plan, because it's very hard to understand the elevation changes. So that, again, to keep that the park feel, I hope that pedestrians aren't put up there with all of this traffic. So just in concluding, I really appreciate, Margarita, your comments about a separate streetscape plan running in parallel for the community to look at. And I would very much like to offer my services, whatever they may be, to be involved in that. So
it's more than looking at it. We're looking to the community to build it. So
well, but it has to start somewhere. So
with you guys.
Right.
Yep. Okay. Thank you very much for your comments. Should we ask DPW to address those questions now, or do you want to catch everything when the public's done? We've got 2 more speakers.
Let's finish with the public.
Let's hear. Let's say we can finish with the public and.
Okie dokie. You're going to remember all the questions. The next speaker is Joanne Messina from the Tree Conservancy. Ma'am, go ahead. Okay, go ahead.
Thank you, Madam Chair, and thank you very much, DPW, for an excellent plan, and also for our previous concerns and changing the plan accordingly. I won't be redundant, but I just want to reaffirm everything that was said previously by my colleagues. In addition, a couple of things. One is that the London planes are really what we are concerned with. Those are the ones that really help with mitigation. Those are the ones that are along the field, which is where children are, and that's what really assists. We can't really plant trees that are bigger than a 3.5 caliper and really expect that they're going to survive. So what these trees, these London Plains trees are doing now is just really, really important. I also, just to say, if in fact this continues through, I would love to see the trees be the last thing to come down before any project begins. The lot that Jim Michael spoke of, the Greenwich Tree Conservancy was involved with that greening of that lot and with assisting with those trees being planted in that lot. We would continue to assist if need be to plant trees in that area. Going down to the Riversville Road turn, I think that is really key, and thank you. And as one that goes into that doctor's complex often and almost gets rear-ended each time, I think that's a really important improvement, and thank you. I also live downtown. I come through this area daily, so I understand the concerns. The only other is to again restate the fact that we don't need granite curbing everywhere. We don't need straight sidewalks everywhere along the street. We can be a little more creative, especially in an area such as this, where there is a field and there is a civic center, and we can be more creative. And that goes to Madam Chair, your original statement about a greenscape plan. And I would love, we the Tree Conservancy would love to be a part of that.
Great, thank you. That's wonderful to hear. Anything else, ma'am?
No, thank you.
Thank you. Our next speaker is Vin DeMarco. If you would go ahead, Mr. DeMarco, whenever you're ready.
Okay, I'm unmuted.
Yes, sir.
Okay, thank you so much. Thank you, everybody. Thank you, DPW, for working with the community, working with the commission, other departments. I think this is a great process that it's turning into. And it could be a model process, I think, for other reasons, not just trees. There's also an effort going on right now to try to make Greenwich more bicycle friendly. And while I heard Gabriella talk about it, the project perhaps helping to make it more bicycle friendly in the Glenville Center, I didn't hear any specifics. So I'm not sure what measures they would want to use, but many people use, particularly children, bike down to the field, to the civic center. So there's a lot of recreational cycling going on, not necessarily the spandex recreational cycling. So there's off-road kind of cycling going on the paths and all of that sort of thing. But in terms of it being a transportation mode, many people feel that Glenville, even after doing this project, okay, maybe we're going to end up with a level of C and LOS of C for a period of time, but that doesn't, once people get wind that it's easier to drive through Glenville now, it could very easily mean that there's going to be more traffic coming through Glenville. So what I'm suggesting is that in keeping with the goal, another goal of the POCD, goals of the Pembroke Glenville plan, in trying to make bicycles a possible transportation mode, that we consider how we can do that without having to go through building more lanes or dedicated lanes, by using sharrows for the first time in town. Many other municipalities in neighborhoods or small downtowns like Glenville use sharrows on their roads, and in particular in this case with the turn lanes, that's where you would expect to see sharrows, and it would give the perception, not just the perception, but it would kind of speak to the commitment of the town toward a more bicycle friendly area, and could be a model that other parts of town might employ, but also be able to help people with a mode that they could possibly use to get in and out of Glenville Center.
Okay. Thank you very much, Mr. DeMarco. I believe, oh, wait, somebody else just raised their hand. I'm trying to figure out who that is. I'm not finding the person. Why aren't they at the top of the list? Oh, I guess they lowered their hand again. If there was someone else who wanted to speak, please raise your hand, because when I went to look for you, it was gone. Okay, I think they lowered their hand again. That's it for the public comment. Do you want to address the questions? Do you go by Sir Costa Coe, or just, I heard Nick calling you Coe?
My last name is Sir Costa Coe.
So we should call you Sir Costa Coe. Nick,
yes, please.
You goofed it.
I know,
okay.
I have a hard time saying that.
Well, ma'am, would you go ahead and answer the questions that were raised?
Jim is going to chime in. Thank you.
Okay.
I'll try and hit on them all. So we're really going to try to save the trees. Gabriella keeps yelling at me because I keep telling her don't totally commit to saving all these trees, but we're about 99% sure we can save at least the two that are closest to Weaver Street. So now we're down to really only 4 there.
Those are the planes, because that's what the tree.
Those are a couple of the planes. So we're about 99% sure that we'll be able to definitely save those. And there's a good chance we might be able to save 2 more in that same stretch. But until we get further along in the process, we won't know for sure. We don't have a problem talking to the Historic District Commission about this. That's something we can have a little side conversation with them. The sidewalk, if we move the sidewalk, some places the sidewalk is adjacent to the roadway. I know a few comments came up about the pathway near the park by the Civic Center. That sidewalk's pretty much going to stay in the same location. It's not really going to change much, especially with our reconfiguration based upon some of the cuts we've made. So it's also going to stay the asphalt walk. So that will not really impact the trees too much, even the ones that are, you know, all those that are going to be staying there. So it's going to be separated from the roadway. It's going to be down kind of below the roadway. So that's all going to kind of stay more or less the same there. We're even looking to see, do we need to rebuild it or not? And so that would be helpful. We definitely would want to, if we're doing this project, keep up with, you know, keeping the condition better. So we may just be replacing that. The parking at the Glenville Pizza, I just want to emphasize, yes, it's for Glenville Pizza, but it's, you know, it's on-street parking that currently exists. It's not, we try not to emphasize that parking is specific for a specific location, so that people don't get the idea that it's reserved parking just for Glenville Pizza. So we are trying to maintain that there are 2 on-street parking stalls in this area and maintaining those 2 on-street parking stalls. I think that if we've heard as many people say that they want to make sure no matter what we do with this intersection, we don't impact the pizza place. And so as we have heard that maybe there's another place to put that parking. So we've tried to come up with a decent compromise here with maintaining this, and we will continue to look at this as we move into the final design. One thing to note also is the traffic level of service C is based upon, as Gabriella mentioned, the 2029 projections, not today's traffic. Those 2029 projections have a 2% increase per year built into them. So ultimately, if we get this project completed in the next couple of years, the traffic level of service will be even better. It'll probably be more like a B, you know, a B time, you know, in the beginning. And as it starts to, traffic increases, that's, you know, more of an issue. So bikes, we're looking at ways we can try and incorporate bikes in this area. With the historic district, it's something we do want to make sure we try to also think about with pavement markings and not making it look too different than what's out there today, but it's definitely something we can look to address. So as we move forward through the design.
Okay. Do I have any comments from the commission?
I have a couple of comments.
Okay.
I have a question about the.
Okay, Peter Lowe, if you wouldn't mind, Peter Levy spoke up first.
I'm sorry, I had my mic off. Sorry.
Okay.
Okay. I wanted to ask about this Pemberwick, sidewalk on Pemberwick. It looks like you've redirected the existing sidewalk in front of the Benheim Center so that it goes up to the roadway when it seems to work perfectly well being set back from the roadway. And I'd like to know if you could reconsider that change because again, it's that campus effect that I'm referring back to. And I assume that there's no trees in this immediate area in front of the Benheim Center that's being impacted, because I didn't hear of anything. But again, it would have been, I think the more I look at this, the more I would like to understand exactly where those trees are that are possibly impacted, because of you don't include the the existing trees on here. Some of the features of the roadway that you've included is you've created these you've widened Glenville Road and some of these other places, and you've created some yellow striping to widen the road. And I was wondering if there's anything you can do to keep the road as narrow as possible, because one of the things that make this this historic townscape something that still exists is the kind of that these roadways are not very wide. It is more country. The more you widen them, the more urbanized it becomes. And that's not the intent here. If we're concerned about this historic district, then the roadways are as fundamentally important as anything else that we do here. The trees, some of the trees, especially in front of the Benheim Center, are closer to 100 years old, not 40 or 50 years old. These roadscapes are extremely important. You're widening the intersection at was it Weaver Street? The turning radius, it becomes quite round, and I'm wondering if anything that you can do to reduce that curvature and make it a little bit more not so soft. One of the things is we want to encourage people to not go quickly, and by making it a nice soft curve, the speeds can be increased. The other thing, which is something which I'm very sensitive to, is the crosswalks themselves. They are have become particularly long at this intersection. And at the moment, they're really pretty easy to cross. Now, when people cross here with their families and dogs, at the moment, I think there may be like 25 feet at the most. I think they're, you increase the distance quite a bit. And these long crosswalks make for a considerably more time to cross from one side to the next. And I just think in a town setting, this village setting really is really what we're trying to have a feel for. Some of these crosswalks are getting really a little bit lengthy and too long, and not very pedestrian friendly. I think that this one going across Weaver Street, I'm not exactly sure why it has to be at an angle, but maybe it doesn't make any difference. But it is very long, and I don't think that is pedestrian friendly at all. And these issues exist all along the way here. I understand you're trying to make increase the turning lanes. You're trying to create a turning lane going down Glenville Road so you can turn onto Pemberwick. And therefore it's 30 feet wide plus the aisles. But it's changing the character of this little hamlet.
So what
to have to do this. So not that it can't be done. I'm just very, very protective of the way things are. And walking 30 feet as opposed to 22 feet or 24 feet or whatever it is a big deal. This is not Greenwich Avenue. And these crosswalks that you've created seem to be extremely wide and don't have a lot of character about being in this nice little hamlet setting. So I think that the scale of the width of this is also something you should look at and consider, that you don't need it to be as wide as a car when a couple of people are walking across it. I think that there should be some sensibility about it. But I think that one thing that might save you a little money is not doing this extra bump out in front of the Benheim Center for the sidewalk, and just continuing just using the existing sidewalk in front of the center. And I could go on because these issues persist along the way. I think that this green strip that exists right now at the bottom of Glenville Road is completely inadequate, and should be at least twice the size as it is in order for it to have any real substance impact, beautification, and I think you have plenty of space there in which to do it. I think you should really consider that. Plus, this sidewalk that you're putting in is, again, very long, and anything that you could do to decrease the length of that, by making the median larger, it's a place to stop, in fact, if you get caught in the traffic. So I just thought just wanted to mention those things again. And
can I make a couple of comments?
Yes, go ahead, Peter Lowe, you're next.
Just to slightly be the devil's advocate to what my colleague just said, it seems to me that it might be that the traffic calming measures, including the existence and the widening of the medians, it might help maintain this village or non-urban feel. My understanding is that design is intended to help, crimp those intersections to reduce the speed of traffic, to slow the pace down. So that's just one thing that occurred to me while Peter Levy was speaking. And a second issue with regard to believing that it's possible to save more trees, is it safe to assume that this possibility incorporates the potential detrimental impact of the surrounding construction? So in other words, okay, maybe we can save more trees, but have we taken into account, okay, we're going to try to save this, but the proximity of the construction may not be successful. So just for what it's worth, that's a kind of an open-ended question.
Okay. We have one more person from the public who wishes to speak, and I'm gonna go ahead with that. Susie Baker, if you would go ahead. Ms. Baker, you're gonna, there you go. Try hitting the, try unmuting again. You unmute, there you go. Okay, you're good.
Thanks, Marguerite. I really appreciate all the effort and perspective that's gone into this, and I enjoyed the presentation, and I'm grateful for the salvaging of as many trees as possible. And I know everyone has spoken on that. I was just listening to Peter Levy, and I was really appreciating his concerns because of the terms of urbanization of this intersection, which is an historic intersection, and terms like loss of the feeling of the village and the hamlet. And I'm just wanting to support his thinking a little bit based on what we went through in Old Greenwich at the Rotary in front of Perrott Library and at Binney Park. And it looked as if it would be this huge urbanization project. And it took a couple of years of going back to the drawing board to say, hey, we have to pull back and try to preserve the historic perspective and of this little intersection, which is the similar intersection with a lot of traffic and several roads going off. So I just wanted to tell Peter Levy that I'm certainly appreciative of his thinking, and I know he lives there, and he's, you know, he's passionate about it. So maybe there is some going back to the drawing board that needs to be considered in view of people feeling it's too urbanized. So that's, I just wanted to add that, Marguerite. Thank you.
Thank you very much, Ms. Baker. Okay, that's it for the public. Oh. Okay, it's better when people always, okay, Alex, Pop, and folks, we keep trying to wrap up and more people raise their hands. If you wanna speak, it's really better if you get your hand up immediately. Okay, go ahead, Mr. Pop.
I'm sorry, I got here late, so I was driving.
Okay.
But I did hear Peter Levy's presentation, what he said, and I totally agree with him. I'm a lifetime Pemblewick Byram resident. I grew up on Pemblewick, and I think maintaining the character of the neighborhood in the pedestrian-friendly areas, I would support what Peter said, and I just wanted to, make sure that, we have a couple of residents that are speaking in favor of maintaining the character of the neighborhood.
Yeah,
and I'm hoping that this went in front of ARC. I'm not sure if it did or not.
Well,
thank you.
What we talked about, Mr. Pop, and I'm going to reiterate, is whether we could work with DPW to have a task force of residents that simultaneously works on the character side of this. Now, from what I've heard from them, the road widening itself they see as necessary to alleviate the congestion, but how the trees are placed and what can be done to enhance the village, whether we could run a parallel project. I'm repeating this because you may have missed it when we discussed, and they agreed to that. And we would love to have your participation as well with your background. I'm gonna now go back to DPW.
Okay. Thank you.
Thank you, Mr. Pop.
I appreciate it.
And I'm gonna go back to DPW for your comments. And I actually, hold on a second. Does anybody else in the commission want to comment?
I just wanted to say a couple things. One is this started as, and it's been on the table for 3 years, about alleviating the traffic congestion. And clearly the current traffic is level of service of F. These proposals make it to a C or better. I think that the comments about keeping the character of the town, the Glenville area, is important, but there needs to be a compromise, because we've listened at numerous other public hearings about how bad the traffic is in this area. And we have a plan to alleviate that. And I just want to make sure we understand what the end game is, and do we really, everybody feels this traffic really needs to be impressed. And I think we need to tweak the current plan to keep, the character. But when you add traffic lights and widening the road, inherently you lose some of the character. And I think we have to come up with a balance between the character And what the POCD requested, we fix this traffic in this intersection. And I don't want to lose sight of that.
So I'm sorry, are you saying that you endorse the traffic, going ahead with a traffic issue, or that you think this design should be revisited?
No, I think there are a couple of things that need to be tweaked. You know, one of the comments about the on-street parking, I think, is a legitimate comment. I think the links and saving as many trees is important as possible. I think coming up with a long-term plan to plant trees, we have tree, you know, we lose limbs every year. We just need to keep this project moving forward.
Okay, so you would keep it moving, you would move it. I'm just not sure where you're coming out. Do you want DPW to come back, or are you satisfied?
I'm comfortable.
Okay.
The way it is with some minor tweaks.
That's okay. So we would ask them what we would do if we decided it would be, we would condition the approval with certain, that they look at certain things that people have raised.
Yes.
Okay. Does Mr. Hardman, do you have any comments you'd like to make at this time?
No, I don't have anything to add. I think it's been a good discussion, but I think there's a way forward here, taking Peter Levy's comments, and but I think the spirit that Andy's expressing is exactly where we need to end up.
I agree. So the question then is, what we would like to see DPW do with this. Say we move it forward now, what we would like to see them do with it as Andy tweaks. From what we've heard tonight, a 2-for-1 tree replacement, an effort to save all the trees, especially the significant ones, a 2-for-1 tree replacement, a 3-inch caliber would be preferable. We heard Ms. Messina say that over 3.5, that 3.5 is not as sustainable. To look at the width that is being achieved and whether it can be reduced in the roadway anywhere and still get the traffic improvements that you're looking for. Because I think Andy made a really important point that we're forgetting tonight is we heard from Glenville loud and clear when we did the plan, the neighborhood plan, and also when we did the mill. We know that level of service is a huge problem there. And we know you guys have to address it, the residents do. But at the same time, they want to keep their community character. So could we ask that you work with maybe a committee of the commission and staff, and we formulate a plan for how we're going to go forward with the community character aspect? I think that might be, would that work, Katie? If not just staff, but we start some kind of subcommittee that address this. The people who've spoken tonight, Vin DeMarco, Susie, the Tree Conservancy, could work with DPW. I would see P&Z having minimal input, but some guidance from either you or the commission would be necessary to make sure that we don't stray off the path. How does that sound?
I mean, it sounds great in concept. Let's just hope we can all come to an agreement and find the way. I mean, even just this discussion now, you've got divergent points of view. So I think we just have to be careful there. I think, you know, understanding that if everyone's understanding that this, you know, the parameters of this project, I mean, that was described in the beginning about where this grant is coming from and what the limits are. And so if
there's no money for the streetscape improvements, that's very clear that it has to come from the residents.
I wasn't even referring to the streetscape though, really. I was referring to Peter Levy's comments as they are, you know, may or may not be adjusted within the parameters of that federal grant relative to road.
I think.
So, I get you. So maybe what you're suggesting is making the improvements to the streetscape to offset the roadway improvements that are basically required.
I don't think we should. I think what everybody's saying, that what I heard Andy say, Nick said it, we can't sacrifice the traffic improvements because we know how important they are to the community. And the fact that those people aren't here tonight, what we do normally see is that people come when they have concerns. The folks that are happy with the idea aren't here. And we heard loud and clear when we did the mill and when we did the neighborhood plan. And Peter, you remember, because you and I were both on the commission when we did that neighborhood plan. And we heard it. People were really unhappy and they want to move more quickly through those intersections. So if we could set that up, that we work together and that we work parallel so that you can go ahead and modify, you know what's important to the community, and you modify, and we just make a commitment to work on this together. Does that work?
That works, okay. Yeah.
And Katie's right, where there are going to be some bumps, but hey, we got the Post Road one started, so I'm feeling optimistic.
Madam Chair, I think actually one
yes,
of the
Mr.
things one of the things we did here in the presentation from DPW was that there was, correct me if I'm wrong, at least 3 community outreach meetings.
Yes.
I think if you're talking about streetscape and impact on the village character, it's getting those people involved as well, because they have,
yes,
those people who went to those meetings
yes,
have a lot invested in here.
Yeah.
And this is, as it's labeled, is the preferred concept. And it seems that actually everybody has come to an agreement on this particular layout as we see it presented tonight. If there's something that's going to happen in the future, you know, involving those people as well, because they seem to be, you know, the real stakeholders.
Yeah, and unfortunately, when Mr. DeMarco spoke, he raised the Sharrow issue and the safe cycling issue, but I think I'm hoping, I know that both he and Andrea Bloom are here tonight, that they would take charge of this as being co-heads of the neighborhood association. That's really who should lead this and getting the community input and working and moving forward. We can't put that in our decision, but I know they're listening and that would be the expectation. So with that, if that's what we're going to do, and Mr. Levy, that they would address your concerns to the extent possible, I think that they have to get the traffic improvement in order to get the CMAQ funding. If they give a design that is halfway there and doesn't widen the roads and improve the level of service, I think that was Katie's point, we don't get the funding.
Correct.
And so the trade-off that we're making is, we want the funding, we want to improve the traffic, and we're going to try to recover and compensate, but the community's going to have to work on this. Okay, with that.
Just before we move on, just a quick question for Gabriella and James. With the funding, the plan that we're seeing here, has this been submitted
to CMAQ?
To CMAQ already?
Yes, we have probably quarterly meetings with Connecticut DOT officials on this project to go through our progress and present it to them. We had to submit a 30% design to them in order to be able to proceed forward. We've received that approval from DOT to move forward with our final design. And now we're going through our steps through the town process.
Okay.
Okay, great, thank you.
Okay, are you, is anyone in the commission uncomfortable with closing this and moving on it? Please speak now.
Well,
nope.
I just want to get a little clarification. So the question is, what things might be able to be worked on? So maybe some of these
Don't make any promises, Gabriel.
crosswalks can be modified somehow, figured out how so they're not so long. Maybe the radius of the right turn from Glenville Road onto Weaver might be able to be modified somehow. I don't know. I'm just wondering. You know, there's the road bed itself. Are there ways that there's many ways to skin a cat here, and it seems to me that with a little thought about some of these issues, we can modify some of these things and maybe not have such a generous road bed. So that's what I'm interested in hearing.
I think just to quickly address that comment, we have been looking at this. We've had about 6 iterations of these plans, including multiple turn lanes and so forth. We've knocked it down because we've understood that there is a community character piece here that we want to try and maintain. I think also looking at the exhibits, they may look a little bit more intimidating than what they are. For instance, along Pemberwick Road, we're able to pick up the turn lane in both directions there. And we really, at the intersection of Glenville and Pemberwick, we're not adding any pavement there. It's literally about a 2-foot at the most widening on Pemberwick Road. And that's just in a very small sliver stretch. It goes from 0 to 2 feet. And that's just for a little bit extra length of the turn lanes. And also all those trees that are out in front of this Civic Center, they're all remaining. We're keeping the sidewalk on that side pretty much looking the same with the grass strip and so forth.
Why did you make a modification? I didn't quite understand why you modified the sidewalk there.
So because of the signalized intersection, in front of the Civic Center between the driveways, we modified the driveway location on the northern driveway coming out of the Civic Center parking lot. And in order to do that, we had to make a minor modification at that intersection in addition with putting the signal in. Out in front of the Civic Center, we're not changing the sidewalk between the 2 driveways and beyond.
Oh, so, but because the sidewalk doesn't go to the street in front of the Civic Center.
There's currently a crosswalk going from the Civic Center to the parking lot on the south end of the, near the south driveway that currently exists, and we're kind of maintaining in that same location.
But there's an area of where the entrance to the Civic Center has a sidewalk on either side, and as it goes down Pemberwick Road, the sidewalk continues along the road. I don't believe that's existing.
That is existing.
That's existing?
Yeah, that's existing out there.
Oh, so it does go along the road.
Correct. Yes.
Okay. Because I walk that every night, and the sidewalk goes straight all the way through to the driveway of Bentheim, and then I cross over and then walk through, walk down the sidewalk going below, walking below the road.
Right, I'm looking at the street view. There's a sidewalk on in front of the Bentheim that goes practically into the mill, farther down in front of the Bentheim and through the playing fields. There is no sidewalk on the other side. It's just a crosswalk from the Bentheim into the park and proceeds through the middle of the park. But I guess as part of the plan, there's going to be a better sidewalk on the opposite side of the Bentheim in the park. So it can continue down from the center of Glenville to that point. So I think that's maybe what you're talking about. But I think if I understand Mr. Michael, that's actually not being widened or anything. That sidewalk is actually approximately where the existing curb line is now. Is that correct?
That's where the roadway is not being widened there. The sidewalk would be added in that stretch, and that's partially to allow people to park in that parking lot, that shared parking lot for the Civic Center and so forth, tie into the sidewalk up on Glenville Road, helps to improve walkability, et cetera, connectivity of the sidewalk network.
Great. Okay. Thank you.
How much is it being widened at the Riversville intersection? How much is Riversville Road being widened?
Riversville Road, I do not believe is being widened at all. If anything, I think it's actually being narrowed at that intersection to slow traffic down.
That's where the mountable curb is?
Yes.
Thank you.
Okay. Peter, does that address your concerns?
I guess I'm a little confused by the, because it's just simply not the way I remember it. But so I still don't understand the walkway, the sidewalk that goes in front of the Benheim Center, and it continues all the way through in a straight line. It doesn't, right now it jogs out to the street and out along the road. But it doesn't do that right now. The sidewalk goes straight.
I guess so. Okay.
So the question is, if it, are you or are you not modifying that sidewalk?
Mr. Michael, would you answer that, or Mr. Costacoe?
I'm confused.
The sidewalk in front of the Civic Center, we're not planning to make modifications to between the two driveways on the Civic Center side.
And you say that the way you've drawn it is accurate?
I should hope so.
It's based upon our topography, yes. Survey that we had done.
And if you pull up Google Earth, it's very clear it's there now.
Okay.
Okay. Mr. Levy, does that address your concerns, and are you amenable to voting on this tonight?
Yes.
Okay. With that, I believe everybody has agreed to closing. Am I correct? Mr. Hardman, Mr. Fox?
Yes.
Okay.
Yes.
And Mr. McRae?
Yes.
Good. Okay then. So with that, Mr. McRae, would you kindly put a motion on the floor?
Okay, we have to actually do two here. One would be for the MI and one for the site.
Yes, that's.
We'll start with Glenville Road, from Glen Ridge Road to Weaver Street, Municipal Improvement, PLPZ 2020-336. Whereas the applicant seeks municipal improvement status to make major redesign of the intersections of Glenville Street, Glenville Road, from Glen Ridge Road to Weaver Street. At a meeting held on November 12th, 2020, the Board of Selectmen unanimously voted to approve the referral of MI to P&Z in accordance with section 699A2. As indicated in the 2019 Plan of Conservation, the proposal is consistent with guiding principles 4.21, 4.3, and 6.2, I believe it is. Therefore, motion to grant municipal improvement status in accordance with section 99A2 of the town charter.
Second.
Okay, all in favor?
Aye.
Aye.
Okay, I've got Hardman, Fox, Levy, and McRae, and Albin is also aye. Mr. McRae, could I have a motion on the site plan?
Okay, Glenville Road, from Glen Ridge Road to Weaver Street, final site plan 2020 335. Department of Public Works says apply to make pedestrian and safety improvements to the intersections of Glenville Street, Glenville Road from Glen Ridge Road to Weaver Street. Commission finds that an MI has been granted by the Planning and Zoning in conjunction with, as per section 699A2 of the town charter. Engineering Division, drainage exemption has been submitted. The town tree warden indicated, the town tree warden had a public hearing on 10/8/2020 regarding the removal of 6 trees in the town's right of way. Tree warden granted approval, removal subject to replanting of the trees at a 1:1.5 ratio. It's a total of 9 trees at a size of no less than a 2-inch caliber.
No, wait, we're gonna do, okay.
Yeah, we'll get to it. 2-inch caliber with the species to be determined at the discretion of the tree warden. HDC issued comments dated 12/1/20 requesting review of the project prior to commission action and concern on removal of trees. Okay, there we go. Therefore, motion to approve the site plan noting the following. I think we were talking about final landscape plans to be coordinated between DPW engineering, the tree warden's office, and I had notes here from our briefing yesterday for the ARC, or how do we want to state that?
Katie?
P&Z.
I think we heard P&Z. I think it's going to be
Okay.
P&Z.
Okay.
We can get ARC input if we so decide later, but I think we want to see that from P&Z. And I think we'd like to add, again, with without any language, that if there is the consideration, along with the consideration of streetscape improvements, and we'll figure out how that gets done later, but that we add that.
Okay. Commission request for a 2-to-1 replacement of trees at a minimum of 3-inch caliber.
And of course, if Mr. Costa Coe wants to throw in a few more trees, that's good too.
And the DPW's requested to save as many trees as possible.
Mm-hmm.
Go ahead.
And DPW to investigate whether there are any measures that could be taken to further preserve community character while retaining the traffic, all the desired traffic improvements. Does that cut it for you guys?
Yeah.
So you don't sacrifice the traffic improvement, but if you see anything along the way that will do better with community character, you'll grab it.
I think even just if you're not going to be, like for example, the islands at the bottom of Riversville, if one side's brick, make the other side brick, and make the middle brick if they can't be planted.
Mm-hmm.
That's a good example. So.
And you could even, yeah, okay. Yep.
Okay. Anything else did you want to add to this?
I can't think of anything. Does anybody want to add anything to this?
I just want to add that I was correct. The sidewalk in front of the Civic Center is a straight line. It does not jog. So either the drawing is incorrect, or there's something that has about the roadbed that they've changed, but it is absolutely straight. There is no jog in it, and it does not go along the street. It is, there's a green strip that separates, I don't know, it's maybe 5 feet wide or something, the sidewalk from the road. And my suggestion is that they maintain that and they don't change it. There's no reason to.
I thought Mr. Michael said they weren't planning on touching it.
He said that
it's drawn differently.
Okay, so why don't we just add to the motion
that we're not changing that sidewalk?
Why don't we just add to the motion that DPW has, and as represented by the Department of Public Works, the sidewalk in front will retain its present conformation. Okay.
Okay.
Okay. All righty. Do I have a second for that?
Second, as amended.
Mr. Fox has seconded. Mr. Levy, how do you vote?
Aye.
Mr. Hardman?
Aye.
Mr. Fox?
Aye.
Mr. McRae?
Aye.
Albin is also aye. And with that, congratulations, folks. And maybe you can connect with Katie and we can figure out a work plan for how we move forward in a good way as soon as can.
All right. Thank you very much.
Thank you so much.
It's now 9:05. How long a break do you guys want?
Break. We missed dinner.
Yes.
At 7:30, you promised.
Yes, I know. Having said that, how long a break do you guys want?
We won't have to stick around this commission much longer, Andy.
I know.
Is 10 minutes enough?
Fine.
Sure.
Okay, 9:15, maybe 9:16. I'm not sure. And Mr. Hardman is going to be recusing from the next item. So we'll see you when we see you. Highgate is next. You're going to recuse?
Yes, thank you.
Okay. And Mr. Yeski is seated for Mr. Hardman. Okay. Who's the next seated alternate if I don't find Dennis in the next minute?
Hey, Margarita.
Yeah.
Do you need some, I can be seated.
Oh, okay. Because Yeski's not answering his phone. But we can have an alternate sit as well.
Yeah, we've got a couple of potted plants hanging around.
Yeah, I mean, so you wanted to recuse, it's fine. And we'll let, who's next after Yeski? You need to unmute.
Patrick.
Oh, Patrick, you haven't made that mistake in like a month.
I know. I believe the next would be Goss.
Goss, do you mind being seated on Highgate?
Not at all.
Okie dokie. So with that, folks, Dave Hardman is going to recuse. I mean, you don't have to if you don't want to, but you had indicated that you would rather, so.
Yep.
Okay, so Mr. Hardman's going to recuse. He has a personal connection to the applicant and felt more comfortable recusing. So we'll text you when we're done. And Ms. Yeski's going to sit for him. This is item number 5.
I'm sorry, Mr. Albin.
Ms. Goss.
We should demote Dave momentarily.
Okay.
I mean, I know he's closed his video, but just to really cross the T's.
Okie dokie. All right. So Ms. Goss is going to sit, not Ms. Yeski. She isn't on.
Exactly.
Okay. So Ms. Goss, I know you didn't even, Victoria didn't even register that. 11 Highgate LLC for a final coastal site plan to remove the existing home and construct a new residence. Mr. Brower, if you would go ahead. This is folks, this is a must decide tonight, as it is currently listed. Mr. Brower, if you'd go ahead.
Sure, good evening. My name is Eric Brower on behalf of the applicant, and I read the staff report, attended the briefing session, and we've obviously been working back and forth with staff and the departments on the plan revisions to take care of some issues that were in our initial report project plan. And so I think things are pretty much in order here. If Patrick, can you put up the, I guess the first one was the 11 set presentation. And I'll go through this pretty quickly because I think, one, you're familiar with the project from what you've seen so far. Obviously, if you have any questions, we can stop and deal with them.
Bear with me, they're not in the, they're momentarily misplaced here. All right, well, while he's looking for that, just to summarize it, we have an existing residence that was built around 1940 on Highgate Road, which is a development of a number of roads down at the end of Indian Head Road in Riverside. And the the dwelling, when it was constructed originally, the situation over the years has changed quite a bit. Flood zone regulations have come into effect. The existing house is significantly non-conforming in terms of its existing elevation and did get significantly flooded during the Sandy event that we had. So its present condition is not compliant for zoning with respect to elevation. Perhaps of more concern is the existing septic system, which is located in the front yard. The grade in the front yard is around elevation 7. The septic system is below grade in that area, and the location of the leaching fields in elevation are such that the groundwater that moves back and forth with the influence of the tide actually interacts with the septic system. So it's a significantly undesirable situation from the environmental point of view. Also, part of the structure that's there today is located in a V zone. We have 3 zones on the property, an AE13, AE14, and VE16. So with the reconstruction, we're moving the house completely out of the V zone. It'll comply +1 foot with the minimum elevations for the AE14 zone. So it's fully flood zone compliant, complies in all other respects with the zoning regulations, FAR, height, stories, etc. When the house moved its location from current position to where we're now proposing it, the septic system also shifted in order to move that away from the V zone. So I think you have in your reports now the 2 different approvals from the health department. The original one that was based on keeping the same footprint, and then we went back to the health department to have them review our revised design, and Teresa Mead forwarded that. Okay, so if we stay on 3 for now, you can see the 3 different flood zones. The house first floor is marked at elevation 8.6 feet, and that's clearly well below the elevation 14. And the garage wing there you can see is in the VE16. So if we go to the next slide, under our proposed conditions, you see the house completely moved out of the V zone, and it's elevated as required to meet the flood zone regulations. Next slide. That one is a close-up. You can kind of see at of the grading and the septic that will be in the front yard, and that will be elevated up out of any groundwater influence from tidal action. Next slide. This is the proposed house from the front view. It appears with the fill envelope in the front to be not artificially elevated or on stilts, so we can achieve providing the required soil for the septic, provide an attractive front to the building, and then as we go around to the side and rear of the building, we maintain the existing grade. So on the right side view that you're looking at, you can see in red where we're keeping the entire space beneath the first floor is open with lattice panels, so floodwaters can come in and out. Go to the next one, please. And then that's the rear and other side view. So it's essentially a 1.5, 2-story home with the flood crawl space underneath. We can go, well, we want to look at 8. Next slide, please. That shows the basement view where everything is open there with all the flood venting.
You've added, so this is, you've added the flood, this is the new design with the flood vents for this. As
no, we had the flood vents on the main house before, but what was missing was on
the garage.
The garage.
Right.
So if we go to the next slide.
Okay.
That next slide has the garage. Now this is the original plan and does not show the, sorry.
Yeah, it said second floor, but that's okay. I mean, we saw that you submitted the revised plan for the garage.
Yep.
You have revised septic comments. I can't remember. I think we got them in yesterday. And that pretty much leaves you with just the open issues of the conservation comments.
Right. So if we go to the last page, which is our planting plan, and we had input from both Bill Rutherford as well as Matt Pop on the appropriateness of the plantings and the types of the plantings. And prior to the comments from conservation staff, we had actually proposed significant planting within what was a former tidal wetland area. Currently, you have the area where it's located, indicated as Phragmites, and that's an extensively dense stand of Phragmites that runs all the way behind the houses on this side of Highgate, from Indian Head down through this drainage corridor, and then eventually transitions into a very nice traditional salt marsh that has the cordgrass and the Spartina patens, which is a more traditional habitat. So this massive stand of Phragmites actually functions as a very good protective buffer to the wetlands of concern further down, but there was the remnants of this saltwater tidal marsh that had been converted to lawn over the years. So we had proposed planting in portions of it. There's about 24 plants that were shown to be high tide bush, which would be native and appropriate to that environment. Alex has suggested that we increase the planting within that former tidal wetland area, and we can definitely do that.
Yes, we'd like you to do that. To Alex's comments, first of all, she has a specific comment on how difficult it would be to, and possibly counterproductive, to eliminate or reduce the Phragmites. So I would expect that you're okay with that, with what she's got there. In addition, she asked that you restore that area that's lawned. We discussed that as well at the briefing yesterday. Right. If you would eliminate that, I can't remember what, we hadn't seen her recommendations yesterday when we discussed it, but it's the same thing. Would you be, really our first request was if you would be willing to eliminate the lawn that's below the tide line.
Well, it's not the tide line. It would be, there's a number of lines.
Patrick, can you zoom in? Because I can't read it there, and I've got conservation comments that went on the computer.
Okay.
It's this title. It's the title. It's this line right here.
Correct.
Okay.
So that's an area. Currently, the lawn runs all the way to, well, you see it says existing edge of lawn. So right now we have a condition that goes from lawn right to the edge of the Phragmites mass.
Right.
So she's suggesting we come up to the tidal wetland line with additional plantings, and then create, which we also agree with to contain the Phragmites, is that 5-foot moat strip that would be maintained so that they don't continue to encroach. So we would shift those plantings closer to the house, have the 5-foot moat strip, and then plant up to the tidal vegetation line you're looking at.
So you accept her comments. And the only one, Andy, I wanted to ask you something. She makes a comment about when they're regrading that they're gonna lose the topsoil. Don't people usually separate the topsoil out and keep it?
Yeah, we'll be doing that. For sure.
Yeah,
it's very expensive to
bury topsoil and then have to get
No, we weren't going to do that. So what you do is you scrape off, bulldoze, whatever, stockpile it, and we don't object to having a compost mixture mixed back into that pile when we regrade it. That makes sense. That's fine.
So based on you being amenable to the conservation comments, you've addressed the septic question, you've addressed the ZEO question, you have a drainage exemption, you have no outstanding staff and departmental comments. Does anybody from the commission wish to ask any questions or make any comments?
I just need to have clarification on the septic. I guess there was you were talking about something from Teresa Mead. I have something from October 27th.
No, there's something new that came in yesterday. Hold on. I think I have it. I can open it quickly. Revised septic, it's dated Monday, and I can send, it's 10/27 actually. No, that can't be right.
No, that was the, when she reviewed the revised, we wanted to make sure we had the septic fixed before we did finalize the plan. So her memo is October 27th, and she confirms that the plans dated 10/22 were approved. So that, that reflects the.
Oh, see, okay, so then it is October 27th, okay.
And then there was this condition on it that you have to be in the present footprint.
No, that was the original.
And then they took that out. Got it.
Correct.
Okay. All righty. So with that, you're set on the septic. And does anybody on the commission have any comments other than Nick? Okay. Does anybody in the public? Oh, Nick, you do.
No, I'm good. I think I'm good. I just we'll get to it later. And
anybody in the public wish to make a comment? No public comment. Mr. Brower, if you're done, I believe that we could close this item. Does anybody have any objection to closing this item? Would you please raise your hand? Andy, you moved your hand. That was a mistake. Okay. With that, we'll close this item. And Mr. McRae, could I please have a motion?
Yes. 11 Highgate LLC application PLPZ 2020-219 for final coastal site plan in the RA1 zone. Applicant is requesting approval of final coastal site plan application to construct a new single-family residence and associated terraces, driveways, patios, exterior mechanical systems, and stormwater management in the AE 13, 14, and VE 16 zones. The commission finds that engineering, the applicant has submitted a drainage exemption dated 10/28/20. Inland wetlands, applicant received a permit needs questionnaire indicating no action required. Conservation issued comments 9/16/20 with concerns about the pool location and fill in the VE zone.
No, there's a more recent set of conservation comments that's been than this one. The one we got yesterday.
I thought that was it.
No,
okay.
Hold on.
November 24th, 2020. That's the one I have.
November 24th. Yeah, you said October or September?
Yeah, so that's the date.
And the pool location's no longer an issue?
Right, it's been changed. Okay.
Okay.
Zoning issue comments dated 11/19/20 endorsing the application for a zoning permit with the inclusion of flood vents in the garage. Health issued a memo 10/27 indicating approval of the septic system. DEP issued comments 11/17/20 stating no comments concerning the proposed development. Therefore, a motion to approve the site plan noting the following. As required by the ZEO's office, the applicant has submitted revised drawings dated 11/25 by Charles Sitton Architects indicating required flood vents in the garage. The applicant shall increase the appropriate coastal plantings up to and along the tidal wetlands line and provide a 5-foot wide mow line to contain the Phragmites. The applicant shall address any outstanding staff or interdepartmental issues.
Yeah, I think those were her only really main comments that the applicant was going to address. He also got kudos for what he was doing with the landscaping. Do I have a second?
Second.
For this motion? Mr. Fox has seconded. Ms. Goss, how do you vote?
Aye.
Mr. McRae?
Aye.
Mr. Levy?
Aye.
Mr. Fox?
Aye.
And Albin is aye. Thank you very much, Mr. Brower. It's always a pleasure. And With that, we now open the public hearing, folks. And our first item on the public hearing, actually, if the applicant would just let us know if it's okay to combine the two items, 97 and 99 East Elm. Mr. Bristol, do you have any objection to us combining the items?
No objection. I'm starting my video.
Okay.
Is Mr. Yeski back?
There we go.
Yes, Mr. Yeski's here.
Because he was seated for me.
Yes, thank you for reminding me. This is the all alternate team, you guys, just as a reminder. Goss is seated for Levy. Yeski is seated for Fox, and Lowe is seated for Hardman. And thanks again, Andy, for the reminder. Okie doke. Mr. Bristol.
I'm fine if we can combine the two applications for the record. My name is
so this is 97 East Elm will be combined with 99 East Elm, and they are for final site plans and special permits. Okie doke.
Correct. And I just wanted to point out that in Greenwich, even the alternates are first string.
He never learns, does he?
Revisiting, we're on East Elm Street. As you all know, what we're proposing are there are two adjacent lots. We're proposing one two-family building on each on each property, one on 97, one on 99. I'm not going to go through the whole spiel for you.
No, actually, what has been troubling us today is it seems that you've got some unresolved issues on this application still. And this is a must close tonight, but you have issues that you have not resolved.
Well, I guess I wanted to go through a couple of those issues because
why don't you go to the issues you haven't resolved? That'd be great.
Yeah, so I guess originally what I saw as the biggest threshold issues were engineering, and we have DPW engineering comments back today even that were slightly revised from about a week ago. So I have comments dated 12/1, and I think you'll find that most of the stuff is addressed. In fact, all I think. First, the traffic. We did submit a site distance study and a stopping distance study, and DPW did agree that all the site distances are found to be adequate now. So that's good. Going down the engineering comments. The second one, obviously, the big issue that we were grappling with was this use of the 93s and 97 shared driveway, which is on the other side of the development. What we had proposed and what DPW seemed to be okay with was that we will stipulate on the record, and obviously accept as a condition of approval, that that the shared 93/97 driveway won't be used for vehicular access to the 97, 99 properties. There was mention of a legal document where we would give that up. I really think that's overcomplicating it. I think it's sort of exceeding the scope from a land use agency perspective. The obvious intent was to prevent vehicles on the 97, 99 development using that driveway shared with 93 for access to this property, which we're fine. Again, we're fine stipulating that we're not going to use that. Also, the geometry doesn't lend itself to using it for access into the middle of the courtyard anyway. Also, taking the recommendations from commission members from last time, we did show a low wall in the back of the carport that faces that shared driveway, that 93, 97 driveway, so that cars can't get through it. We were kicked around a few ideas. Originally, that carport was proposed to have lattice panel in the back, as well as planted plant screening. And I wonder if that was a little bit lost on the commission members as we went through it. We're talking about landscaping and buffering, etc. We actually thought that was a good idea to propose a lattice, a 50% open lattice panel in the rear of the carport. The 50% lattice obviously is so that the carport doesn't count toward FAR. So that is the genesis of not having a solid wall, complete wall behind the carport, as mentioned in the DPW comments. So what we did, again, to be clear, we proposed a lattice wall behind the carport as
we
well
said
as
no.
Screening. Sorry?
Yes, and we had said we wanted the knee wall.
Yeah, okay, yes. We did show a knee wall, by the way, just
right.
So that is there. But when we were talking about screening and buffering, I wanted to bring that up and mention that because I thought that was actually a good way to go about doing it, to have the layers of the lattice and the planting over in the
back. And what we said to you is the lattice, I think it was Nick that made this comment, and we said to you the lattice has a really bad habit of disappearing. And so that was why we went crazy about it. Was that what it was?
We could do both. Nick? I guess I even thought about doing both. Were there like a low wall?
I'm sorry, Mr. Bristol. I'm asking Mr. McRae a question.
Oh, I'm sorry.
I think actually the lattice that they have proposed, I think that in this case, understanding the closeness to that other driveway is actually going to be successful here. Okay. I think actually if Mr. LaRoe has an opportunity to bring up page 238 of our agenda, that particular drawing has a section that really explains the low wall, the planting as proposed, and the lattice. But in this case, actually from 93, it's preventing cars from getting in there. It's going to be a cut down on the lights, and it maintains actually kind of a physical enclosure that's actually code compliant for the FAR issues.
Exactly, and that's what we were thinking of, and that's why even if we want to put that atop the low wall, that's fine too. But I just thought that was a good mechanism, to accomplish both tasks, prevent access as well as the screen.
Right, Mr. LaRoe, lower right-hand corner of the lower right-hand section.
And there's a grade change.
Yeah, you can really see it there. There's the driveway, and then the arborvitae, I guess that's being proposed, section of the lattice, and then the grade change with the low wall. That low wall would actually, that drop would actually be no more than 18 inches, so then it doesn't constitute a wall itself. I think that actually works. That's probably the most successful way of doing this.
There were two issues that, and they're really your major salient issue pertains to the driveway. And this whole two questions, the abandoning of the use and this legal agreement that the neighbor still has issues with. Pat, would you mind summarizing everything that transpired today? Because I felt, I'm not seeing Pat, but I think we could take that down now, right?
Yeah.
Pat, would you mind summarizing the email traffic from today? Because it was a little bit.
Yes, so Madam Chair, so we received the comments from the engineering division based on the revisions from the applicant received on Monday. Their comments do indicate that the drainage component and the sightline distance still meets with the plans as proposed. Their requirements, there is two things I think of note that are in there. One is the use of the driveway, which I think you already explained, of the current driveway between 97 and 93. And the other one is the requirement that they put a wall in that that space that is the carport that separates the driveway or holds the grade up against the current driveway. So the applicant's plans seem to show that in section. I'm not sure if that was completely clear to the zoning enforcement officer and staff that has been addressed on the site plans, because I think the grading in that area is still a little ambiguous. If we and we can pull those up in a second. And going along with that, which is a third thing that is not on the engineering report that we got, is that the discussion that we had the last meeting was that there's a lot of ledge on this site and in this area along the shared driveway with 93, and how planting is going to be accomplished, one, in a strip that's this narrow, and two, with soil conditions possibly not being ideal. So I guess, I don't know if Madam Chair, if you want the applicant to address it, or how do you want to handle that? But
why don't we have the applicant address it? I know we're going to ask for the neighbor to comment too.
Okay, so again, just to be clear, what is proposed by the landscape plan? Again, we're maintaining the fence along the driveway, so that's there. And we from last time we did show some arborvitae, some plantings there, and we increased that amount. So we increased the area that was planted along with the fence that we're having between the fence and our side. In terms of soil conditions and ground and topography and stuff, I think Tony should be on, so maybe he can opine a little bit to the physical conditions of the property. I'm not sure if he was on, or he should be on. Oh, there he is. Well, maybe he can give you a bit more detail. I mean, the landscaping plan is relatively simple, given the area. I mean, if everyone's familiar with the area, so these type of developments are somewhat common in the area, and everyone is there's various styles and types of landscaping, but what we think is proposed is consistent with other screening type plantings and other landscape plans in the area. But yeah, maybe Tony can chime in onto the
I've asked Tony to unmute a few. There he goes.
Before, just so I can be direct with the question that we have, is the area of that carport on the side of 93 and 97, where there doesn't seem to be a footing or a wall height or anything in there on the plan. So I understand it shows up on the architecturals, but where is that on the site plan? And then again, if we could just talk about the soil conditions over there, if we know about it.
Okay, I can answer.
Look at you.
Okay, you're all set. I can answer the question in this way, that we show the carport elevation of 112.5, and adjacent to that area, you see that the elevations existing on the adjacent property are around 113.6. When you add the 18-inch high maximum height permitted knee wall on the back of the carport, you find that your elevation of 114 is right at the elevation of the driveway. So that prohibits any action or driveway access onto 93. So I think that's a moot issue. As far as landscaping in that area, the existing conditions and the site plan show that very artistic indication of a hedge. So that to me indicates that something has been growing there. That hedge was substantial, as I recall. So I don't think that we really have a problem in suggesting that we can grow something very small like the arborvitae root wall in that area. Also, test pit number 3 shows that we had a deep seam of gravel, sandy gravel on test pit number 3. So there is a seam of soil there that would support it. While there is ledge throughout the property, I was also surprised to find that we did find depths of soil and no sitting or stagnant groundwater. So I'm comfortable with our drainage design and the fact that we do have depth of soil in that area. I hope that answers the question.
Yeah, Mr. DeAndrea, where's that test pit number 9? I think there's
number 3. Number 3 happens to be in the middle of the property. When we dug those, we had other obstructions, but that just shows that seam of gravel. It's right in the middle of the courtyard. Along the north side, we show the hedge. I mean, on the west side, top of the page, we show the existing hedge that's there. And that was running right behind the dwelling that had existed.
Understood. Okay.
But I think the key, just to reiterate again, this issue of knee wall versus lattice, the knee wall that we refer to as permitted to be only 18 inches high. So that's what we built into the plan. So the 18 inches plus 112.5 makes 114. That makes it equal or slightly above the adjacent property. But we are lower, therefore no vehicle could mount that 18-inch high wall. So there's really no concern about access.
So so I think that's their response to the gravel or the soil condition. The question I have, and this is more of a probably for Mr. Bristol, is I don't know exactly how the commission has the authority to require you and your neighbor to extinguish a private agreement.
We don't.
I would think that the DPW, being the authorizing authority for the curb cut, would be the one to require that or mandate that. They have seemed to have walked back from that position in their current comments.
Yeah, we don't
So-
have the authority, and it's clear that it needs to be done.
So,
Well,
yeah.
I mean, if I can interject, I mean, if I may, I'm sorry. What happens all the time is we're happy with the condition that we won't use it, and physically we can't use it. What I can't allow my client to do is legally give up a right that we may need in the future. You know, so we have to comply with the site plan conditions. The physical topography and how it's going to be developed and the physical layout of the carport prevents access physically from its vehicular access anyway. And we may need to go and use that. Where are we? Oh, we may need to use the driveway as pointed out in engineering, to maintain the other side of our building, or, you know, for maintenance or construction or something like that. So legally, I can't let my client give up that right, but we're very happy to condition, like we place many other conditions on our site plans.
But I hear all those words that Mr. Bristol just said, Patrick, but DPW wants it in perpetuity that they give up their right. That's what they had asked for. I'm not asking you, Mr. Bristol, I'm asking Mr. LaRoe.
Yeah, I guess my larger question is, I don't know if we're going down the path of creating an illegal condition here, if we agree to put the conditions that DPW is asking for in a decision. So I don't know if Katie agrees or not, but I mean, I don't know exactly.
It's uncomfortable. Katie, what are your thoughts?
Yeah, I mean, first of all, it's a suggestion by DPW. It's not a we will move it forward or not. So I think Pat's absolutely right that it's not
something we can ask for,
can enforce or ask for. Right. Having said that, I do think Mr. Bristol's right also that if you wanted to put something as a condition of your decision, nothing to do with that easement agreement, but something that works in a site plan, it's just a very uncomfortable situation, Mr. Bristol, because the plans have been submitted as, you know, that we don't have plans showing this wall. So, I mean, I know Mr. DeAndrea just described it and explained it, but it's just an awkward thing in that we don't have the final plan.
Well, I mean, we're all very clear about what we're going to do with the low wall and everything else. I mean, I guess I just wanted to point out
the fact that we're
comments,
all okay. So we've been, Mr. Bristol, we've been down this road. I mean, most of the commission isn't new. In fact, nobody's new. And we've been down this road, and we've said, yeah, okay, I'll give you a break, Lo. And you know, this thing of, oh, we know what everybody's going to do, and we've all talked nice. You know, the problem is we don't have final. We don't have something in front of us that says what you're going to do. And we've also got a couple of open questions from the neighbors, but I would like to have something from you that's final.
I'm sorry, what do you mean by final? Like, what I wanted to point out is, if you look at the engineering comments, they're perfectly happy with conditions placed on the final site plan.
Right.
I mean, they literally say that. So, and that's what we're agreeing to. And literally the development. I mean,
okay.
We're not going to be able
Pat,
to
if you would go ahead.
an 18-inch curb.
I think you know what I'm trying to say.
I think what Madam Chair is saying is that the plans that came in on Monday, does the grade plane reflect the 18-inch wall around that area? And so are we assured that this building is going to be in the location it is post a decision and prior to construction? Because that's the concern that staff has when we're scrambling to review all the nits and nats. And like I said, it's not obvious to me looking at it right away, because we don't have the zoning enforcement officer's comments to look at the revised plans that came in and everything else, if it all comports. So I just want the commission to be aware that things may shift, you know, hopefully within the legal setbacks, or obviously within the legal setbacks. But if that's a possibility, I think we need to know it now, or the commission has the right to know it now, as opposed to be surprised later.
I mean, I don't disagree. I guess. I mean, maybe I'm being a little dense right now, but I mean, even if the grades are a little bit different, I guess what my point is that regardless of the elevation, let's say, of the driveway, of the 93-97 driveway, we can still put the 18-inch wall in regardless, even if it's, I mean, regardless of where it is. I mean, we could always have that very specifically incorporated in the plan.
Andy?
Was there.
Andy?
Yeah.
you want to make a contribution to this discussion on your
Out of
final
the
night?
darkness.
You know, again, unfortunately, as you said, we've been down this road. I don't understand why these issues weren't resolved before we have to make a decision.
Thank you. And
you know, why are we always made to bend over? What happened over the last 60 days that this couldn't have been cleaned up?
Okay.
I guess what are you giving up? I guess like how are you bending over? Like I don't.
Okie dokie.
So we
thank
have
you, Andy.
we have engineering. Engineering. The only thing that's really kind of bizarre about the engineering is their discussion of the rights to use the shared driveway of 9397.
You got it. That's what's weird.
It's slippery slope for us because this is basically between two parties.
Exactly.
It comes down to a situation. Would we be comfortable with just indicating a simple note on the site plan talking about use of? Well, I'm just saying use of for maintenance only because it's actually in.
But we can't.
In the engineering stuff.
It's in the engineering stuff, but we can't take away someone's right to use their property. Well, it has to be.
The only thing is that the reason engineering said that 97 cannot use the 93, 97 driveway was because the driveway between the two driveways weren't 50 feet apart.
Mm-hmm.
So that is, it's not a dispute between two different parties at that point. It's a planning and it's a DPW issue.
And that's why it has to be DPW has to, but that's exactly what you just said, Ms. Goss. It's got to be a DPW condition when they grant the curb cut. It can't be ours. I'll tell you what, guys, the neighbor is here, Mrs. Semenuk, and I know they sent in an email earlier today. Could we just turn real fast and get the public comment from them? And then if the commission has anything else to add.
Good evening. Can you see me? Can you hear me? Oh,
yeah, you're good.
I'm low. Well, that's fine. Okay, so as far as like the grade
no, Peter,
between, I am low. I'm still here. Whatever, it's late. The grade between the shared driveway, 93 driveway, and the actual structure is unclear. There's 2 feet of distance, but it appears as though the grade, well, what is the grade? Towards the rear of the house, between the house and the driveway, what's the grade next to the retaining wall?
So they're showing, Andrea, they're showing a top of wall at 118.
No. I'm not talking about the wall. I'm talking about if you move left to see where the 116.5 is.
Yes.
Okay, so that's the top. That's the driveway grade.
Right.
What is that? There's a little bit of 2 feet, right, where we're claiming we can plant things. The house and the driveway. There's 2 feet right there. What's the grade there?
It's the same as that. It's 116.9. I think is what the existing is under here.
No. No, it isn't because the proposed dwelling is at 113. The carport's at 112. So it's like a well in there.
Right. That's what they're showing is that your current driveway would be above the grade of their driveway on the other side of the.
Okay, so by like 4 feet. So we're talking a 4-foot hole there.
That's what.
So how are you going to plant things in there?
Not in the space between the house and the driveway. I'm talking about that space there is being maintained as current grade is. It's following the grading along your driveway right now.
So then it's gonna they show the house as wood shingles with windows there. So the grade, so 4 feet is just of dirt is just gonna sit up against the house.
No. The first floor will be lower, right? But so it'll be a basement type situation on that part.
I know, but they're showing the house as wood shingled on the outside.
Right.
So you're gonna have the dirt piled up against the outside of the house.
Well, that gets back to the question that we were asking before: is are all these plans matching right now?
And also, like, you know, they have their retaining wall is west of the structure, but on the plans, the landscape plan, which isn't a landscape plan because it's not done by a landscaper, they show the wall in a different place. If you can see the landscape plan, the wall is in line with the house.
I'm just trying to bring up the other plan here. Give me 1 second.
Okay.
This Madam Chair, this is the facade that's facing that direction. So this is the area.
You know, I'm going to come back, Mrs. Semenuk, excuse me for saying this, but we've got too many, I'm echoing what Andy said as well. We've got too many unresolved issues on this application. We've got a lot of confusion about this right now, and we've all agreed like nice people, but we don't have something that really shows what we're doing. In addition, the neighbor wanted some more time to consult on the agreement. And I realize that the agreement isn't relevant to us, but we're being asked to give them time because it hasn't been fully, we don't have something final in front of us. Mr. Bristol, stop me, commissioners, if you disagree with this.
I just wanted to, did Jody opine on the rear retaining wall? That's right next to the property line, and it's 6 feet high.
Yeah.
I didn't think
it's 4. I think it's 4 feet, Andy, but I'll bring it up.
No, it's tall. It's more.
5.5 feet high. Totally legal.
But he's not. Oh, he couldn't have opined on the wall that was at the DPW comments. That's the wall I thought that was being referred to.
Mr. Bristol, I'm gonna ask the commission to stop me if they disagree, but I would really, I think it would be wise on your part to convert this to preliminary.
Okay.
And finish doing what you need to do.
Can I ask just another question before you?
Yes, ma'am. What we're trying to do by converting it to a preliminary, he'd come back with everything straightened out.
I know, but there's a couple other issues.
Yes, ma'am. Go right ahead and we'll get everything lined out that needs to be addressed.
Okay, well, first of all, I just want to refer to the DPW comments about relinquishing rights to the driveway.
Yes.
Right? It's not just relinquishing the right to drive through the house and onto our driveway. It's relinquishing the right to use the driveway with vehicles.
Yes.
Okay, so the knee wall really is irrelevant to the whole discussion. Okay, so it's not about driving through. It's about driving on.
Oh, okay. Well,
right?
If they didn't have a reason to drive on it, one would expect that they wouldn't use it. I wouldn't expect.
We can't live with one would expect or a note on a plan. I mean, it's going to be sold and then we're going to have to fight everybody who thinks that they can use it because they have, because it's their property. And I can't.
Yes. And so what we're doing is by asking them to convert to preliminary, they will give us a final set of plans, and that will give you guys the opportunity to resolve these issues with them while we wait. So that's not something we can address with you.
Okay, can I just ask for a couple other things to be resolved?
Of course.
Well, then it just takes less time at the next meeting then, you know what I'm saying?
Yeah, no problem. Go right ahead.
So I understand now that there possibly isn't going to be a basement in 97. Can they clarify?
Mr. Bristol?
That's news to me. I don't know what. I mean, I'll have to look at the plans again. I mean, I thought there was, but okay.
Okay, so they'll clarify. They're going to come in with a final set of plans, and they're going to clarify. What else, Mrs. Semenuk?
Location of HVAC units.
Okay.
Snow stockpile. It really won't work, their little picture, for the snow that falls on our side. Where's it going to go?
Sorry, was that snow stockpile? Is that what you said?
Yeah.
Okay, thank you.
Okay.
Mrs. Semenuk, where does it go now?
On our side. And I don't know where you put yours. Where do you put it?
They don't know. They don't live there.
Right. So last one is the pedestrian bypass plan. you have a pedestrian that would rip up our driveway and our sidewalk area. Is that necessary when the DPW requirements say that there has to be continued access to the sidewalk?
I don't know what Mrs. Semenuk is referring to.
What drawing are you finding that on, Mrs. Semenuk?
There is a bypass.
Pedestrian bypass.
Is there a little number on the drawing?
Okay, Mrs. Semenuk, is that, are you, the pedestrian bypass, is that in a note in engineering? Is that where you're getting that from?
Well, there's a plan.
There's a plan. There's a plan, and then.
What plan is that we're looking at getting that from?
It's Mr. McRae, it's the current set. It's drawing number 7 of the one that was submitted on Monday.
This is Mr. DeAndrea's drawing?
Yeah, RVDI, yeah, thank you.
And you said it was drawing number 7?
Yes, it's labeled pedestrian access plan. Bypass.
And it's drawing number 7. Hold on one second.
Okay. Hopefully the applicant has no intention.
Okay, I got it now.
Okay.
As part of putting in the curb cuts, the Town of Greenwich Highway Division requires to have a pedestrian bypass, so you have safe access around the curb cut construction area. So that actually would be put back, so the actual, when it's finished and done, the sidewalks are in,
No, I understand
that would be removed.
It's just temporary.
No, but you're going to put gravel across the paved driveway and through a planted area?
And then
when we did the pedestrian bypass, we just did it at the crosswalks. And also, don't the DPW comments say that the sidewalk needs to be accessed throughout the construction?
And it would be. That's what the pedestrian bypass is.
Madam Chairman, I answer some of these questions that are outrageously inaccurate.
Mr. DeAndrea, if you're going to answer questions, I would certainly not begin by making judgments on the public speaker.
There was no judgment intended. The fact
outrageously inaccurate is a judgment. So I would request that you be courteous.
Okay, I will be courteous.
Thank you.
The fact is that the neighbor is suggesting things that are just not accurate, and that's a fact. The bypass plan is something that the engineering department requires. In fact, they will not let us use a sidewalk across the street. In spite of
Mr. DeAndrea, Mr. McRae just said the exact same thing.
Okay, so
to which the neighbor responded that where that line is crossing right now, she has a planted area, and since her driveway is a bit earlier than that, why not tear down all her plantings?
Because the engineering department doesn't recognize all the time the sequence of construction. There is a grass strip that we are showing can be utilized while we are replacing the existing sidewalk.
Okay, so why don't you revise this on the plans as well so that it doesn't interfere?
I'm not going to revise it because it would not be consistent with the demands of the highway department and the engineering department. Practically speaking, we work around this. It's not a problem, but we are required to show that it is possible to maintain a safe route around the construction, which only takes a matter of hours.
All right.
We have to graphically indicate it.
Okay, we've understood you.
Okay.
All right.
Another question about the wall heights.
I want you to just submit what it's going to look like. I'm tired of being told, I'm sorry, but I'm just tired of being told, see, this is what we're going to do, and then we're going to send you a plan that looks like it. Mrs. Semenuk, do you have any other questions?
Nope.
Okay. I mean, you're asking us to imagine what it's all going to look like. I trust you, Mr. DeAndrea, but I'd like to see a site plan.
I appreciate the trust, but all of the information you've asked for is on the plan. And quite honestly, I would not be changing it because all the information that you asked for is here, if you would like me to explain it.
Mr. Bristol has agreed to convert to preliminary. Mrs. Semenuk, do you have any more questions?
No, thanks.
Okay. So Mr. Bristol, you're going to convert to a preliminary. And we could then, at the end of our meeting tonight, we could move these preliminaries forward to final.
Correct.
Mr. Bristol, something to address when you come back is, can you have the landscape plan?
Well, you're going to put it in the, you're going to put it in your resolution.
Yeah, I was going to, yeah.
You don't need to ask him for anything. We're just going to move on. We're just going to put it in the resolution and we're going to move him to final and we're going to tell him everything we want.
Okay.
Done. Cooked.
Okay. Anything else?
No.
Yeah.
Okay. So as soon as we have the paperwork, we will. Oh, how do you do that? Can you fax it or something?
No, we can just take the testimony here.
Okay.
Right,
so
Katie,
in that event, does anybody object to closing the preliminary? No. Okay. So the preliminary has been closed.
Thank you.
Thank you, Mr. Bristol.
Thank you.
Thank you, Mr. DeAndrea. Our next application is Terry A. Tatar with a final coastal site plan and special permit at 0 Oak Street West. And who, I just hope it's not Mr. Bristol right now. Don't know how happy he is with us.
I believe it's Mr. O'Donnell.
Oh, that's right. I did know that. I'm not seeing him though.
I just moved him into
okay.
Panelist.
Good evening, Madam Chair, members of the commission.
Hello, Mr. O'Donnell.
Mr. Luca.
Are those books real, Mr. O'Donnell? Sorry.
I was just referencing one during Mr. Bristol's performance. Okay. I know you guys are exhausted. I'm very grateful. One, just happy to see you. And two, pleased for your attention tonight. Is there, may I start, or is there any point of order?
No, please go ahead, Mr. O'Donnell.
So just as a practical matter, to prep you for my presentation, which I will make succinct, despite my tendencies, this is practically for us a nearly must decide tonight. The applicant is a contract purchaser. The applicant has exhausted all extensions and all contingencies up until your next meeting. So you will not meet again before the contract expires. So we would be grateful if you feel that you have adequate information after my presentation, that you would close this and make a decision on this application. Well, thank you for that consideration. I'll give you the very short form, and then if you'd like, then you can ask me some questions and I can chat just a little bit about the special permit requirements.
I'm sorry. You said it's, oh no, he's only exhausted for his contract to purchase.
That's
for
correct.
us, this is only a must open in January.
That's correct.
Okay, thank you. Okay, go ahead.
Okay, it's R6 zone. This is coastal site plan and special permit. Coastal site plan is due to the proximity of the Byram River. I've submitted a relatively detailed coastal site plan application. I'll state broadly that it's consistent with the regulations, located more than 450 feet from a coastal resource, uses low impact engineering design. It's outside of the coastal high hazard area, and it's consistent with the relevant policies in the Coastal Management Act. Does the commission have any questions in regard to consistency with coastal overlay zone requirements? Okay, thank you. Okay, so short version is we understand the site, and I attended the briefing. I appreciated your comments. So the overall topography of the site is consistent with, it looks the same. I look back at the aerial photos to 1934, and this knoll has kind of always existed. And in that photo, the house at 11, the 3-family as pictured, was there at that time. So this knoll has been there for a long time, and we know that it goes from up at New Lebanon School sort of down to the Byram River. So that sloping topography is consistent overall, as well as on Oak Street West. The other thing that I thought was relevant was the general character of Oak Street West. Patrick, I did prepare some presentation materials. I have them here. I don't know if you can put them up. I'll keep talking while we consider that opportunity. So Oak Street West is comprised of 13 properties, 6 of which are on the north end of the street are industrial and commercial uses. There's a 6-unit, a 6-apartment, multi-unit apartment building. There's 2 3-families, 2 2-families, and 2 single-family residences that front. And the general feel of the neighborhood, which I have prepared in the map, is that this property at the north end of Oak Street West, you have high intensity industrial commercial. And then as you move south down Oak Street West, then the intensity starts to abate. And that's a healthy approach to nodal development, is where you have higher density and higher intensity uses, you want to phase out of those as you move to lower density. So a 2-family at this location would provide a natural transition from the higher density and intensity uses at the north end of Oak Street that is consistent with the overall pattern of development throughout Byram and on Oak Street, moving to lower intensity and density development.
We were pretty familiar with the neighborhood, and we recognize that it does have a very similar development pattern. Our key concern, you heard us, is what you need to do to the geology of this site in order to build this property, to build this 2-family. That's the biggest concern we have. We're not clear how we're concerned about the drainage. We're concerned about you getting that garage in. We know that you're within the regulations. There is a special permit concern, not around the community character issue, but just around what you're doing with the natural features of the site and the fact that this is just a piece of rock, this site. And that's the problem with it.
I think one of the other issues is that we're at the end of a very narrow street.
Mm-hmm.
To remove the ledge is going to be significant construction. I think one of the things we were talking about yesterday was a real construction phasing plan,
mm-hmm.
how this is going to be done so it won't affect the neighbors and the street.
The person, to Nick's point, it was the resident at 12 Barium, and we looked at their driveway. You saw that we looked at their driveway access, and that resident is concerned about how he's going to access his driveway. And looking at the way it's laid out, the person has every reason in the world. Go ahead, Nick, sorry.
Mr. O'Donnell, you actually talked about doing research on the property and noticing that this ledge is, in your research, nobody's ever developed this property going way back. I think that's indicative of the issue here, and I think actually even our site plan standards. This has been a rock. Nobody's wanted to blast this. Nobody's wanted to change it because of how difficult it was. So we're just leaving it. And I think actually if we're looking at this, it's interesting over the course of years, if somebody really wanted to do this, they would have done it by now. But it's grown into the environment and to the neighborhood is that here it is. This is open space. It's a geological formation that has been there for millennia. So I'm actually really concerned. Actually, as you start to remove this ledge and take so much of it out of here, you're going to actually probably have to remove a lot more than you anticipate, just even to get the building in. It shows us there's retaining walls. The corner of the building is embedded in ledge. And I'm just wondering, has the property owner understood the amount of ledge that has to be put in there? And have they actually done any research as to going about trying to remove all this ledge?
Excellent, thank you. So let me address the ledge
Great
removal
questions,
first.
Nick.
Yeah, always articulate, Mr. McBride. Thank you.
Don't butter him up.
If you review the review the drainage report closely, and I did after the briefing, I spoke to the applicant about this. But to draw it back to the materials we've submitted, I won't make you dig through it. But if you look at the borings for the test holes, numbers 5, 1, and 4, you'll find that to the depth of the equipment they had on site's reach, which was 6.3 feet, that they were reaching soil at every case. So when they did the test borings, when they were initially evaluating the engineering for the site, which was really the first step in this process, in fact, before I was a part of the project, they made this design to accommodate the subterranean ledge profile to minimize the ledge removal on the site and to make it work well. So again, when you look at that report and you see that the machine they had only reached just over 6 feet deep, and in the corners of the foundation, that's where they were able to achieve those depths. Now, every site in Greenwich, not every, many, the majority, maybe, sites in Greenwich have ledge. This is something that we're with in front of you every day. We're experts on blasting, on rock chipping. You guys can tell me your personal experiences with it. It's common. We've dealt with this problem before in this town. We know that the fire marshal closely regulates it, that chemical blasting, the traditional blasting is a very refined process today. And those decisions on how that ledge removal occurs starts when the actual site operations begin. And it's a judgment call based on whether or not there's fissures in the rock that respond to mechanical means, or whether a more intense mechanical mean like blasting is appropriate for the site. So again, we've actually researched and considered the subterranean ledge profile. They are educated about it. This is something that we've gone through before with a number of projects in Greenwich. We've gone through it with other homes and as infill development. And believe it or not, there's still plenty of raw land in this town. We're seeing right now a massive boom where spec building is getting exciting. And so we're seeing raw sites that have never been developed before get developed. So the fact that this happens to be a site that is going to be developed in 2020, ideally, rather than 1930, I think is exciting, because you, the town, the Plan of Conservation and Development will have an opportunity to influence what that development looks like if it's two-family development. Do you have other concerns on ledge or ledge removal? And by the way, the site has a minimum of retaining walls. I mean, this is really capturing and using the natural topography. I thought I was pleased to bring something with so few retaining walls.
I'm confused on that statement. I see one on either side of the driveway. I see one in the back for retaining walls. I'm also seeing that the test pits here. You're saying 6.5 feet. What I'm seeing is that it's both sides of the house, but not the back corners of the house.
Yes, DH1. But I acknowledge that the ledge does come into play.
Okay, it would only seem to me think actually some of this actually you won't even need a retaining wall, because you're going to be, you're going to be in the middle of the rock, and there's your retaining wall.
A natural retaining wall.
Exactly, Mr. Lowe.
Yeah, if an engineer can sign off on it that it's stabilized, then you're right. It won't be necessary. When I talk about retaining walls, the walls on this site, I'm looking at it, the driveway elevation, I see is 77.4, and looking for an adjacent elevation. So you're right. We have one potential retaining wall that's 85 point. No, that's an existing. I guess they really look like low walls to me, as best I can tell. Less than 3 feet, it looks like. 80 on the southwest corner to 77.4. I think it's more managing the water on the site and making practical accommodations for automobiles than what we've seen in the past.
Okay. Now, speaking of parking, you have 2 in and 1 out in each one of the each side.
That's correct.
Okay, and the 1 out is actually behind the garage door, or is it tucked away? How does that work?
The 1 out is going to be, if you have, well, I apologize for.
Patrick, why don't we toss up the plans?
So the 1 out are parallel here.
It's hard for us to see that, Mr. O'Donnell.
Yeah, I appreciate it.
Thanks anyway. Mr. O'Donnell, while Patrick is doing that, Andy, by the way, I don't know if you were still at the briefing. Did you see that? I just put up the topo. Did you see that? Hold on.
Mr. LaRoe, page 523 of our
And
agenda is the
Andy,
best plan.
did you see what this is what the site looks like? I don't know if you got a chance to walk it. Andy?
Andy's on mute.
Unmute,
Yeah,
Andy.
I'll buy it.
All right. Okay, you drove by it. Okay, so this is what we're discussing. And Mr. O'Donnell, the reason that we have expressed this concern to you is we appreciate that your law degree has given you great expertise in blowing rock, but we approved an application had a very similar plan on a very large scale, on a larger scale than yours. And the plan was not able to be constructed basically because the bedrock impeded it. And that was a pretty large and experienced builder. So this has left us with a concern when people need to completely change the geology. Okay. Oh, look at that. You can kick me out, huh, Pat?
Hey, like that.
It's the only power I have.
Again, the site is not completely changing the geology. It's designed to work around the existing geology of the site. So we have the ledge. We're working with it. We can't. I mean, you could leave it completely undeveloped.
Okay, but I think what we're going to end up. I think where I'm leaning is something about, somebody jump in if you disagree, but if you encounter problems with this application, if we were to move it forward, we would anticipate you not revise the site plan in any way without coming back to us, and not do administrative review for any change you make.
That's well, yes, without a doubt. And I think that's what the regulations state.
Well, there's certain things that Katie and Pat could approve. But in this case, I look at this rock, these two chunks of rock, and okay, all right, go ahead. Patrick, Nick was asking you about the parking, and we need to go on with that.
If you could zoom in to, yeah, that one right there. Just zoom in right there, yeah. So, Mr. O'Donnell, there's two inside and one outside. And the one outside is right behind the garage door?
Actually, the way we've conceived it is that they're on those outside layers, the sort of those hammerheads are the parking places. So
okay. I had anticipated that they were the backouts, but those are the two parking spaces. Okay, that makes much more sense to me. Thank you. So I guess we've got zoning.
Yeah, there's no issue regulation wise. It's whether we feel that the change in the natural environment is significant enough to rise to 617D. And we have this alternative that if the applicant has to revise it, they're going to be back before us.
Don't forget, we revised 17D5.
Yes.
So, okay. So phasing plan would be a good idea too, right?
The phasing plan, absolutely.
Okay.
I did consult with DPW Highway and engineering, and I asked about that. I said, what would you look for? What would satisfy you? And their response was, we have regulations. We don't need a phasing plan for this site. There's
well,
been
we
a
do.
lot of.
We're going to ask you for it, okay?
I appreciate. Thank you.
Sorry, I don't mean to be sharp, but you heard. You've got a neighbor who's got a concern, and I just
there are a lot of 5,000 and 7,000 square foot lots in this town, and they have all been, not all, but the vast majority developed without phasing plans. Highway has regulations. You cannot shut a road down. You cannot close access off to the site. That's not permitted. We'll have the police and DPW long before planning and zoning gets there.
Yeah, maybe, but what we're asking you for, well, I think, you know what, is Quentin Ball 12 barium? Let's find out. Pat, you keep bumping me. Mr. Ball, if you would go ahead. I'm going to go to public comment now because I think we need to incorporate the.
Thank you. It's actually Ms. Ball.
Okay, I'm good with that.
And thank you so much for, it says start your video. Here we go. Hi, I'm Quentin Ball. My husband, Brett.
Hi.
So we live in that greenhouse at 12 Berrien Place. And I can't say enough that I think you articulated our concerns even better than we could. I think they kind of fall into two main buckets. One has to do with, Ms. Albin, you referred to the geology of the site, that we have concerns about all the blasts and whatnot. We didn't see any sort of plan for monitoring our foundation, any sort of pre-construction or post.
Ma'am, yeah.
Yep, we had submitted a letter to O'Donnell, but didn't hear back or see any of our concerns met in any of the plans. So one of them had to do with the pre and post-construction foundation review. The other one is really safety for our family. We have 2 little kids, and as you can see, that's the driveway that we take to get to our house. And so the concerns have to do with, the construction vehicles coming in and out. And then the second thing is that to date, at every step in the process, anytime they've come to do anything, they've blocked our driveway. So I have a photo here, which I don't know if it's easy enough to share, but 3 days before I was supposed to give birth to my husband, good Lord, it's late at night, to my son, they put that driveway in there, and it has a huge excavator that was blocking the way. And I was like, I might give birth. I don't know, like I might have to leave. And so they said, we'll just move the vehicles. So anytime we've had anyone come look at the site, when they did this, the survey a couple weeks ago, the sewage last week, they blocked the driveway, and we asked them, if we have to leave. And they said, we'll move when we want to move, kind of thing. So anyway, we just have massive concerns that, like, if there's a big construction project, are we going to be able to get in and out? And then our kids going to be safe in our area? Thank you.
Thank you very much, Ms. Ball, and I'm sorry I called you Mr.
Oh no, it happens all the time.
Okay. I think if you can address the neighbor comments, Mr. O'Donnell, that would be sufficient. When Nick McRae asked you for a full phasing plan, I think we would be satisfied if your construction vehicles don't keep the neighbors out of their own house. And if you consider some way, I'm thinking almost during the day you put up a temporary construction fence across, you work with them so that if one of their kids runs out, that their kids can't run out. And there's got to be something. People put up those things you can move, and maybe the Balls should just buy one of those things, but it would be nice of your client to do it for them, because if one of those kids runs out, they're going to get hurt.
I think that the point about the logistics plan is, if you can't do your surveying and investigations without blocking the street, there's an issue.
Exactly.
And so, quite frankly, with all due respect, you got to show us how you can actually get access to the site without impacting the public. And unfortunately, your track record over the last 3 weeks hasn't made it. This is, small vehicles. I mean, I think the phasing plan is, where do you create access for the equipment, the trucks, and where do the workers park, and without blocking everyday traffic? And so
you know, why do you think that isn't a requirement?
Okay, so I just want to start. I
Prove
appreciate
to us that you can do this. The street is narrow. Where are your contractors going to park? They can't park on the site because it isn't accessible at this point. So the concern that you're hearing is a true concern to us. Not that we're trying to challenge your ability to develop, but you've got to develop the property in concert with the neighborhood. And you haven't proven that you can do that. I mean, what's your plan and where are your people going to park?
So let me ask you a question, Andy. It seems there's only one neighbor beyond this lot. Couple we just heard from. Is it possible just to reach an agreement with them to almost provide a shuttle service back and forth so that anytime they need to get to and fro, that they're accommodated?
Well, I think you have, that's one issue. The issue is also emergency access, fire department.
Gentlemen, I apologize if I may interrupt you. Those are good thoughts. They are thoughtful.
Just do it.
Practical
Just
thinking.
do it. It's what we've been saying to you. Just do it. Don't give us, I'm sorry. I was gonna get short with you and say basically what Andy said much more politely, which is don't tell us that you're not going to do it because you don't have to or something. There's a danger here. Andy's absolutely right. If these people have a medical emergency, he's on the board of GEMS, so he should know.
The site isn't going to be blocked. The plans include a construction phasing plan already that shows stockpiling, development, infill development. This is common in this town. The average size of the lot in this neighborhood is 6,000 to 7,000 square feet. The residential, it's 62. So we have,
Casey, we're not challenging your right to develop.
Exactly.
What we're saying is
that on all 6,000 square foot lots, that we're going to require construction phasing plans.
Come on, no, Andy, this is a practical matter. This is entirely a practical matter. About
gentlemen, I agree.
You're going to provide access to the neighbor.
If you look at the photographs that I submitted to you, you'll see that my car is parked on the site in the corner. I had no difficulty. I drive a sedan getting on and off the site. I certainly appreciate that the Balls may have experienced some interaction with people visiting the site. That's possible. Okay, it doesn't appear to be generated from my clients.
Mr. O'Donnell, wait, Mr. O'Donnell. This is a special permit. We are telling you that to keep the neighborhood safe, we would like to see how you're going to protect that neighbor's driveway access. We are not asking for every single project in the R6 to have a phasing plan. We are taking this specific. I've put up what it looks like, what your street looks like. We've put it up 3 times. We are dealing with a very specific example. Done. We're asking you to do this.
And I think we can do it as a condition of
absolutely
as be submitted when you submit for zoning.
Katie, you look like you want to say something.
Yeah, I was just going to say, I mean, to your point, Ms. Albans, it doesn't need to be a negotiation.
We're done.
Yeah, but having said that, we have run into this before in the coastal area where there has been a required oversight from staff, and I would ask that you not do that.
No, not going to do that. We're going to have the Quentins, the Balls, not the Quentins.
Yeah, other than your basic stuff prior to construction and getting the plan in order and whatnot. That's all I mean by that comment.
Yes, yeah. And we're expecting Mr. and Mrs. Ball they will contact staff if there's a problem, but you can't materially adversely affect the adjacent areas located within the closest proximity, okay? And we're telling you right now that you need to address that question that we're asking you. Now, we're skipping the land being preserved. We're saying, yeah, okay, go ahead, develop this. But we also take you again on 617, not adversely affect safety in the streets, okay? We are trying to keep these neighbors safe, and we're asking you to give us something that documents that you are not going to block their access. Full stop. It's consistent with our regulations. It's not a negotiation, as Katie said. Okay.
And we do
with
it on
that,
a lot of projects with narrow roads, and it isn't, we aren't singling you out.
no, we're not. And we don't then require that every single CAM application have some sort of logistics plan for how they're going to keep the neighbors safe. We do it on a case-by-case basis, which is what 617 lets us do on a special permit. Okay, does anybody else on the commission have any questions or comments? No. Okay, with that, I believe we could close this with the conditions that we've discussed. Does anybody, if anybody objects to closing it, would you kindly raise your hand? God, I thought Nick was going to object because he didn't want to make any resolutions. Okie doke. So we will now close this item. Thank you very much, Mr. O'Donnell.
Thank you, Madam Chair. Thank you, members of the commission.
Nice to see you.
Well, it was, you know.
Oh,
Just remember, if when we're quoting our regulations, it's not a negotiation, okay? Thank you. All righty, thank you very much. And now, what you thought would never happen. Our last one of the night. Lower Cross LLC for a final site plan and special permit at 70 Lower Cross Road, reminding everybody that this was approved. When was it approved originally, Nick?
June? June of 2020, June 2nd.
They are now adding a 3-car garage, and they are back in because they have added 20,000 square feet. And with that, Mr. Holsworth, I guess you're presenting for the applicant?
Yes, I am. All right, thank you. Good evening. For the record, my name is Brett Holsworth. I'm a civil engineer with Redness and Mead. In the May meeting this year, it was approved for the excessive volume special permit 2020-00050. So we are expanding the increase by 20,000 cubic feet for a 3-car garage. All other elements of the project are staying the same. We received sign off from wetlands for this revision. We have DPW approval for the drainage and the site work design. We have health department sign off because the bedroom count has not changed. So there's no impact to the approved septic systems. The guest house and the pool house aren't changing from what was approved, and I'll get to the pool house in just a second. There was a question about the boardwalks through the wetlands that were brought up in the discussion. That was part of the original approval, and wetlands is okay with having them. And then another insignificant change is that the forest buffer around this whole property, you know, there's wetlands and forest around the development area. The limited disturbance is not changing with this expansion. It was previously designed as a manicured lawn, wasn't forest, so we're not cutting additional trees in response to this revision. One specific comment I'd like to just bring up is the ZEO's comment regarding the pool house it not being in the rear yard.
I think we're kind of, I think I finally agreed with what I was told. I'm still feeling like they drew me the little red lines at the briefing and I bought in. Patrick, you want to throw up the little thing with the red lines? And then we'll be done with that one.
Yeah, I could walk you through it real quick if you.
No,
have
I think I grasped it. I think
yeah.
Mr. LaRoe got me. Mr. LaRoe and Mr. McRae got me to grasp it.
It's unfortunately not in the presentation materials, but it was in the.
Oh, Mr. Holsworth. Jeez.
I'm so sorry. It's late. But I can.
A lot of time to prepare.
Well,
Andy, you're on a roll tonight. If you can't find it quickly, I think, Patrick, we can just tell Mr. Holsworth that we believe him, that it's in the side yard.
The gist is, you know, the property line is slightly askew from the alignment of the main house. And when you go, you know, however many 100 feet, you kind of lose that angle of the angles. But if you do draw a line from parallel to the front line, you bring it all the way back to the corner of the screened porch, you'll find that the new location of the pool house is completely in behind that. So therefore it's considered in the rear yard. So yeah, there were two exhibits you were looking at. One was the previous location of the pool house, which was in dated the April plan. And then the October plan, which you're looking at right now, is the revised one.
Okay.
So one other quick mention discussion was one of the setbacks wasn't indicated on our zoning chart for the rear setback of the pool. That number is 252 feet. So, you know, clearly.
Just made it.
Just made it, right. And then lastly, I'll bring up the conservation comments that we received from Alexandra Mock.
Oh yeah, thank you.
So she mentioned in her first comment that the approved project eliminates forest area by the Babcock Preserve watershed. But
she's happy. She says the new landscape envelope had created a forest edge, which is important in preservation of this large ecosystem. So it seems like as long as you do that forest edge, she's a happy camper.
Yeah, I mean, I guess I always read her comments as pessimistic, but
well, that's the. I think she tries to do that.
But yeah, we're not changing the forest buffer. We're not increasing any limit of disturbance. So yeah, if that's your interpretation, I'm totally cool with that too.
It says once established, the forest edge is often characterized by more diverse and abundant wildlife communities. Blah blah. I think she's pleased with as long as you keep it.
Sure. Okay. That's totally fine. And then her comment number 2 relates to the increase in impervious coverage and the using up more green space. To that, I have to say, you know, we still comply with the green area regulations.
Yep.
And increase in impervious coverage, we mitigated with the drainage, which DPW satisfied. And she brought up that the garage cuts off access to the rear yard. And, you know, the plan is kind of, it's a large scale plan, but if you look at it, there's still a 15-foot strip of lawn to get around the garage for, you know, whatever vehicles they need for lawn mowers.
I think if you put it another way, I think what she's really saying to you is, you were at a 0.03 FAR on 10 acres in a zone where that is normally a 4-acre zone and where you could go to 0.06. So you basically needed 10 acres to make this house work within the FAR. And that is disturbing to a conservation person.
Right. Well, I mean, it is a 10-acre site. It's
a 10-acre site, and you are within the regulations. We understand that. Yeah. And you've got a significant wetland, but it is still startling to a conservation person that you need that much land in order to meet your FAR. You're using 2.5 times. Wow. So that's how I read her comment, and I've got to say that I understand it.
Thank you for the tax base.
Yep. Thank you for the tax base.
Right.
And I don't think we should address her comments on the watershed because you have addressed all that through wetlands.
Yeah.
Right. Yeah.
Okay.
Wetlands was totally fine
Yeah.
with this modification. We submitted them. We got a response. So, you know, we went through the whole original application with wetlands, and they had some comments back and forth, and we made adjustments. And then with this garage addition, there was practically no impacts, further impacts to the wetland.
I do not believe that you have any other outstanding questions at this time from staff. Does anybody on the commission have any questions or comments?
Just a real quick one, Mr. Holsworth. In the briefing package, we have a colored rendering showing where the pool is as revised. Who actually created that drawing?
That came from William Kenny and Associates.
Great, thank you very much.
Okie doke. So with that, nobody else on the commission has any questions. Do I have any comments from the public? No. Well, we got a few people still here. We got 3 people, 2 people. Okay. So if anybody has any objection to closing this item at this time, please raise your hand or flap it. Okay, so we will close this item then. And with that, we have now ended the public hearing. And we've got a couple of decisions to make. We're gonna do something about 97 and 99 East Elm. That preliminary was closed, and so we can decide whether or not to move it to final. And then we have 0 Oak Street in this application. So Mr. McRae, whatever you want to do.
Let's go backwards. We'll start with
Okay.
70 Lower Cross application PLPZ 2020-314, final site plan special permit RA4 zone. Applicants requesting final site plan special permit to amend previous approval PLPZ 2020-50 to construct an addition containing a new 3-vehicle garage, the volume of which would exceed 150,000 cubic feet, requiring special permit. Commission finds that zoning issue comments dated 11/19/20 endorsing the application for zoning permit with revisions. Engineering has issued comments dated 11/19/20 stating the application is approved for a zoning permit. Health Department issued comments dated 11/18 indicating previous septic approvals on the site. Wetlands issued a memo dated 11/25 stating no issues with the proposal. And Conservation issued comments dated 11/24/20 noting exception with the additional increase in the size of the already large residence. Therefore, a motion to approve the site plan special permit with the following conditions or following comments. The applicant has confirmed location of the previously permitted pool house on a hand sketch dated 5/27 by William Kenny Associates. The applicant shall abide by any and all requirements of the conditions stated in the 6/02/20 site plan approval, and the applicant shall address any and all outstanding staff or interdepartmental issues.
Second.
Okie doke. Do I have well, I've got a second. Mr. McRae, how do you vote?
Aye. Aye.
Hardman?
Aye.
Fox?
Aye.
Levy?
Aye.
And Albin is aye. It's really scary when the boxes move because then I can't find people. Whenever you're ready, Mr. McRae.
Okay, what do we do? Oak Street, bear with me on this, please. Let me see where I am. Okay, so this is 0 Oak Street, final coastal site plan special permit, PLP 2020-205. Zoning has issued comments that's okay for your zoning permit with sections that's dated 11/20 2020. Engineering was at a resubmittal prior to zoning permit that was dated 11/24/20. Sewer division issued comments with no issues dated 9/16/20. Conservation issued comments on 3/24 that it was pleased with the development. The applicant shall provide a construction phasing plan to indicate location of construction vehicles and storage of construction materials. There shall be no change to the proposal without bringing it back to the zoning commission. And applicants to resolve any and all outstanding staff or interdepartmental issues.
Who's going to review that logistics plan?
I thought they would review it at staff when they submit for zoning sign off.
Yeah.
I think the two biggest issues is where's everybody park? And where are they actually storing construction materials? It would seem to me short of if they actually have a load of lumber or whatever, where is it being put on the site prior to being installed in the building?
I mean, I guess that the key thing is just wanting to know that they've thought of everything.
Yes.
That's really, I think, what's driving this, and the safety of the kids next door and whatnot. Obviously, we're not construction managers, so we're not reviewing it from that standpoint.
I think actually that part of the decision, but actually just to understand, actually, if they're going to have to blast, the requirements for blasting by the blasting company are significant for their insurance, and they would be conducting a pre and post inspection of anything.
Per the fire department regulations, which is pre and post blast surveys, notice to the neighbors to give them time to do it.
I mean, we've had situations in the past where we said no parking on site because the road was narrow and that kind of thing.
No parking on the road.
Right. Well, not on the road, but we've had situations where they didn't want a lot of the construction vehicles there because there was barely any room at all on this particular site, Andy. So it became a big problem because the people have the tools in their vehicles and that kind of thing. So you need to have your construction vehicle on the property. So it's just, like I said, it's just a matter of them thinking it through and managing it.
Yeah, I think that again, that the key component is they have to main access to the neighbor 24/7, 365. And that's, for safety purposes. And it means, they can't have the concrete trucks backed up in the street 3 deep and all that stuff. It's going to be a challenge.
Yeah.
So, okay, well, see what it looks like when you get it, Katie.
Yeah.
If you're not comfortable, Katie,
well, just send it back.
Kick it back up to us.
Yeah. Yeah.
That's exactly what yeah. I mean, because we did say that they can't make any changes whatsoever. Oh shoot, I forgot to ask. They are going to take down that wire fence in the end, right? Because they have it on all the development plans. Forget it. Okay, don't worry about it. Okay, Nick, you're done with the motion, right?
Yes, I am.
So it's prior to permit. Okay, does I have a second?
Second.
Andy or Dave? I'm not sure.
My last one.
Oh, you could do the next one.
No, I wasn't seated on that.
Oh.
Okay, so we're going to let Andy have the second.
Give it to Andy.
Mr. McRae, how do you vote?
Aye.
Hardman?
Aye.
Fox?
Aye.
Levy?
Aye.
And Albin is also aye. Okay, one more. You've got the
We still have discussion items, by the way, just so we don't.
No, we're pretending we're not seeing the discussion items.
Okay, so
I'm not hearing you.
we're for 97.
We're gonna do the preliminary, and can he do one motion and then say what I just said? There's only one difference, as I remember, between the two. Can Nick do one motion and then repeat the motion?
I think we've done that before with that,
Nobody
which
said
is a minor
no.
difference.
Okay.
Okay.
So if you would
So
go
actually,
ahead,
what
Mr.
we've got
McRae.
9799 East Elm Street application PLPZ.
No, just say you have to. No, you have to make one motion for 99.
Okay. 97. Start with that.
Okay, you can be
East Elm Street PLPZ 2020-87 final site plan special permit. R6 zone. Applicants requesting preliminary site plan approval for permit construction of new two-family residence with attached garages, carport, outdoor parking space, and shared driveway with retaining walls. Commission finds that zoning had issued comments 9/15/20 endorsing the application with revisions. Engineering issued comments 12/1 indicating resubmittal prior to zoning permit. Sewer Division issued comments dated 06/9/20 indicating no issues to be addressed during P&Z phase. Wetlands issued a permit needs questionnaire on 8/19, stating no issues with the proposal, and Conservation issued comments dated 6/8/20 noting issues to be addressed. Their motion to approve preliminary site plan special permit, the following conditions. As recommended by Conservation, there's a 1-to-1 tree replacement should be implemented using native species, and a soil and erosion plan should be submitted, as well as a construction phasing plan showing contractor parking. As required by the ZEO, proposed decks along the shared lot line shall not project into the side yard setbacks. Okay.
I think in moving it to final, what you really only need to do is to address what we want to see when it comes back.
Okay.
And not worry about the conditions for the final and what we would ask for in the final. So
converted. So we're looking for a revised accurate landscape plan showing specifically showing conditions along the common line between 93 and 97. Confirmation about basement or not. Let's see, what else did we have?
Nick, can I add to your list or just double check?
Absolutely. No, just absolutely. Go ahead, please.
So, do we want to say something about the working out the agreement or coming to some sort of accord with the private agreement?
How do we phrase that in a way that's within our mandate? Can you guys tell us? Because I was struggling. I was keeping my mouth shut because I didn't know. The issues raised by DPW regarding the use of the current shared driveway in future shall be addressed. How about that?
Yeah, because I think it's use, and that covers vehicular access or not, and being able to access the driveway for maintenance of that side of the building of 97.
I'm wondering if shall should be out of there. I don't know, Katie, can it say something to the effect of that the two parties should at least have a conversation so that they can report back to us? I mean, I don't know. What's the comfort level on that?
I mean, yeah, that's a tough one. Because it's not, it's not really, you can't have the neighbor hold the development of this project hostage, so to speak. Not saying that they would do that, but
no, but that's exactly my point.
Yeah.
So
you also tell the applicant that he has to enter into give away his property rights either.
No, so I think all we say is fully address the DPW comments regarding, we have to put it back onto DPW because it's who approves the curb cut. Is the only way we could do this.
Yeah, that's probably a better way to say it, is that they need to address all the conditions DPW has required for their curb cut, and then not say specifics, but okay.
Okay, so actually they need to address all the comments, address all the comments of the 1201 memo.
Okay. That's probably the best way to say it.
In the meantime, you guys go back to DPW and have the conversation with them about, we can't require this. It's your requirement on the curb cut. So before it comes in for final, DPW spell it right out what needs to happen.
Right. Sorry.
Now,
so Nick,
the walls and stuff, Pat.
The wall, I had two other things. Well, the other thing that was brought up by the neighbor was snow stockpiling. I don't know if that's something that the commission wants to enter into or not. Then I had architectural elevations to match the site plans, because I do think that's a fair point that they brought up, that the grade climbs higher than the clapboard or the shingling on the facade. So how is that true?
Okay, you know? I think it's actually, so it what's kind of deceiving on those rear elevations, or that side elevation, is that the grade goes across. In reality, what's going to happen is that the line that's on the drawing is the baseline of the driveway, and then at a minimum 9 inches above that is where the clapboard would start. So they just need to revise it to show that it meets code and that it's above the driveway elevation at that point.
Right. And then the other one was HVAC unit locations.
That's a good question. I don't remember seeing them.
They're not.
Yeah, they're not there.
I went through it when Mrs. Semelchuk was summing up, because I thought I saw them, but it wasn't. They're not on the site plan.
Okay, so he needs to address that if they're on the site. They actually could be on the roof too. I don't remember.
Well, that's fair. I mean, I'm not saying that they're not considered.
I don't think they have enough flat roof, Nick. Remember, they have all those lines. Let's just ask them to specify. Let's not try to solve the problem. Just specify where it is, and then it complies with the regulations, that they are fully compliant with all regulations about the setbacks and the noise ordinance.
Great.
And the you did the grade and the wall stuff, and we're done.
I believe so, yes.
Okay. Now, do I have are you done, Nick?
Yes, I am.
Do I have a second?
I second.
Mr. Hardman has seconded.
Except he's not seated.
Oh, you're not seated. That's right. This is the all alternate team. Lowe has seconded. Thank you very much, Patrick. Ms. Goss, how do you vote?
Aye.
McRae.
Aye.
Lowe.
Aye.
And Yeski.
Aye.
And Albin is also aye.
And no action on the special permit.
No action on the special permit. Now, for 99, we can leave all that other stuff out.
Okay, so 99 will actually be final site plans, preliminary site plan special permit.
No special permit. No action on. This is just moving. You're just gonna. Yeah.
99 East Elm. Okay. Patrick, to make this easy, that it's actually the same, except for any mention of grade change from 93 to 97, and any mention of curb cut between 93 and 97.
Gotcha.
All of the letters had addressed, and all the comments had addressed both 97 and 99 at the same time, except for a mention of the comment line between 93 and 97.
Thank you.
Okay. And that's it.
It just let's talk about the ARC meeting schedule some other time. And the only thing on the budget, Katie, is a couple of people asked if we have any idea how much money we saved. Wait, I didn't get a second and a vote on that. Did I?
Well, nope. I'm sorry. I just copied it from the prior one. I apologize.
Yeah. So, okay. So you're good. Let's just do a vote anyway. That was Lowe who seconded.
Oh, Lowe.
Yes.
And now we'll take the vote. Goss.
Aye.
McRae.
Aye.
Lowe.
Aye.
Yeski.
Aye.
Albin. Aye. Yes, it's always good to do a real vote.
I agree. Thank you.
Now, Katie, we could talk about the ARC schedule next time. I don't think it's urgent, but could I, there's one thing that everybody kept asking about the budget is how much money we actually think we saved being virtual in total.
Oh, I can find that out for you.
Because I think it's a handy thing to be able to refer to.
Yeah, I'll definitely find that out for you. Just based on the legal ads and the transcript, what we spent last year during these months, I'll just transpose it into this year.
And the delivery dude?
And the delivery dude, yep.
And paper.
And the reproduction costs.
Yep.
Because we aren't reproducing anything. So Xeroxing is like, just assume that it's, whatever you had done by the print shop downstairs is basically all gone.
Yeah. Yeah. Board of Ed, but same thing. Yeah.
Anything that's the biggest pieces. What?
How much was that a year?
We're going to find out.
Yeah.
We're going to compare what it costs to be, because we think there's a huge we know there's a huge savings, but we think we should quantify it because we're pushing to stay virtual.
Oh, by the way, just so you know, I am having Mark call court reporters because the court reporter that we used went out of business. That was court reporting. So ZBA is they have a fellow, so we're checking in with him because honestly, I don't want to stay with the Zoom transcription. It's just not up to par.
It's hysterical.
So starting January, I mean, obviously we've got the recordings as we need, but starting January, I'm going to have a court reporter either take the recordings and then transcribe or attend the meetings. I'm getting the price on both of those.
Well, actually, the court reporter usually did the recording while we were live. So
yes, right. So we would
that might be really efficient.
Right. So one option would be, yeah, exactly, would be to just give them the recording or
it's terrible. The transcription, the automatic transcription is hysterical. There's one where Lauren Rabin says Lauren Rabin votes yes. And it comes out, we are voting, we are wearing Maven boots, something bizarre like that. I mean, you have no idea what they're saying. And then Jill Oberlander says something and it makes absolutely no sense. So it would be better to have a real transcript. Okay, you guys, Andy, once again, thank you for the 7 years.
Andy, thank you so much.
And we've got to.
Bon voyage.
We obviously have to make it to drinks at the appropriate time when we can.
How about
and this time maybe you won't have to pay for it.
Right.
But the problem is we're never done by 9:30 now, so there's no place to get a drink.
Yeah, exactly.
Well, we could tell. You know, we could tell Katie to just have less applications.
It would be 2:16 in the morning. We were in town hall, by the way.
Doesn't make me feel better.
No, Katie's been telling me that all night. You know what time it would be if we had started at 7? And I'm like, neither here nor there. I'm getting grumpier with each one.
But Andy, very sad to see you go, Andy. I'm just.
Yeah, you've been tremendous, Andy.
Well.
Had to see you go for sure.
Unfortunately, I'm getting pulled in too many different directions.
Well, you're always welcome to participate on one of our exciting task forces.
Oh, I said I would do that.
Yeah, okay. I'm just glad you're not reneging.
We'll send you the short list tomorrow morning.
And if you would like to do the one on how much cut and fill people can do, we're happy. You can do that one by yourself.
I don't want to do that. I hate cut and fills.
No. Glenville Streetscape. That's his. That's.
Oh no, I don't do colors and textures either.
I'm afraid to even ask any of the people on ARC right now. I don't know how. But Peter Levy's volunteered already for that one.
Yeah.
There you go. Done.
He said he wasn't happy.
Are we not voting on the budget? Is that all?
Actually, we were gonna. Do you have to have it tonight? Can you wait till the next meeting?
Yeah, but I'd rather have it tonight.
Okay.
Just for pursuing it, and then
could I have?
Right. I mean.
Yeah. Could I have a motion on the budget? Okay, Andy just moved.
There is a second.
I second.
Okay, McRae seconded. He beat you, Hardman. I'm going to ask for a voice vote. McRae, how do you vote?
Aye.
Hardman?
Aye.
Levy?
Aye.
Fox, this is your last vote. And Albin is aye. But we're going to share with you how much money we saved this year.
That would be
And
great.
then Margarita, is there an issue with the schedule, or I
was being lazy.
No, that's not what I was suggesting. I just want to make sure that there's nothing we need to follow up or get back with you.
No, there's one meeting that we changed so that they'll be out of sync with us. And you might just want to ask them, I can't remember what meeting it is. You might just want to ask them if they want to revise so that they're back in sync with us, but it's their call.
Yeah, I think we're on the same night, one night is what it is. So
yeah.
Why are we approving it?
Because they're our board.
They're advisory to us.
Oh, we should add more meetings to them. They should be doing more.
We tried that.
Oh, they did do more.
They did, and then they
have this crazy system where they give themselves a night off every 3 months. It's crazy.
It's communism is what it is. It's
only
ridiculous.
Architects would have figured out something so screwy.
Oh boy.
All right, you guys.
Okay, good night.
Bye, Andy.
Take care, Andy. Thank you.
We know you're going to miss us.
Bye.
Bye.
Thanks again, Andy.
Thank you, Andy.
Andy's gone.
He couldn't run fast enough.
Good night, everybody.